declare open this hearing of the Senate Community Affairs Legislation Committee's inquiry into the Social Security Administration Amendment Repeal of the Cashless Debit Card and Other Measures Bill 2022. I begin by acknowledging the traditional custodians on the land on which we meet today and pay my respects on behalf of the committee to elders past and present. I extend that respect to Aboriginal and Torres Strait Islanders who may be participating in the committee today. The committee will be conducting today's hearing via video conference and in person. My name is Senator Marielle Smith. Today I'm the chair of the committee and I am joined today by Senators Rice, Price, Pratt and Askew. These are public proceedings being audio streamed live via the Parliament's website and a Hansard transcript is being made. I remind all witnesses that in giving evidence to the committee, they are protected by parliamentary privilege. It is unlawful for anyone to threaten or disadvantage a witness on account of evidence given to a committee, and such action may be treated by the Senate as a contempt. It is also a contempt to give false or misleading evidence. Witnesses also have a right to request to be heard in camera. If a witness objects to answering a question, they should state the ground upon which the objection is made, and the committee will determine whether it will insist on an answer having regard to the ground which is claimed. If the committee determines to insist on an answer, a witness may request that the answer be given in camera. I remind committee members and witnesses who are appearing via video conference who are not speaking to mute their microphones. I do want to note at this point that our committee is conducting this hearing into the bill specifically around the cashless debit card, and there are separate consultations being undertaken by the Honourable Amanda Rishworth MP and the Assistant Minister for Social Services, the Honourable Justine Elliott MP. The committee acknowledges that many witnesses will appear before both the committee and participate in these other consultations, and we thank those witnesses for their time and for participating in both processes. I now would like to welcome Professor Matthew Gray, Dr Rob Gray PSM, and via video conference, Associate Professor Elise Klein OAM. I understand that information on parliamentary privilege and the protection of witnesses given evidence to Senate committees has been provided to you. For the Hansard record, I'd ask each of you to state your full names and the capacity in which you appear today.
Matthew Gray, Director of the ANU Centre for Social Research and Methods.
Rob Bray, Research Fellow, ANU Centre for Social Research Methods.
And Associate Professor Elise Klein at the Crawford School of Public Policy at the Australian National University.
Wonderful. I'd like to invite each of you to make a short opening statement if you wish, and then I'll be passing to different senators to ask questions.
Do you want to go first, Elise?
Okay, thanks, I will. Thank you for the opportunity to come before you today. I want to acknowledge the unceded lands in which we're all meeting on and acknowledge elders past, present and emerging. I've been examining broad-based compulsory income management in Australia since 2015, including leading peer-reviewed qualitative research examining the cashless debit card in the East Kimberley. This research was invited by community organisations when the CDC was due to be rolled out in 2016. Drawing on this research and other peer-reviewed studies, I've written about issues of broad-based compulsory income management, including how it makes money management harder, divides communities, depoliticises structural disadvantage, and links in with other punitive policies such as CDP to disempower and disadvantage those structurally unemployed. My research has been published in leading international peer-reviewed journals. It is one of the many studies that continue to provide critical insights into the failures of broad-based compulsory income management. Let me be clear. Research shows that broad-based compulsory income management is a failure. We knew that in 2014, and it hasn't changed since, despite millions of dollars spent by previous governments trying to show otherwise. In the interest of time, I just want to highlight two specific points which I think are relevant given the prior evidence presented in the hearings before this one. First, I support the government's attempt to abolish the CDC in the current bill, but submit that they extend their work to abolish all forms of broad-based compulsory income management, including the Basics card. I can see how a voluntary card that is opt-in at the individual level could work for those wanting to continue with income management. However, this needs to be complemented by accessible, culturally appropriate support services. This new opt-in card may incorporate some of the functionalities of the CDC, but when it comes to the design of this new opt-in card at the individual level, it can neither be the basics card nor the cashless debit card. This is because these are not just products, technologies, or pieces of plastic. Both have intricate and detailed social lives that surround them. The white card, in-due card, going back to the ration days, intervention, are all common terms linked to these pieces of plastic and signal the broad social and political mess that have developed around these technologies. The CDC and Basics card are also artefacts of failed government logics and policy framings, which puts the emphasis on individual behaviour being the root cause of disadvantage, rather than structural issues such as there just not being enough jobs for everyone, and not everyone who receives social security can have a job. Also, that assumes people receiving social security, alcoholics or have drug problems or cannot manage their finances, and that addiction can be treated through a blunt, punitive instrument rather than holistic professional support and health services. All three logics have been disproven through peer-reviewed research and community best practice. What comes next must break with this approach. It must include a theory of change, framings and engagement that speaks to and supports not only the evidence, but what folks who are using these technologies want. Not to do so would be to overlook foundational principles of good policy design. And second, on what comes next, it must be developed in real collaboration with Aboriginal controlled organisations and traditional owner groups. There must be care for and real regard for sovereignty. There also must be options on the table for programs beyond income management. We must remember that broad-based compulsory income management was never community designed. These ideas came from the Northern Territory Emergency Response and Andrew Forrest's Aboriginal Employment and Training Review. All options need to be on the table with what comes next, including funding Aboriginal controlled organisations and services sustainably, as well as supporting other models that deal with structural disadvantage. Community consultation should not mean the wholesale inclusion of anyone wanting a say at the community level. This is because community deployed in these debates is not without hierarchy and relations of power. Time and care are needed in what comes next. And precedence should be with Aboriginal controlled organisations and those impacted by these tools. Whilst this has all been worked out, all people on compulsory income management, broad-based compulsory income management, should be given the choice to opt out of their current program and can then opt in when the new program is available. And finally, I will say that the level of disdain for people on social security, as we have seen through the CDC and Basics card, needs to stop. Reducing people to understand their realities far better than most, and what is needed needs to be taken seriously, and people should not be infantilised through policy based on racist and classist opinions. If the government is serious about not leaving these people behind, having respect for agency of people at the centre of these debates should be held up as a way forward. Thank you.
Okay. So should I go now? Thank you.
Yes, please proceed. Yep.
Yeah, thank you. I'd like to acknowledge the traditional owners and pay my respects to elders past, present and emerging. So thank you for the opportunity to be here today. I'm making a joint statement with my colleague, Dr. Rob Bray. As introduction, we're both academics from the ANU Centre for Social Research and Methods with backgrounds in public policy, the interface between economic, social policy and evaluation. We have both had extensive experience in program evaluation and were part of the team commissioned to prepare input to the independent review of the Australian Public Service, the THODI review on evaluation of the public service. We support the proposal to repeal the cashless debit card. Our basis for this is that the evidence shows that the policy has not been successful. We state this based upon a review of the range of evaluations and studies of the program and our own findings in the evaluation of new income management in the Northern Territory. In doing so, we acknowledge that there are various views about the program, from external commentators and from participants. Our view is, however, that this and other policies need to be judged on the hard evidence about their effectiveness. The Auditor-General's two reports detail details many of the limitations of the evaluations which were commissioned by the Department of Social Services of the cashless debit card, and that these did not provide an evidentiary base for the program's extension and expansion. We also note that the Auditor General quotes the conclusion of the separate and yet unreleased cost-benefit analysis that, and I quote, "The core conclusion that the benefits of the CDC are outweighed by the costs appears to be robust." From our experience, we know that evaluations of this type of program are complex and challenging. We can expand further if the committee wishes on our concerns about the evaluations, but we would note specifically the quantitative element of the research was not longitudinal, had no baseline data, and relied upon retrospective behavioural questions. Our published research on new income management shows that this type of question performs very poorly. There was heavy reliance upon qualitative responses, but little attention to the actual interests of those making the comments or attempting to reconcile with the quantitative data. The evaluation largely failed to use independent real measures of outcomes. The only data reported was on crime, where the evidence pointed to no impact or potentially worsening outcomes, but this was brushed aside in the conclusions. This latter is a serious failure, as the fundamental role of these types of programs is to influence outcomes, and this type of data provides solid evidence of outcomes. We note in this regard some other studies have looked at this data with respect to the cashless debit card. In particular, work by Greenacre and colleagues published in 2020 looked at actual gambling revenues, police apprehensions under the Public Intoxication Act, and crime and hospitalisation rates in the Ceduna region, and found no impact. It also undertook a detailed analysis of actual sales in a community store. This found that while at that store food sales increased, discretionary or unhealthy food sales increased more than non-discretionary healthy food sales. We further note that this type of data was critical in our evaluation of new income management in the Northern Territory in its own right, and to allow us to test and understand the results of surveys and qualitative data. It is also data we have continued to monitor. This brings me to the two final points we'd like to make in our introduction. Firstly, the failure of justification for this program also extends to other forms of compulsory income management, and we consider that attention needs to be given to these, in particular in the Northern Territory, where compulsory income management, introduced in 1997, for what Minister Brough described as an initial period of 12 months during the stabilisation phase, remains 15 years later, notwithstanding the absence of any evidence of it having a positive impact. Secondly, there is a clear need for these types of initiatives to be evidence-based policy and for rigorous evaluation of policies and programs. As well documented by the Auditor General and others, the evaluation of the cashless debit card was significantly limited, including by poor commissioning and design. This, we emphasise, is a much larger challenge, but one which needs to be addressed, including committees such as this, in ensuring that evaluation strategies are properly built into and resourced in new and existing programs, and that these results should be made public. In turn, public servants, ministers and others should be routinely expected to provide the evidence that their policies and programs are effective in meeting their goals. Thank you.
Thank you very much. I'm going to pass to Senator Rice first, and then I have some questions as well.
Thanks, Chair, and thanks, Associate Professor Klein, Professor Gray here. Professor Klein, I wanted to thank you very much for your evidence today. It was really clear and really succinct as to the problems that we've been facing with compulsory income management. And I wanted to go to your point of there needing to be time and care taken as to what comes next, and that the concerns of getting rid of the cashless debit card and the fact that we've got the basics card still existing in the Northern Territory. And so the difficulties then, however, of unscrambling the egg, given the complexity, the timelines that we're on. I'm just interested in your thoughts of, given that time and care is needed as to what comes next. You said that people should be given the option to opt out of the current program and then opt in when the new program is available after all that time and care has been spent. Just what would you see in broad terms of that timeline and that process looking like?
Thanks very much, Senator. I mean, I think for those on broad-based compulsory income management, the focus should be now in helping communicate them to opt out, what options are available to move off either the basics or the cashless debit card. I'm worried about people being left behind, and what we saw with the rollout in the East Kimberley Safe for the cashless debit card was just the complete lack of communication and people not knowing what was going on and people being confused and hearing one thing and not the next, and really, getting caught up in this rollout, this poorly rolled out intervention. And so I'd hate to see that again. And so I think, and I think this speaks to a lot of evidence that's already been given to the committee, is that communication and working with Aboriginal controlled organisations, community controlled organisations to help people make sense of what's happening is really important. So given that there's a short period of time, I think that's where the focus needs to be. And then also through developing with what comes next, this voluntary opt-in at the individual level technology, then the same kind of approach needs to happen to help people understand what is available to them. And if it's income management, if it's a voluntary income management that they want to go with, well, fine. But the communication has to be key. And it's not something that we've seen so far.
Thank you. With that sort of working out what comes next and a new tool, which, as you said, can't be either of the basics card or the cashless debit card because of the culture around them. I'm interested to know your thoughts on income management as per the Cape York model, where you've got the communities, the Family Responsibility Commission deciding as part of a other suite of tools and engagement that compulsory income management for particular individuals is appropriate. Whether you've done any research or have any understanding or what evaluation has been done of the value of that type of income management.
I mean, I haven't done research in the Cape, but my understanding of the research that has been done is it's very hard to disentangle the supportive role of the commissioners with the tool of income management. So it's very hard to say, oh, it's compulsory income management that's working there versus the whole holistic support that the program offers people. I'll also say that there's been an extraordinary amount of government goodwill but also support around that particular program over a period of time, and which I think has also helped. I also say that with the cashless debit card, one thing that we did see was early on in Ceduna and East Kimberley was the empowerment of sort of almost like community controlled committees that worked out if people could have their amounts reduced, amount quarantine reduced. So they were being able to review huge amounts of private information of individuals on the cashless debit card. And it was really a failure. And in the end, people didn't continue to put their submissions forward to try and get their amounts reduced because it wasn't, they didn't know who was looking at their information. They didn't know, there was no accountability looking at what was happening. So, I mean, that's a very, very different model to what you kind of see in the Cape. And so just to say, I'm just making the point that the sort of community, the use of the word community gets used, and I kind of think a bit abused in these debates about who the community is and how these processes work. That's why I'm really pushing for an individual opt-in method because, I think the detail, I think that we've seen with the cashless debit card, the use of community being extremely disempowering for folks that have been on the cashless debit card. So
basically that method, if you were going to have a method like that, it would have to be very much a self-determined methodology that was worked out with the community so that there was trust in who was going to be making those types of decisions.
Yeah, but I think, I think the work in the Cape has been very significant and very specific. And what we saw with the trials of these Kimberley and Ceduna was nothing like that. And I think it just goes to show how terrible these processes of community control in those committees can go. And I think the evaluations picked up these points also.
Thank you. Thank you. Professor Gray and
Could I just add on the Cape York? Because Cape York is a very, very specific model, and it's so much more than income management. I think the figures last time I looked at was around 10% of cases which actually go to the Family Relationships Commission actually are subject to income management. So it's just one of a large number of tools actually used there. The evaluative material I've seen coming out of it says that it really is difficult to work out the balance of the contribution of the different elements, but the general impression is that the supportive activities, the actual discussions with the Family Relationships Commission are at least as important as any of the very specific actions which flow out of those decisions. So it is a very distinct, a very embedded model, and a lot of the evaluations haven't found a really big impact overall, but to the extent the community believes there is some value in it, I think there's a case for a continuation of some sort of model while this is still supported by the community, and the processes do give us some indication of some of the things we should perhaps be learning from. And that's the identification of people who have a specific problem and then trying to work with those people to find out what's the best solution to those problems, how best to help them individually rather than the mass imposition of policies.
thank you. And certainly the evidence presented to us was that it was a tool that was used pretty much as the last tool in the armoury, to use a horrible violent analogy, and very much that it was only a small number of people, that there was at any one time about 100 people, and another very significant difference was it was time limited as well. So it was only for a period of a number of months usually that they were on income management. I wanted to go to overall evaluation, and Professor Gray, you talked about the problems of evaluation and the problems with the way that the evaluations were done, which we certainly have heard plenty of evidence of, and we're talking to the ANAO later today as well of their assessment of all of the evaluations. It would have been possible to have evaluated these programs, cashless debit cards, better.
Yes.
If there had been the political will to do so. Given the problems that you were just saying, like in the Cape, of how difficult it is to untangle the measures if you've got a suite of measures going on.
Yes, so I mean, in technical terms, it's quite possible to have done a much more. It would have been quite possible to do much more sophisticated, balanced evaluations, which would have done a much better job of identifying what impacts, negative or positive or no impact, that the cashless debit cards had. In some ways, the evaluation we did in the Northern Territory, which in some ways is more difficult because this was a policy that applied to all areas of the Northern Territory and at the same time as there were many other policies trying to achieve the similar outcomes. Because the cashless debit card was implemented in a smaller number of communities spread across different areas in Australia, it would be easy. It should be even more robust in terms of comparison of the cashless debit card communities to other similar communities. Also collecting proper longitudinal information and making much more effective use of the administrative data, and some of the evaluations that have been done, including the work of Stephanie Schur and Deborah Cobb-Clark around the Northern Territory Emergency Response Income Management, show how you can use existing administrative data, and some of the work done by, I think, Greenacre and colleagues as well is another example of how you can use large-scale administrative data sets to try and look at the impacts of these policies, combined with detailed field work on the ground using different methodologies and from a wide range of stakeholders. And in fact, you can tell, I think, from some of the published reports about that it wasn't working. So even though they were claimed to be showing certain impacts, even those reports alone on their own actually can, if there's sort of a careful examination of the data in those reports, it does show the cashless debit card is not achieving the outcomes claimed. Rob, did you want to?
Yes, look, I'll add 2 points there. The first one is the problem of disentangling. And that can be a really serious problem, and it really depends very much upon the nature of the data that you're looking at and your understanding of the program. So some data collection where you're specifically targeting the people who are participating in the program, you're looking at their outcomes and changes in their specific outcomes over time, and you're also identifying what particular programs are impacting upon them and comparing those with other populations. You can very frequently isolate specific aspects. Similarly, with work such as Greenacre and others, and some of our own work in Northern Territory stores, allow you to actually directly relate the outcomes to the very specific instruments which are being used. In other cases, it is much more difficult. And for example, in the work I've done in following up from the evaluation on looking at the big outcomes in the Northern Territory, have there been changes in the level of crime? No specific ones. Alcohol, the only changes appeared to be to do with some of the more specific activities in the Northern Territory. Infant mortality has not improved. School attendance has not improved. In fact, it's got worse. And going through all of these broadest social indicators for the Territory really not only says that income management has failed, but so have the whole raft of policies which were actually implemented at the time of the intervention. So in that case, you can't disentangle, but you can say the broad approach there was a failure.
Thank you. I'm interested in your it's almost advice, I suppose, given your expertise in evaluation, as to how you deal with communities who, given the absence of good evaluation, still some people feeling, but there's been a reduction of crime, and the streets are safer and things are better.
I don't want to dismiss individuals in communities' lived experience, but we do know that people's sense or impression may not be representative of the community as a whole, and that's where you need to have external, independent sources of information which enable you to make an assessment about whether that is in fact correct. And also, these policies can sometimes have very varied impacts, heterogeneous impacts. So for some people, and I think Elise talked a little bit about this, they may find that the tool of income management or the cashless debit card style, way of restricting expenditure might be a helpful tool for them. For others, it doesn't. And it's about it's important to have other sources of evidence. And of course, you will find, I think, that within communities there's often very varied and often contradictory opinions on something. Rob?
Yes, I'd add a couple of points there. The first one is that in a number of these cases, and I'd emphasise those points already made, in a number of these cases we actually do have the objective data which does allow us to make some of the comparisons and determine whether or not those reports are always correct. And that data was, for example, available for the University of Adelaide study. If you go to the data, you discover that they've actually reported that there were an increase in crime levels in the East Kimberley region. I think the Goldfields, there was no significant change, although there was an increase in domestic violence. And to our mind, totally inexplicably, they then said they didn't report the results from Ceduna because it showed no change, which really breaches all protocols for evaluations. A finding that there is no change is as important as a finding that there was an improvement or a finding that there was a failure. With issues such as school attendance, you can actually compare those results with what you actually see. And it's important in all of the evaluations that these things get balanced. Interestingly, the chapter in the University of Adelaide report that talks about alcohol starts off with the heading perceptions of change, but then the language just goes on and starts stating these things as facts. The other really important thing, as well as the fact that different people in the community do have different experiences, is to understand why some of these answers are at times given. And we found that out when we were doing it was told to me while we were doing the evaluation of new income management in the Northern Territory. One of our activities was going out to the communities after we'd done some of the research, talking about the findings and our impressions and their responses to that. And one of the issues that we raised was the fact that the qualitative research or the quantitative research asking people about change in the communities reported that things for children had got much better, that school attendance was reported as having increased. We had the administrative data on school attendance, and that data showed that school attendance had got worse. And I asked the people in the community, can you sort of help me just trying to understand what this information's telling me? And one of the women looked at me and said, well, it's really simple. When we're answering these questions, we're not going to admit that things have got worse for our children. That'd be a shame job if we said that. And besides, what would happen? Would the government come and take our children away again? And so some of these responses are actually shaped by a much broader experience. Some we can explain sort of psychologically, that you report positive things because you're so clever, and you report negative things because of unfortunate things that happen to you, and all of these biases. But we also have to remember the circumstances of people who are actually responding and how they're viewing how we're going to use the data.
Thanks, Dr. Gray, Professor Gray, Professor Klein. Thanks, Chair.
Thank you, Senator Rice. For Professor Gray and Dr. Bray first, I'm not sure if you saw, but we had some evidence given to us by the former mayor of the District Council of Ceduna and the current CEO. They expressed really serious concern about what the impact would be in their community when the CDC was no longer in place. I just would like to give you an opportunity to respond to that, given the research you've undertaken.
I mean, I think that the issue of transition is important. So firstly to say is I don't accept that there's evidence that at a community level that the cashless debit card has produced those sort of positive impacts which would then be lost. But the issues of transition are important to take into account. And I think that one of the issues which we identified in the Northern Territory was a tendency for income management to create dependence. You've become to rely on, in a sense, in my words, somebody else micromanaging detailed aspects of how you spend your money. And I would expect, and I think the evidence is that cashless debit card can do similar things. This needs to be managed. I note that the Minister, Rishworth, in introducing legislation, stated that Services Australia will conduct individually targeted transitional support interviews those who need it, and that where participants require continued assistance with budgeting, transferring direct debits from the cashless debit card or referrals to further support services, there will be help available, including the option for voluntary income management if they choose. And it's important that this be done and done well. We consider an activity which needs to be monitored and reported on, and also needs to be accompanied by a clear effort to identify service gaps and action to fill these. So in no way do I think we're saying that our support for this particular legislation is saying that there are not issues and there are not needs for services and support. And we would also note, in terms of monitoring, the Australian and Northern Territory Government are proposing to work with community organisations to monitor the impact of lifting of some of the alcohol bans in the Northern Territory, using a range of data such as hospital emergency presentations, arrests, child removals and so on. And I think that kind of provides quite a good, the extent to which that's followed through is quite a good model, I think. In the Northern Territory, the issues are more complex because it's been going for a much longer period of time.
Yes, and the one thing I'd add is, once again, his perception of the impact of the card and whether or not that's actually a correct perception. If we go to the University Adelaide report, page 120, it's the point I mentioned earlier. Notably, the present report does not include figures for police outcomes in Ceduna and surrounds, because no significant impacts were detected for any offence type. So that's actually reporting on the police data. Now, yes, sometimes, that type of administrative data, there are particular issues. Enforcement may have changed, but then that can be taken into account. And I presume that information was given by the police if there had been changes. But the basic fact is that the data showed there was no change in that area. So it's really important that these perceptions actually get tested against the reality of the impact. Because we really want evidence-based policy.
And Associate Professor Klein, you spoke about the importance of other services to support people in terms of the transition and in the future. What sort of support services would you like to see? And noting that the card was offered in communities accompanied by a range of new services as well. So if you've got a perspective you can give on that existing support and what else you need to see.
Yeah, I mean, the issue about the support services coming alongside the rollout of the cashless debit card in the Kimberley, I think needs a little bit unpacking, because I don't think that funding was distributed in the way that I think people originally thought. And I think there's notes to that effect in some of the evaluations that have been carried out, but the kinds of services that were funded and where that funding actually went is, yeah, I think isn't as straightforward as I think originally claimed. In terms of the support services in the rollout, so do you mean if there was getting rid of all forms of broad-based compulsory income management and the transition from that? Is that what your question is going?
Well, talking specifically about the sites where the bill leads to the abolishment of the CDC, so perhaps putting the Northern Territory to the side for the moment, but in those communities where we'll see the CDC abolished, what support services would you like to see in place to support communities in that transition? And in some of those communities, there were support services attached to the CDC. Some evidence we've been given suggests that it can be quite difficult to tell where you do see positive anecdotal impacts. It can be difficult to tell whether they're coming from income management or they're coming from the services which wrap around income management. So I'm just interested in your perspective on that.
I think the transition needs to be led by traditional owner groups and Aboriginal controlled organisations. So in East Kimberley, I think the role of MG Corp is really significant. And just to note the amazing work that corporation does in terms of working with families on individual basis to work out ways forward for for their Target 120 program. I'm thinking in particular in the ways in which they work with families to support ways forward is, I think, a really significant approach. And so, there's a lot of really good ideas there. I just think there's lots of different voices that want to get involved in this conversation. I think, making sure that it's led by traditional owner groups, Aboriginal controlled organisations is really essential in mapping out that pathway forward. And, it may take time, and a lot of care is needed by careful policy work is needed to support making sure that the people who are at the target and at the centre of these interventions, are not getting left behind, which they have been for the last six years. That a different approach by the current government is forged.
And you spoke about, in terms of a future product to support voluntary income management, the importance of that not being the CDC or the Basics card. Could you just expand on that for me, please?
Yeah, I mean, one thing that my research, but others did that looks sort of more qualitative. So, my research was never meant to be an evaluation. It was looking at the sort of social and political life of these technologies, is that they're not just technologies. It's not just a piece of plastic, that they have a whole sort of social life around them. And so, in some of the research that I've done, but others done, these pieces of plastic have a whole sort of program logic that comes with it. Like, it's not just a technology, it's not just a product, that it has meanings in people's lives. And also within the community. So that's why people, call it a white card. I mean, the card is grey. But it's a white card because it's an intervention of white people. Now, my thinking, and just, I think it's just, general good public policy is that you really want to, if you want something that's going to work and if you want something that is supported, you really need to get to those root causes of the sort of social and not reproduce the same mistakes that were made previously. So that's why I cannot see how the Basics card, but also the cashless debit card. I know people are saying that it's a more superior technology, but it's not just a technology. There's a whole social life around it, and you need to break that. And that's why I'm advocating for, if you're going for a income management, it needs to be individual opt-in, and it needs to be called something else. It needs to look different.
Mm-hmm. Okay, and just before I pass to Senator Pratt, can I just confirm for each of you, noting your comments around broad-based income management, but you support the bill as it's drafted?
No, I'd want, I have deep concerns about the 4,000 people being put back onto the basics card. And I think there needs to be some work done around the continuation of the basics card. But abolishing the cashless debit card, definitely supportive.
Without going into the detail, I think the point that we would make is that there is a need for the government to take a clear stance at this point on income management in the Northern Territory. And so in parallel with this process, that even if yet the detail has not yet been worked out, that the government state clearly an intention to remove compulsory income management in the Northern Territory, and to start discussing with communities what alternatives, what options they would like to have, and develop community-driven responses. We recognise the transition process is going to be complex. It's going to be very messy. We warned back at the time of our evaluation of new income management in 2014 that program, rather than creating independence of those individuals put on, was creating dependence. And we've now had people in a dependent state for 15 years. This is not going to be something that's easy to come out of. It is going to be a complex transition. But the appropriate thing in this legislation is not just that one of moving people across, but moving them across in an environment that says it is our intention to remove compulsory income management in the Northern Territory.
So would you welcome this bill as a first step in that process?
Oh, very much so, but very strongly call upon the government to take that next step.
Okay, thank you. I'm going to pass to Senator Pratt now. Senator Pratt, I think you're on mute, sorry. We don't have your audio, Senator Pratt. No. We still don't have your audio, Senator Pratt, I'm sorry. We'll just give her a minute. Senator Pratt, you might need to contact support services. Just while we're waiting for Louise to get her audio sorted, I know Senator Pratt did have some questions for you, Professor Klein, around how you reached your findings and how you conducted your evidence, and she noted you'd spent some time in the Kimberley, but if you could just expand on how you found your evidence base.
Sure. So it was invited research. So when the cashless debit card was said to be rolled out, community organisations got in touch and asked they were concerned about what was about to happen and wanted sort of an external person to help research the environment and also the rollout of the card. So that included a rigorous ethics process. I was at the University of Melbourne at the time, and over, I think, about 6 separate trips to the Kimberley, Some of them were quite extended periods of time. Interviewing people prior to the cashless debit cards, understanding what people knew, and then interviewing, so I think all in all about 50 people who were targeted by compulsory income management, and then also a lot of interviews with who gets called stakeholders of the community around their perceptions and the like, and then a whole lot of observations, participant observations in the community too. So that research has been published by various leading journals, international leading journals, which all have peer-reviewed processes.
Thank you. I'll just check to see if we have Senator Pratt back. No, we still don't have your audio, Senator Pratt. Okay. I think Senator Pratt also indicated me, and I hope, Senator Pratt, I'm not mixing up your question here, but Senator Pratt had a question about the use of evidence by the former government. And I think from her perspective, it had been quite selective in terms of the evidence they'd used to support the continuation of their program, whereas the broad base of evidence seems to not support more broadly, provide an evidence base for the government's stated policy objectives. So I hope that's correct, Senator Pratt. So if you could comment on that, please. Perhaps that's one for Professors Gray and Bray.
Yeah, I mean, I think that it's from our perspective. My perspective, it's very clear that there was highly selective use of evidence and of the way in which the contracting and the commissioning of research was done. I think both, and it's not just my opinion. I think it's pretty clear from some of the ANAO reports and so on.
I'd go a little bit further and say there has been a misuse of the evidence by previous governments, plural.
Yes.
There has been a long history of quite distorted interpretations of what was found, selective quoting of particular reports, and trying to report a detail rather than the overall finding of the evaluations. If we look at the whole history of ministers, there's been very little strong data that supports the continuation of income management, yet we've had a history of ministers quoting particular studies selectively to justify it. And I'd say not just the ministers, their departments. And it's one of those unfortunate things with evaluation and with public policy, and in the work that we did for ANZOG for the Thodey review. The theme of that was actually learning from success and failure. And evaluation has a very important role in identifying success and failure, but unfortunately governments and bureaucracies have great difficulties in accepting failure. Rather than then learning from that, there's a tendency to be defensive and to maintain policies for a very long time in the absence of evidence.
Can I also just add that I completely agree with my colleagues' assessments that are correct. I also think what's been troubling is the lack of engagement with all the other peer-reviewed research that's being published around compulsory income management, and there's quite a lot now, and there hasn't been an engagement from sort of the bureaucracy with that research that has been marking out a whole lot of issues around broad-based compulsory income management, and I think that's something that should be addressed going forward.
Excellent. All right, well, I believe that's all the questions from senators. Thank you for your participation in giving evidence today. We appreciate your contribution.
Thank you.
Thank you.
Thank you for the opportunity.
Okay, I would now like to welcome via video conference representatives from the Anti-Poverty Centre, Change the Record and the Australian Council of Social Services. Let's check we've got everyone. Great. Thank you for appearing before the committee today. I'd like to invite each of you to make a brief opening statement, should you wish to do so. And after that, I'll invite committee members to ask you questions. Perhaps we could start with the Anti-Poverty Centre if you have a brief opening statement. Do we have Ms O'Connell or Mr Coonan? No? Okay. Perhaps if the witnesses on the line could state their names and we'll see who we've got.
Edwina McDonald from ACOS here.
Great.
Charmaine Crowe, Program Director, Social Security at the Australian Council of Social Service.
And do we have anyone from Change the Record? No? Okay, over to you, ACOS, if you'd like to make a brief opening statement.
Thank you. I acknowledge that today we are coming to you from Gadigal country, and we pay respects to elders past and present and extend that respect to First Nations people in the room and online today. I thank the committee for the opportunity to provide evidence today, along with my colleague Charmaine Crowe. ACOS warmly welcomes the abolition of compulsory cashless debit. As we and many others have argued, compulsory cashless debit is a discriminatory policy that has failed to improve the lives of people on low incomes. It is demeaning, unproven and expensive. We welcome the new government prioritising this issue at the start of their term. As we make clear in our submission, it's important that the government also abolish compulsory income management as soon as possible. Income management continues in a blanket fashion under this bill, primarily in the Northern Territory, as well as a few other sites. And after 5 years, there's no conclusive evidence that income management delivers positive outcomes for people subjected to it. Since 2007, when income management was introduced as part of the intervention, income quarantining has humiliated and stigmatised people. Both income management and cashless debit have compounded a sense of shame that people who are unemployed feel, because not only are they without paid work, they have lost control of their income. These schemes are incompatible with Australia's international human rights obligations, including rights to social security, privacy, equality and non-discrimination. They overtly discriminate against Aboriginal and Torres Strait Islander peoples. It's time for a punitive mandatory income quarantining to end. Our submission also puts forward some recommendations to support the transition of cashless debit card, including to ensure Centre Pay works in the best interests of people on low incomes, and for existing Centre Pay arrangements for people on cashless debit to continue in a seamless way once they're taken off the card. We also urge the government to adequately fund and support local community-led services in areas subject to income quarantining, including social security rights and legal centres to support people with this transition. And we understand the government's actively considering these and other mechanisms to best support the transition. We congratulate the government again for taking this step to abolish cashless debit, and we look forward to it taking the next step to make income management truly voluntary. Thank you.
Thank you very much. I believe we may have representatives from the Anti-Poverty Centre now.
That's right. Sorry about that, folks. Had some technical difficulty.
No problem. Would you like to make a brief opening statement?
Yes, thank you. I'm joining from Gadigal country today, stolen country never ceded by its rightful owners, and my colleague Jay Coonan joins from the lands of the Wurundjeri people. We acknowledge elders past and present and extend our solidarity to them and all First Peoples whose sovereignty has been denied by successive colonial governments. The genocidal project continues today in the form of policies like cashless welfare, which violate welfare recipients' fundamental rights. I will be referring to government cashless welfare programs using the term income control during this hearing. The Anti-Poverty Centre was established by unemployed people for unemployed people to counter problems with politicians, academics, professional advocates, and others who don't share our struggles, making decisions about us without us. We reject paternalism in all its forms, and welfare recipients are the experts in our own lives and in the social policies imposed upon us. Discriminating against people who rely on income support punishes us for structural unemployment, disability, race and gender discrimination, lack of access to jobs where we live, and politicians choosing to maintain macroeconomic policy that requires us to be unemployed. Any program that targets welfare recipients is premised on the idea that we're somehow inferior, less valuable members of society. We strongly support the end of the cashless debit card, but the bill doesn't go far enough. It's a cop-out to avoid the subject of the basics card or to kick the can down the road. It makes cashless welfare more racist, not less. It ignores the vast contributions of communities over more than 15 years opposing it. We urge the government to act to prevent the risk of income control being imposed on more people by leaving legislative infrastructure in place that allows for future governments to more easily expand it. The bill must be amended to create a clear path to end all compulsory income control, to ensure no one on the CDC is forced onto the basics card, and to use the opportunity of instruments that sunset in October to give relevant communities the earliest possible chance to exit cashless welfare. You can't continue it in any form without the consent of welfare recipients. Other consultations are illegitimate if you neglect this, particularly when those who are influenced by partisan players and profiteers are involved. If you insist on unequally applying moral judgments to us, it's your responsibility to ensure that your solutions to our so-called problems do not violate our rights. APONT has recommended voluntary programs should be available to anyone, not just welfare recipients, making them less discriminatory and reducing stigma. Another submission to this inquiry identified serious risks with proposals for community-level income control. The Australian Psychological Association said in their submission on the 2020 bill to make the card permanent that there are 50 years of psychological research showing that positive reinforcement strategies are more effective than punitive ones. You all know, as well as we do, that the primary problem isn't people are bad with money. It's that we don't have enough of it. There is bipartisan support for starving children in this country because that is the effect of the Coalition and Labor Party's welfare policies. The effects of inadequate income support are especially acute in remote communities where the cost of living is extreme, and that's exacerbated because income control limits people's choices and enables price gouging. This will continue with the basics card. Payments must be above the Henderson poverty line. Mutual obligations must be abolished to ensure no one who needs a payment loses access to it, and that everyone has the best possible opportunity to find a job.
Thank you, Ms O'Connell. Can I just confirm if we have representatives from Change the Record on the line?
Someone from Change the Record texted me and said they were in the waiting room, and I've sent them the password, but I'm not sure if they've had any luck.
Okay, we might continue on and just see if the Secretariat can work that out with those representatives. I'm going to pass to Senator Rice for questions first, and then other senators will have questions.
Thanks, Chair. And look, thank you very much, Representative from ACOF and this Anti-Poverty Centre for your both your submissions and your evidence this morning. Very clear, very direct as to where you feel we need to be going. I want to start off for both of you. I mean, you both recommended that we should be moving as quickly as possible to be getting people off all forms of compulsory income management. So perhaps starting with ACOS and then APC, what does that look like for you? How, I mean, do you think this bill should be amended to make that possible, or what does that transition period look like?
Thanks, Senator Rice. I think, as we say in our submission, we do very much welcome the abolition of cashless debit and mandatory cashless debit and want to see that happen as soon as possible. We urge the government to act as quickly as possible to abolish mandatory income management. I think it's important that the government do engage with communities that are currently subjected to mandatory income management. let's not forget that income management has been in place in the Northern Territory since 2007, an extremely long period of time. And I do think it's important that the government, consult with affected communities extensively to work out how to, abolish the mandatory form of income quarantining. We are of the view that if individuals are wanting to continue with some kind of income quarantining, then they should be able to do that. But ultimately, we are calling on the federal government to abolish all forms of mandatory income quarantining as quickly as possible.
Do you think that, would you prefer to see this bill amended so that that process of ending all forms of compulsory income management was at least flagged and a process begun?
Well, I don't think there's anything to stop the government to instigate the process of abolishing mandatory income management, and it should just get on with it. We obviously want to see the abolition of cashless debit happen as soon as possible, and the government has made that commitment. And so, look, quite simply, we're urging the government to abolish both forms of income quarantining as quickly as it can.
Thanks, Charmaine. So, Anti-Poverty Centre, Ms O'Connell, what's your views on what the process should be given the bill in front of us?
Yeah, I think a number of other witnesses have referred to community-controlled processes, and that's obviously vital. But we also know that there are really clear actions the government can take now, immediately, to provide more people with the option to exit the card, that there has been plenty of evidence provided that communities don't want it, and that where there needs to be further consultation about potential future programs, that there is no reason why failed programs should continue to exist while that consultation is ongoing.
So would you like to see the bill amended to allow for that, getting rid of compulsory income management via the basics card as well?
Yes, absolutely. We believe every opportunity should be taken right now to amend this bill to ensure the minimum number of people are on compulsory income control in the immediate future. And we would love to see a very clear commitment from the government about the next steps they'll be changing to bring any further legislation that's required, again, in the immediate future, not kind of some vague commitment to have discussions down the road.
Could I get you to expand on the point that you made in your opening statement about how, if that's not done, how in fact it then means that cashless welfare becomes more racist than what it is at the moment?
Well, one of the major sites that the former government used to try and, I guess, counter claims of racial discrimination was by expanding the card to Bundaberg and Hervey Bay. So once that very cynical move is wound back, we are going to be left with an even more significant proportion of people who have their income controlled being First Nations people. So that is how it becomes more racist. We know that when this card was started, the Racial Discrimination Act had to be suspended. And that, again, only the small number, when it was expanded, but under the Rudd government, if I recall correctly, to the rest of the population in the Northern Territory, including colonisers like ourselves, that was, again, just designed to get around the claim of racial discrimination. But the number of people who remain on the card in the Northern Territory are, by the vast majority, are Indigenous people.
You make the point in your submission about the issues with involvement of private financial institutions in the management of income management. We've heard a lot of evidence and a lot of support for voluntary income management of some sort, of people that feel that it's useful for them and they would like to be able to avail themselves of it. Do you have a view about that form of voluntary income management? And given your concerns about private financial institutions, do you think that should, if there is a mechanism of voluntary income management that's available, that should be government run rather than privately run?
Jay Coonan from the Anti-Poverty Centre here. I'll jump in on that one. Obviously, there should be no private profit-derived services within the welfare sector, but particularly when it comes to the topic of income control, it is difficult to see how it would be operated through the public sector as a blanket mechanism, and rather not like a community-led or operated organisation. So the continuation of any form of income control, whether it be voluntary or compulsory, will be difficult if it's managed through the public sector, and that is partially why I suspect that it was privatised in that form, as it was easier for private institutions to be able to manage than the public sector. So while we do support the removing all forms of private provision within the welfare sector, we also would like to see something that is more community derived rather than something that is blanketly used via the public sector.
Thank you. And
Just add to that,
yes.
that one of the major issues is people's privacy and the use of data. And so if the government insists on continuing with involving private organisations in the delivery of welfare services, that there must be much, much, much more robust protections in place to ensure that people's privacy is maintained to the greatest extent possible, and that their data is not used for any other purpose than delivering the service that is the government's responsibility to deliver.
Thank you. Look, my final question is, both in your evidence this morning and in your submission, you make the link between people being asked to individually manage their income when their income is insufficient, and so that nexus between levels of income support and people managing that. And in your submission, you give a bit of information about the experience during the pandemic when income support was doubled. Could you expand on what lessons we could learn from that period of time?
Yes, so I think most people who've lived on welfare for any significant period of time have been driven, like myself, to do things that we don't feel good about and that the government would view as criminal to meet our basic needs. And I think it's reasonable to conclude that the evidence shown in the Northern Territory, which is included in our submission, regarding the dramatic drop in property crime during specifically the 6-month period that income support for most payments was raised above the Henderson poverty line, and while mutual legations were suspended, and while the Northern Territory was not subject to significant lockdowns, shows that if you give people money, they are better able to survive and less likely to do things that, again, probably most people don't actually want to do. I just think that the solutions are so obvious to government, and there's so much evidence that has amounted over years and decades about what forcing people to live in poverty does. And personally, I was looking up those statistics to counter a claim made by a Northern Territory politician during the election, where they fear-mongered to say that if the Labor Party removed income control, that there would be a skyrocketing crime in the Northern Territory. When I looked up those statistics, I expected to find something that would disprove that sort of claim, but I was myself quite shocked to see how stark the experience was. And I think, it's frustrating and it's abhorrent and it's dehumanising to see that all that evidence continually ignored.
Thank you. Thanks, Chair.
Thank you. We have Senator Ruston on the line as well, and I just wanted to let, for the purposes of Hansard, know that Senator Nampijinpa Price has also joined us. But Senator Ruston, if you'd like to kick off.
Hi there, can you hear me okay?
Yes.
Oh, cool. Look, I was just interested to all of the people that are appearing as witnesses at the moment, notwithstanding the fact that you quite clearly do not support any form of compulsory income management. So I'll take that as a given, and that's something that you've all clearly advocated for a very long time. What I'm interested to understand from you, though, is the bill that's before us seeks to get rid of the cashless debit card mechanism of income management as opposed to the basics card income management system. If we were to move to a voluntary system that you potentially would advocate for, I'm sort of keen to understand why you would be suggesting that it should be delivered in a form, a form other than the cashless debit card mechanism of income management. And I just wondered if you had a view around the kind of delivery platform that you would like to see used should voluntary income management be something that is proposed going forward.
I'll jump in there, Senator. Charmaine Crowe from ACOS. Hi. Look, I think, a few things. I think there's been problems with both forms of income quarantining in terms of the card itself and its effectiveness, if you like, in being used. I'd be loath to say that one is superior over the other in many ways. We've not put forward a view which technology should be used, but I think as a first principle for people who are wanting to volunteer to have their income quarantined as an individual, then it is up to government to ensure that whatever technology is used is the most efficient and reliable form possible. This is people's income support. This is a crucial part of people's lives, and it's critical that they have access to it at all times. I think that would be the key thing that we would urge government to consider.
So following on from that, Charmaine, at the moment, if you aren't on income management, your payments are paid directly into a bank account that is operated by a bank. I noticed that a couple of people had made comments around, we shouldn't be having income management managed by anybody else but the government. How would you see if there was a product that was provided by your bank that just said that you were able to provide a certain level of quarantining of that income? I mean, do you still see that that's something that the government should be delivering, providing, or do you think it's something that would make more sense for a bank to provide, the same bank that you currently bank with?
Look, I guess ultimately it's still a government. I'm struggling with terminology here, but look, for want of a better term, service. Perhaps a good way of thinking about it is the centre pay, and so that is ultimately administered by the federal government for the purposes of supporting people on income support payments, and it's very widely used. I think the core thing for people is that they can trust in whatever product is put forward to support someone engaged in a voluntary system of income quarantining. The last thing that we would want is for a private provider, for instance, a bank, to do a poor job of it for people who are wanting to have their income quarantined.
Jay Coonan from the Anti-Poverty Centre, if I may jump in on that line of questioning as well. I just wanted to point out that income control should be voluntary. However, what we're concerned about and what we raise questions to is the nature of how it will be co-designed in an efficient way where it's for the benefit of the community and the individuals who voluntarily subscribe to it. The service should be controlled by the community and not by any organization or institution. And I believe that is core to the principle of co-design as well, especially if you're going to roll out some form of income control onto communities.
And Senator Ruston, did you have further questions?
Hello, can you hear me? It's Antoinette Braybrook here.
Oh, yes, Ms. Braybrook.
Finally got on, thank you.
Welcome. We'll come to you in a moment.
Okay, thank you.
Senator Ruston, did you have further questions?
Yes, I just had one follow-up on that, in the sense of currently when somebody has their payments paid to them, it's paid into their bank account. I'm sort of trying to struggle to understand if somebody voluntarily wants to have a certain proportion of their payment quarantined for a purpose, why that would need to be community controlled. Why couldn't a bank just offer that product to the person the same way that they offer all of the other products that are associated with their existing accounts, as opposed to actually having to design it again?
Kristen O'Connell here from the Anti-Poverty Centre. I mean, banks can offer these products. That has nothing to do with government. And if it was a bank offered product, we would have access to it just like anyone with their income, regardless of whether their income comes from. This is about what the government is doing, its own policies. If its policies at the direction of community involve providing a service, then those services should be provided by government, and it is government's responsibility to figure out how to deliver those services itself. Privatisation should not exist in the welfare system.
Even if it's voluntary?
You're talking about two different types of voluntary from what I am understanding from what you're saying. You're talking about my option as a welfare recipient to make a decision with my bank. Also, there are existing programs where people make decisions directly, for example, to control their spending on gambling, to limit their ability to spend. Those things are initiated by us, but they are not to do with the welfare system.
Yeah, I suppose I'm just trying to work out why you would be so against the cashless debit card mechanism for income management if it was voluntary and operated through the mainstream banking system, because that's all the cashless debit card is a technology that uses the infrastructure of the mainstream retail banking sector to support people. And if it was voluntary, I'd sort of struggling to understand why that wouldn't be the preferred mechanism for delivery, because it provides all the protections that your normal bank account has. But anyway, look, thank you. Appreciate your evidence, everyone.
Thanks, Anne. I had a question for ACOS. One of the things you spoke about was the importance of transition, and I'm just interested, this bill, it deals with the cashless debit card immediately, because we've got this issue around the sunsetting of the legislation towards the end of the year, and then leaves the door open for broader consultations on the future of income management, particularly in the Northern Territory, to allow time for those consultations to be undertaken fully. I guess I'm interested in your view of what those consultations should look like, and during any transition period from broad-based welfare, and particularly the CDC, what support services you would like to see in place to support that transition.
Thanks, Senator. I think it's really critical that the government adequately support community-led services that will help the communities with the transition itself. In our submission, and for quite a few years now, we've also been calling for adequate funding of the Social Security legal centres and other community-based legal centres in affected areas, so that they can help the community with the transition, ensure that people's Social Security rights are upheld with this transition. That will be crucial. We also need to make sure that basic things like people's centre pay arrangements, etc., are not affected by this transition. So, you know, the last thing that we would want is for people to be missing out on rent payments or fall into arrears with their utility companies because those centre pay arrangements have fallen over when people transition off the cashless debit card. So it's critical that the government has an eye to that, and I understand that these are, you know, being actively considered by the government as we speak, which is welcome. But ultimately, and you know, throughout this whole, you know, period of time that we've had income quarantining, we and many others have made very clear that the government should be supporting community-led services who so often have the solutions to many of the issues that these communities face. And we would really like to see the federal government seriously support those services and invest in those services and ensure that those services can deliver the solutions to the issues that their communities may be experiencing.
And would you welcome this bill as a first step towards the ultimate policy outcome you want to see around income management?
That's what we've made clear in our submission, yes.
Okay.
I might just add, just in terms of the process of the consultation, I think just to emphasise that the importance of working with the communities and the community-led services on the ground to identify as part of the process the supports that are needed in the transition is just key.
Thank you. Now, I've got a question from Senator Nampijinpa-Price, but I just aware that Change the Record didn't get the opportunity to make a brief opening statement. I just wanted to check, Ms Braybrook, if you were happy to table that so we can continue on with our questions, or if there's something you'd like to say.
I am, do you want me, sorry, I'm on my phone, so it's hard to hear. I do have opening statement to make.
Okay, I might ask you to make a brief statement, and then we'll move to questions by Senator Nampijinpa-Price.
Okay, so I have 2 minutes. Is that right?
Yes.
Okay, so I'm an Aboriginal woman, born on Wurundjeri country, but my family are from far north Queensland, Cookie Erlandji. And I'm going to speak briefly to Change the Record's position that the Social Security Amendment Bill is a step in the right direction in abolishing the cashless debit card, but should ensure that income management is abolished in its entirety. As you've heard, I am co-chair of Change the Record, Australia's only national First Nations-led justice coalition. CTR is a coalition of legal, human rights and Aboriginal community-controlled organisations, including Aboriginal legal services and family violence prevention and legal services. And I've also been the CEO of JIRA for almost 20 years, which is an Aboriginal community-controlled organisation, family violence prevention and legal service based in Victoria. And we deliver specialist culturally safe services to Aboriginal and Torres Strait Islander women who experience or are at risk of experiencing family violence. So Change the Record welcomes the Commonwealth Government's commitment to abolish the cashless debit card. We're, however, concerned that the bill will enable the continuation of compulsory income management for over 4,000 people in the Northern Territory who are currently on the cashless debit card. In total, this will result in over 27,000 people in the Northern Territory being subjected to some form of income management. Most of these people are Aboriginal people. It is Change the Record's position that this is unjustifiable. We agree with the government's conclusion that the cashless debit card is not evidence-based, ineffective and discriminatory. It is for precisely these reasons that we strongly object to the failure of the bill to abolish all forms of income management. There is decades of evidence that underscore the need for Aboriginal people to have control over our own lives. We must have self-determination for ourselves. Income management flies in the face of that evidence. Income management is about control, not self-determination. It takes power away from Aboriginal people over their own money and lives. It particularly takes power away from Aboriginal women who desperately need financial control and freedom to make choices that are in the best interests and the best interests of their children. There is substantial evidence that domestic violence police call-outs increased significantly after the introduction of the cashless welfare card. An independent study conducted by Monash University, Griffith University and Queensland University across 4 cashless welfare sites found that interviewees reported an increase in tensions and fightings within households due to the additional financial pressure that the cashless welfare card placed on families, and increased risk to women fleeing family violence as a result of having less available cash at their disposal. The National Agreement of Closing the Gap stipulates that Aboriginal and Torres Strait Islander peoples must play an integral part in the making of the decisions that affect their lives. This is critical to closing the gap. Income management takes that power away from our people. Further, the UN Committee on the Elimination of Racial Discrimination has expressed concern about the discrimination faced by Aboriginal and Torres Strait Islander people and has recommended that Australia maintain only opt-in forms of social security quarantine. For these reasons, CTR supports moves to abolish the cashless debit card, but it has changed the record's position that this bill misses a vital opportunity to abolish other discriminatory and ultimately harmful forms of income management that are harming our people. Thank you.
Thank you, Ms Braybook. Senator Nampijinpa Price.
Thank you very much. Firstly, I just wanted to note that there is been a lot of conversation around these measures being driven by community, and I would like to, I guess, remind the panel that the CDC was a community-led push to begin with in many communities, and those communities are now at risk of having that removed from them. It's certainly evident that there is a call to make income management an opt-in service. And I just would like to ask anybody from either organisation, my concern as a representative from the Northern Territory is that there are women who are certainly concerned about the fact that if the income management, if they're removed from income management, we have a demand share economy in traditional culture that your family members can demand your access to your income and you're obliged to give that income. And that is a deep concern for many women that I have spoken to in the Northern Territory regarding that. They're also concerned that if the opt-in option is available to them, that they will have pressure applied to them by offenders in their own families. Do anyone from your organisations have a suggestion with regard to how that particular concern can be addressed?
It's Antoinette Braybook here, Senator. Sorry. Look, as you know, I respect that you're from that way, and I'm not. I have worked in this area for 20 years, so I just wanted to, I guess, make a few comments just around, my understanding, probably not a lived experience of the cashless debit card, but just from, seeing women experiencing family violence over those many years, that I think that what we need to be doing is looking at wraparound services to support those women to not be controlled by government or controlled by perpetrators or communities, so they can make individual choices. And those services, where women feel safe to make their own individual decisions. Thank you.
Thank you. I guess it's
Kristen from the Anti-Poverty Centre here.
It's still not clear how women in those circumstances who are culturally obliged to provide, to give when they're expected to, and there are many, often more than one family member who are applying this pressure onto these individuals. I understand that, again, I don't see how, if the woman, certainly I understand the need for a female to make that choice, but it has been suggested that there are forms of triggering an opportunity where the card is applied to somebody that might be their choice, but it is applied in such a way that it cannot be removed because perhaps the court has ordered it because of a DV situation in protection of that woman. I note that it has been a mechanism of protection for women in those circumstances, and certainly the Cape York model under the Family Responsibility Commission basically steps in. The community itself, community members step in and they will apply income management for a period of time to individuals who they feel need to be able to, one, if there's a situation of neglect of children, two, if there's a circumstance of DV, to be able to protect those individuals. I don't know if this is something that your organisations are aware of, but would this, do you think, provide for that opportunity to allow that protection without the responsibility falling solely on the shoulders of, say, a victim of DV, to be able to use that as a tool to say no and not be forced by an individual to remove themselves from income management?
Senator, I think if a woman has access to appropriate services, then she will not be pressured and she will feel safe to make her individual choices. And, government control is the same as, being controlled by a community. We need to invest in every way to ensure that a woman who is experiencing family violence or pressures, financial pressures from community or other individuals in that community, that she is supported to make those decisions for herself, not take control of that, but work with. We need to start looking at things through a different lens and stop having government making those decisions for us. Aboriginal and Torres Strait Islander women are ready to take control of their own lives, no matter where they live. And we just need to make sure that the appropriate services are there for our women to do that.
Can you please just explain to me how that service will work in that capacity?
Firstly, if we have appropriate culturally safe services for Aboriginal and Torres Strait Islander women to access across Australia, and that we're appropriately invested in and not having to fight for resources, then we can do the work that we need to do to build the trust within the communities with women, to draw women to our services. That's been my experience in Victoria. Women don't just walk through our door to access our service. We have to get out to our communities to build trust and confidence, and we do that through, taking some workshops to communities like our Sisters Day Out, our Dilly Bag programs. It's about building on women's resilience to give them the power to control their own lives. And so what we know is we take what we do to our communities, bring women in, and then women feel safe and confident in accessing our services.
Thank you. I guess in my experience in the Northern Territory, a lot of women feel this tool is that for them, is that protective mechanism for them and has been for them, and have expressed their concerns to me about that being removed because it has worked for them. So I'm just wanting to understand, because those are the circumstances that I've certainly been confronted with, and speaking to the organisations in my region are also concerned with.
Sorry, to note that I do respect that every woman has an individual choice, and if there are women within communities that do want to opt in, then we should support those women to opt in, but we should not make them feel like they're being controlled.
Thanks. And I guess, yeah, it's those women that feel like if the opt-in mechanism is there, that they will be pressured to opt out. So it's overcoming that concern.
Then that requires another support system wrapped around it to ensure that those women are safe as well.
Which is certainly what is taking place in places like Cape York and their system. That's all from me, thank you.
Okay. Senator Pratt, do we have you back with audio? Sorry, Senator Pratt, we still aren't able to hear you.
Chair, could I ask a question of change the record?
Sure, Senator Rice, do you want to do that? And we'll see if we can get Senator Pratt.
Yes. And look, thank you for your evidence this morning. I'm interested in terms of that perspective of sort of opting in and the various moving away from compulsory income management, whether you have a view about the model being used in Cape York in terms of having, the Family Responsibilities Commission having income management as one of their tools when they are sort of working with with people, and they certainly express the fact that they would like to maintain it as a tool to be able to be used as part of a whole range of other support services.
I did hear some evidence given earlier that the importance of the wraparound services as to the success of that, but I would have to take that question on notice and consult with the Queensland Indigenous Family Violence Legal Service and come back on that one.
Okay, thank you. Thanks, Chair.
Thank you. Senator Pratt is phoning in. I just wanted to check if we've got her connected by phone. No, we still don't have you, Senator Pratt. Just give her a moment to see if she can connect by phone. Does any other senator have a question while we just wait for Senator Pratt? Okay, I have a question. One to ACOS. Just early in your submission, you spoke about the impact that the CDC had on individuals' lives who were subjected to broad-based income management. I just thought I might give you an opportunity to talk to some of those personal impacts and where you saw that compulsory income management negatively or detrimentally affecting people.
Thanks, Chair. Look, there's so many there's a wealth of stories from people who feel like the cashless debit card and income management has done harm. Single parents having their card declined at supermarket. I know of single parents who have been unable to pay their rent because they were under cashless debit. Mums and dads being unable to provide their children with cash for, the tuck shop or going to the local show, for instance. There have just been so many examples for people who are on very low incomes where their lives have been made harder because they've been put under these schemes. And I think the key thing is, as other witnesses have made very clear, is it's the lack of control, the loss of that control over your income. We know that people receiving income support payments are the best budgeters, right? Because they have to be. You simply don't have enough income to cover the basics. And so being put under these schemes is demoralising. It is stigmatising. And that is why, for many, it has caused so much harm. Yeah.
And I'd just add, as well as the stories that we're hearing, what we know, and as you've heard from witnesses in this panel and earlier today, is it's just abundantly clear that there is no solid evidence to support the card as well. So we're hearing the stories, but also seeing just the lack of any evidence that the card is doing the things that it's supposedly set out to do.
Thank you. I believe we've got Senator Pratt on the line now.
Thank you. To ACOS and others, if you like, I'd like to ask how income management and the cashless debit card contribute historically to misconceptions about who might need support in managing their income, in making decisions if they're struggling with drugs, alcohol or gambling, or are subject to, financial coercion and control by someone else. Does a focus on welfare recipients mean that we're blind to the needs of others who might like support, and also haven't made suitable products and services available to them in order to do that? I guess if we're going to have an opt-in system that enables people to make financial decisions to limit certain types of spending, isn't that something everyone should have access to if they wanted it?
Well, we've been very clear from the start that this policy is blatantly discriminatory against people on very low incomes. There is no reason to think that just because you're on income support, you are more prone to having an addiction, for instance, which I think is ultimately what has driven this policy from the start. And we've seen it in other iterations, right? The former government's proposal to drug test people who are unemployed is coming from the same assumption, that just because you are receiving an unemployment payment, then you must be fundamentally flawed in some way and you probably have an addiction. It's abhorrent, that kind of thinking. And it's one of the key reasons why we are so supportive of abolishing mandatory income quarantining. If you look at income management in the Northern Territory, for instance, the trigger for that is being on an income support or an unemployment payment for a long period of time, completely ignoring the economic circumstances in which that person lives, in that there just may be very few employment opportunities for them, so they are essentially forced into a situation of being on unemployment payments for extended periods of time. But what income management does is cast this aspersion over people on unemployment payments in that area as, being prone to having an addiction or something else, which is why they need to have their income quarantined against their will. So yes, fundamentally, we strongly oppose the assumption that just because you are receiving income support, you may have an addiction or something else happening. And indeed, the evidence suggests that that's absolutely not the case. Your question about whether or not anyone should be able to volunteer for to have their income quarantined. Look, we've not done extensive work on looking at who should have access to voluntary income quarantining, but I guess as on principle, if you are going to have a voluntary model, then it should be open to anyone who wants it, irrespective of where they derive their income.
And that might help us develop products that are more fit for purpose because they're not targeted at Social Security recipients. Can I ask, ACOS, you made some remarks about the care we need to take in transferring, for example, centre pay payments. I'm also interested in if you were reviewing direct debits as people move their payments over, whether there are areas where people might have had their consumer rights trampled and they've been signed up for illegitimate income deductions. You know, for example, lines of credit that might have been in breach of consumer law for whether that could be purchases at Good Guys, and not to pick out anyone in particular, but I've seen those kinds of things happen historically where a retailer has an obligation to check someone's ability to pay but sells a product anyway. Do you think this is an opportunity to go through and clear the decks a little bit on those problems?
Absolutely.
Or is it not? Yeah.
Absolutely. Look, it's a great opportunity for the government to look at the retailers that are using Centre Pay. I think there's some 600,000 people who use Centre Pay, who are receiving income support and use Centre Pay. I think it's crucial that the federal government ensures that all retailers who are engaged with it are reputable and have, the interests of people on the lowest incomes at heart. I think, it's also probably a good opportunity for the federal government to ensure that, rather than people on JobSeeker, signing up to a 3-year rental of a white good, for instance, which is going to end up costing them far more than what the white good would cost if you bought it outright. There are other options, and making sure that those options are available to everyone, like no interest loans, for instance, which will be a more cost-effective option for the person. So it's just ensuring that those services are adequately funded too. And finally, this is why adequate funding of social security and community legal centres is so important, so that people aren't getting ripped off and that they can ensure that their rights are upheld, whether it be with social security or in the consumer space.
I just wanted to add
Yeah. Sorry, I'm
just wanted to add
reading
to
the others' answers. Apologies for interrupting.
No, that's okay. It's a bit difficult with managing technology. But no, I'd just like to go back to the original question about payments and the particularly the line of questioning about drug and alcohol, and just ascribing an individual kind of blame. What we know from income management is that people who have lived outside of the trial communities who then moved into it, say if their partner and they moved with their partner, were then forced onto the payment, even though there's, they don't have any vices. And after they move out, they're still, being forced into that program. This income control program shouldn't be seen as the final kind of, product in order to resolve social and community dysfunctions or inequality. It's being used as a very, very blunt instrument to very complex, minuscule and individual problems. When alcohol and gambling is a social-wide issue, you can't turn on a football match, for example, and see, products being advertised to people. You at the same time, alcohol is advertised at those things. Yet we have, I just want to draw an example to the Midwinter Ball, for example. It's being sponsored by Woolworths Group and Lion, two major political donors. And for example, Woolworths Group in Darwin, we saw that, for example, the Northern Territory government overrode through legislation to allow for that to be built. And it was only at the last minute that the company decided to pull out due to community pressure, saying, we don't want this in our community. So there is broad-based political corruption and just the complex social issues are being believed that this income control program is going to fix that. Maybe it might for certain anecdotal individual situations, but as a broad-based blunt instrument, it won't. There needs to be bigger structural reformation in the way that we deal with gambling and alcoholism in our communities as we do with domestic violence within our culture. So just to end, basically, we cannot rely on this continuing as the means to solve our complex social issues.
Thank you very much for your evidence today. We appreciate you being part of our process. The committee will now suspend and will be returning at 11:15 Eastern Time, which is 10:45 Central Time. Thank you.
Thank you, everyone.
The committee will now recommence. I'd like to welcome representatives via video conference from Uniting Care Australia. Thank you for taking the time to appear before the committee today. I'd like to invite each of you to make a brief opening statement if you wish to do so, and after that I'll be moving to questions from senators.
Thank you very much. I will make us an opening statement on behalf of all of the three of us. Thank you so much for the opportunity to represent Uniting Care Australia here today. Before I begin, I would like to acknowledge the sovereign First Peoples of the lands on which we are variously meeting from, and to pay my deep respects to their elders past, present and emerging. I'd also like to express my solidarity with their ongoing struggle for justice at this critical point in time in our history. Uniting Care Australia is the national body for the Uniting Churches Community Services Network and is an agency of the Assembly of the Uniting Church in Australia. We give voice to the Uniting Church's commitment to social justice through advocacy and by strengthening community service provision. We're the largest network of social service provision in Australia, supporting 1.4 million people every year across urban, rural and remote communities. We focus on articulating and meeting the needs of people at all stages of life and those that are most vulnerable. To support our contribution to today's hearings, I'd like to acknowledge the participation of my colleague, Simon Schrappel AM. Simon is the CEO of Uniting Communities. Simon can speak to the experiences of the participants on the cashless debit card in Ceduna, and more broadly through his role in convening the Accountable Income Management Network for the past 10 years, which has brought together those with lived experience of being on the cashless debit card and the Basics card together with researchers and service agencies operating in communities subject to various forms of compulsory income management. I also introduce Samantha Gledhill, our First Nations advisor, a First Nations woman who speaks to the impact that compulsory income management has on the self-determination and rights of those that are subjected to it. She also represents the voice of our national staff network on First Nations strategic policy and advocacy issues. Uniting Care Australia has been advocating against the cashless debit card since its inception in 2016. We've made 6 submissions on this issue and included it in numerous pre-budget submissions. We support this bill based on the large evidence base which has been built by government and independent researchers, identifying the extensive problems linked to compulsory income management. We also note the data and information gathered through our services network, which further supports the problems associated with compulsory income management. And based on this evidence, we have 2 recommendations. Firstly, that we believe that all forms of compulsory income management should be abolished and replaced with an opt-in approach to voluntary income management that should be developed and implemented in consultation with communities and those with direct experience of receiving income support to achieve meaningful and positive long-term outcomes for participants. And secondly, we support the government's staged approach to transition participants from the cashless debit card, but we recommend that the government adequately fund ongoing wraparound supports for communities with a focus on community-led solutions that will address the underlying issues which lead to participants being placed onto compulsory income management. I'm not sure if Simon and Sam have anything else to add. Thank you. No?
No? Okay. We'll move to questions now, and I have questions from Senator Pratt.
Thank you very much, Chair, and thank you to Uniting. May I ask, please, in the context of transition, you've spoken about uniting Care's support for the bill, but also support to see the basics card and income management overall become voluntary, noting the need to transition reasonably quickly because the mandate for the cashless debit card ends in December. How do you see our bill? What does government need to take care on, particularly in the context of the services and communities that you have worked with, to make that transition as effective as possible in the best interests of people who've been historically affected by the card?
Thank you. Simon, did you want to have a go at that first? And
I'm happy to kick off. I hope I'm coming through clearly. I had some computer problems, but hopefully that's good. Look, I think much has been said about the transition arrangements and some of the challenges that people may have as they exit CDC and come back into either a form of basics card, depending on where they are, or completely off the card and going back to measures that most other Australians are able to enjoy when they're on income management. Remember, the majority of Australians don't require an income management mechanism to help them manage their finances. However, I do think that for people who have become reliant on this card or have had to use the card through no choice of their own, certainly options in relation to Centrepay that enables them to manage their income as they choose rather than how somebody else chooses is something that we should be trying to focus on more strongly, and to ensure that all participants, if they wish to have some form of management of their income undertaken, that they are encouraged and enabled to use Centrepay. I think, aligned with that, ensuring that the resources of financial counsellors and those communities that can help people with their money management, if that's what they choose to seek, is and enable them to better manage their daily finances, is something that should be made available at the same time.
Thank you. Can I ask, in that context, when is Centrepay well used and when is it inappropriately used?
I think it's well used when people have control over it. So if they don't feel coerced into using Centrepay and it's managing essential, weekly payments or sometimes, fortnightly or monthly payments. So obligations around rent, I think it's probably where it's strongest, and to some extent around utility payments. I think extending it beyond that can be problematic because it ties up a lot of money, and rent payments tend to be fairly standard. Utility payments clearly can change over time, but for some people, they find some comfort in being able to ensure that those essentials are being met on a regular basis.
Is there, I'm imagining that Uniting Care has financial counsellors among the kind of different contracts it gets. What can you tell us about the suite of services that you might contract for in different communities, and what government could learn and be aware of better in giving out those contracts to better meet the needs of people who are on income support in affected communities?
Yeah, go, Simon.
Oh, okay. When you might like to add too. I mean, I think contracts. There's a lot of issues with contracting that our network experiences. I think continuity and certainty are certainly sort of key elements, so that we can, particularly in remote areas where much of CDC has been applied, the challenges of actually recruiting and retaining staff is a key issue, and therefore having security of tenure over those contracts is quite important. I think having flexibility in terms of the way that they're applied is also a key element, so that they can be modelled and to ensure they cater for that particular community's requirements. And so, whilst and this is a sort of a general point, most contracts should have an outcome focus rather than just a product, the number of people that you might actually see. And most agencies are very happy to be held accountable for trying to achieve particular outcomes, assisting people around their income management and ensuring that that's an effective intervention is something that most agencies are very, very happy to be held accountable to. So I think contracts that allow that rather than just, provide money on a short-term basis and, without an outcome focus are preferable. Claire,
and is there anything in the context of this legislation in terms of the emphasis of those contracts or what's in them that you would like to highlight?
Well, look, as Simon said, our financial counsellors and our emergency relief providers and our family support workers and our domestic violence workers, they all, they all play a key part to identify different needs of individuals and families. So I think we really welcome the latest announcement from Minister Rishworth last week in extending the life of contracts. So it's really important that those contracts have continuity and that you're able to work with people. Sometimes you need to provide support to individuals and families for a very long time. So chopping and changing of providers has been very unhelpful in the past when it comes to the provision of services. But it's about continuity. It's about adequacy. So, we're seeing a lot of need in many communities across the country, increasing because of the cost of living issues that are being experienced by people at the moment. So ensuring that we actually have adequate workers in communities, particularly those communities that are facing more challenges than others. There are some gaps, and so we need to make sure that that there are adequacy of those services. But the contracts, really, it's about having a suite of support for people. And in many communities that we work across the country, some of the greatest outcomes for families or for individuals, for young people, are where they have you have a one-stop shop, so you don't actually have to tell your story 50 times to people, but you can actually say it once, and you've got a suite of wraparound services to really support your needs, so that you can be self-determining and get on your way. Most people don't want to engage with services for long periods, but sometimes they need the support. So if it's really focused on the outcomes of the individual, often people can get their needs met and be on their way. And I think the financial counselling services do have a really key part to play in this transition from being on the cashless debit card. As Simon said, many people have, if they have possibly been on this card for too long, in that they need some new skills to learn how to manage their money better in a different environment. And people can, and they have the right to do that. It's a fundamental right to be able to manage your own affairs and not have somebody else intervene in that.
Okay. And how accessible is financial counselling in terms of the communities that you might have these services in? Do we need a boost in that funding specifically? Do we need to recruit people locally? Are we able to do that quickly? I don't know how long it takes to become a financial counsellor. Best that they come within the community rather than, I guess, recruiting them from elsewhere. What is the level of access to these services currently? What are the waiting lists like in the communities where the CDC is ending?
I think that given that we have a transition process going on now, which is going to be fairly quick, I would suggest that it would be a good idea to review what service levels are available in those communities in a suite of services, and ensure that we can fill some gaps fairly quickly, either through use of other programs from other communities, or actually even if it's short term, boost the service levels within some of those communities between now and when that transition process is to taper off. And I'd suggest further on from that, another 6 months or so, however long it takes, so that we've got adequacy of services. There is a dearth, and I think, Simon, you probably help me here, but I think there's a dearth of services in some of these communities. And so I think we need to do, I would assume that a review would be going on to make sure that the transition process is successful.
Yeah, I concur. I think it's important that that a review is undertaken in each of the communities where the card is dismantled, because at best it's patchy in relation to availability of those specialist services. And as you point out, I mean, there is a training requirement to be accredited as a financial counsellor. We struggle in city locations to get sufficient supply of financial counsellors. It's just an extra level of difficulty to ensure that we can provide those opportunities in some of the remote and country areas. So I think the sooner we get onto that, identify those needs and start targeting, because it will take some weeks, if not months, to be able to recruit and get people into those communities.
And given this financial counselling and other programs, it's not just those services, are really over the last 2 years have really learned how to pivot themselves pretty quickly into some different circumstances. I'm sure, and I know that there will be services out there willing to help to do some outreach if required into some of those areas from existing programs in other places.
Thank you. And in that context, in terms of the Department of Human Services or Services Australia, as they are now known, or I can't even recall actually if that's their actual name. What do they need to be aware of in being on the phone with people? They're not always going to be very aware of what the local services look like. If they're sitting down and going through someone's centre pay and they're like, they've moved their rent over and they've moved other things over, but they might be like, oh, well, but what's this deduction here? For example, it could be one of those very long leases for white goods where you've more than paid for it twice over. What should be the trigger for that kind of referral? And how do we ensure that support gets to the people that need it?
Well, I would assume good practice with Services Australia or with Centrelink, which will be doing a lot of this work, I'm assuming, good practice would be a case management approach to the transition. Yeah. So each individual gets their case worker to sit down with them, and either it's on the phone or physically, probably not, but on the phone, to sit down and really work out what those things are. But a case management approach is the sort of way where, an individual, this is now about tailoring an individual transition for a success. We want this to be a successful transition. So I know that Services Australia are doing a lot of work on their vulnerability framework. In fact, there was a workshop we were supposed to be at right now talking about their vulnerability framework and looking at how they meet the needs of more vulnerable people in our community better. This is a great opportunity for them to trial some of their newfound skills in that, in trying to make sure, but essentially it's about an individualised approach and asking the right questions and having trained staff at the Centrelink office who know this is about support. This is about making sure that they understand that individual's world and their context. Simon, or do you have anything else to add? And that requires a good case management approach that is about the needs of the individual.
Thank you.
Senator Pratt, are you happy for me to move to Senator Rice now?
Yes.
Okay, Senator Rice.
Thank you. Thanks for your evidence this morning and for your submission. I want to start with your recommendations. You noted that there were 2 in your evidence this morning. In your submission, you had 3. And the first one, which you've touched upon, about the concerns about participants who'll be transferred to or remain on compulsory income management. What I wanted to ask was whether you would prefer that this bill actually address that issue more explicitly and set out a process or a time frame or something to actually acknowledge that here's the process, that everybody would be moved off compulsory income management, i.e. the basics card, as well as the cashless debit card.
Could you repeat the question? Sorry, Senator.
Yes, I mean, basically, we know that this bill is only addressing the cashless debit card, and that there will be participants in the Northern Territory who are going to be moved back onto the basics card. And the government have indicated that they will be moving to get rid of compulsory income management, but we don't know what the time frame for those, particularly for those people in the Northern Territory, is going to be. And so my question is, would you actually prefer for this bill to be amended to at least set out in some way that time frame or that process?
I'm happy to come in first on this one. Absolutely, Senator. I think that is perhaps one of the omissions in the bill, and I mean, we're assuming that perhaps for practicality's sake, because of the timing with CDC, was one of the reasons that may not have been addressed in this bill. But it is disappointing at one level, because certainly our argument is that no form of compulsory income management should be maintained or retained in Australia, and that in some communities clearly there isn't an alternative, a basics card, and people will be coming off of this card by the end of the year, and will be going back, as I said earlier, and have the same experience as most other Australians have in relation to be able to have complete self-determination over how they manage their financial affairs and the income they get through income management payments. But our view is that absolutely that the basics card should also be looked at, and a time frame should be given to eliminating or getting rid of the basics card as well, so that people right around Australia should have the same opportunities wherever they live to control their finances.
Yeah. Sam, did you want to jump in there too?
Look, I just would support what Simon has said. I think it really is about providing a clear direction for participants on the basics card of what is actually going to be happening. And obviously one of the key things that the government has identified through the Closing the Gap agreement is that they would actually consult with communities to ensure that that process is done in a culturally safe and appropriate way as well.
I'm interested, Ms. Gladhill, we've heard evidence about how, in fact, removing the cashless debit card at this stage and putting people in the Northern Territory back onto the basics card will actually reinforce the racism that's inherent in the basics card, given it was a measure from the intervention, and whether you've got any comments that you would like to make about that.
Yeah, look, I think there's quite a broad issue in relation to discrimination when it comes to the basics card. The history of the creation of the basics card is rooted in the overrepresentation of policies that are paternalistic and oppressive for First Nations peoples. So literally identifying one group as being seen as needing help more than others is potentially problematic. I think one of the key realities of even the intervention was that it was a blanket approach, and it didn't provide a solution that was targeted to meet individual needs. I think one of the key findings of research is that a strengths-based approach, which is individually adapted for individuals' needs, and something that our services do focus on, is people-centred solutions. And so, in the NT, we see the experience of the basics card is a blanket solution to a whole number of issues that really doesn't actually, from the evidence, doesn't actually address the issues that it was designed to address.
Thank you. Other evidence that we received last week was that, in fact, even for people who are on the basics card in the Northern Territory, there is a mechanism that people can apply to be offered, and that the way that is being implemented by Centrelink is also racist, that it's much easier if you're a white person to get off the basic card than it is if you're an Indigenous person. Do you have experience with people that you're working with that that's the case?
I couldn't actually speak to that. Simon, I don't know if you've had any experience particularly, but I mean, that's particularly services in the NT. And I couldn't actually, I'd have to take that on notice and find out whether there was anyone in our services in the NT. We've literally spoken to the South Australian experience today through Simon, but yeah, at this stage we haven't necessarily spoken to anyone in the NT about the differentiation between the processes needed to remove themselves from the basics card between Indigenous and non-Indigenous peoples.
Yeah, I can't speak for the Northern Territory either, and I can only speak for the awful experiences that many people have had to try and come off of CDC. I think it's the hoops that people have had to go through, and to actually outline their personal circumstances to try and provide a case that they should no longer be on CDC has been unfair and unreasonable, and many people have felt quite humiliated by that process, particularly given that some of those decisions are made by people in their own towns about them. They're having to lay out their own situation in front of others. I couldn't think of a more unfair and unjust way of being able to determine somebody's access to money that they have a right to have, and that at the very least has to stop with the CDC being abolished, and people should have the right, if they wish to have some voluntary form of management, that is their right. They shouldn't have to actually jump through hoops to be able to come off a scheme that was imposed without any of their choice.
Thanks, Mr. Shrapple. Just quickly, knowing that we are about to be short on time, you talked in your evidence this morning about the need for extra resourcing for the wraparound services and the transition and the financial counselling and other services. Do you have any estimate of what level of resourcing we're actually is going to be necessary?
No, not really. I think the fundamental principle is that a review is undertaken very quickly to ensure that the right level of support is there. And, given the amount of money that has been spent on implementing this card, I think we need to make sure that there are adequate supports and adequate investment made in giving people, the best outcome in transitioning off the card. And, if we were to, 1.5 billion, I think, was the estimated amount for implementation of the card. I'm not suggesting it's going to be anywhere near that, but I think that we just need to make sure that it is adequate, whatever that takes, to make sure that we transition people off a card which was a trial and has been found by the government itself to have not achieved its objectives.
Thanks, Ms. Little. Look, my final question is about whether you'd like to comment on the interconnection between income management and income support, and sort of people, the philosophy that people needed help to manage their income, whereas in fact the income was inadequate, and that's the fundamental problem, and whether in fact many of the issues that income management is put as a solution for would actually be solved if we increase the level of income support.
You want to go first, Simon? Go on. We'll be.
Well, once again, absolutely. I mean, I think this has been a measure that has tried to mask the inadequacy of income support that many Australians are experiencing, and for many of those in remote and rural communities, they have the added problems and stresses of higher costs of living and inadequate access to appropriate housing. So, addressing those things would be a much more effective approach than trying to impose controls over people's management of their own resources. My experience, and it's interesting, providing a lot of financial counselling services, but often people who are the poorest are probably in some cases the best money managers because they've had to be, and many of them have proved to be able to do that with very meagre resources, and then unfortunately had this imposed on top of that, which sort of suggested that they weren't capable of managing those meagre resources. But yes, we'd have a much more effective strategy if we were able to increase income management, increase income levels for people reliant on these forms of income support.
Absolutely.
Thank you. Thanks, Mr. Shrapple, Ms. Little and Ms. Gledhill. Thanks, Chair.
Thank you to each of you for joining today and for your participation in this process.
Thank you so much for the opportunity.
Thank you.
Thank you.
Thank you. Bye.
Bye.
I'll just check that we have representatives from the Australian National Audit Office in the room, and if they are, they could take their seats. Thank you to representatives from the Australian National Audit Office for appearing before the committee today. The Senate has resolved that an officer of a department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. Excuse me. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. I note that you have provided an opening statement to the committee. Would you like to make any further opening statements?
No, thank you, Chair.
Okay. Senator Rice.
Thanks, Chair, and thank you for your audit. Thank you for your opening statement, which I have to admit I haven't had a chance to read. So look, I invite you to just expand on some of the key issues that you've covered in your opening statement.
Rona Mellor, Deputy Auditor General. Thanks, Senator. Look, we've tabled two audit reports, one in 2018 in September, which really looked at the trial that was underway. And what we were seeking to do in looking at the trial was to see whether the Social Services Department was well placed to inform any further rollout of the cashless debit card with a robust evidence base. It's fair to say that based on the department's monitoring and evaluation approach, we found it was inadequate, and as a result it was difficult to conclude whether there'd been a reduction in social harm and whether the card was a lower cost welfare quarantining approach. We also made a number of recommendations that went to risk management, contract management, procurement, and then recommended that the department undertake a cost-benefit analysis and post-implementation review of the trial to inform the extension and further rollout, that it utilise all available data to measure performance. So internally there was some mismatch and misalignment of how the department was operating, and that it continued to monitor and evaluate the extension of the CDC in Ceduna, East Kimberley and any future locations to inform design and implementation. So we went back in late 21 and into 22 and tabled a further report in June 22 to look at whether or not the recommendations that had been made by the Auditor General had been implemented, and whether or not the extended CDC program was suitably informed by a second impact evaluation of the CDC trial. So we did see improvements in the administrative oversight by the department, some issues around some shared risk management, some issues around diligence in procurement, but we did find that the department had not demonstrated that the cashless debit card program was meeting its intended objectives, and therefore did not effectively implement the recommendations made by the Auditor General relating to cost-benefit analysis, post-implementation review and evaluation. I think in short, the landing was that the cashless debit card program extension and expansion was not informed by an effective second impact evaluation, cost-benefit analysis or post-implementation review. There were methodological limitations that were not independently, that weren't addressed in the work that was done, and the first impact evaluation was not independently reviewed. I think this itself creates a problem for improving the evaluation methodology as the program continued to roll out. I think I might stop there, Senator Rice, if that's been helpful to you.
Great. Yes, it has. Thank you. Look, I did want to also take you to your assessment about the cost-benefit analysis and sort of the ANAO's review of that, because that certainly looked like it was a bit of a mess in terms of whether that cost-benefit analysis was able to be done, and then the issues with releasing it or not releasing it, with and whether the ANO had some comments on that.
So yes, there was a cost-benefit analysis undertaken, my recollection by CIE. If I just draw your attention, Senator Rice, to the letter from, so at the end of a performance audit, we give people an opportunity to have a look at the draft report, and CIE, who conducted a cost-benefit analysis in 2020 of the first 4 CDC program regions, being Sedunia, East Kimberley, Goldfields and Bundaberg and Harvey Bay. In the letter, which is on page 76 of the report, the CIE indicates that our analysis found that the CDC delivers a benefit cost ratio of 0.16. This indicates that benefits would have to be more than 6 times higher than estimated to result in a positive net benefit. So there was one done, and as you can see at page 76 of our report, the CIE has provided a view.
Thank you. Thanks, Chair. Look, I'll leave it there. I might come back after other questions, but fine.
Senator Pratt.
Thank you very much, Chair. I'm going to go to, I think it's point 16 in your opening statement. How is it possible, even that when Parliament says we want an independent review, that an independent review is not undertaken? And how is it also possible that did you form a view as to whether it was just poor methodology or whether there was, in effect, a selection of evidence being made in order to make the case in favour of the cashless debit card, rather than it being a proper independent review? Where did that bias come from?
Okay, so if I just start with is it possible? Yes, it clearly is, because this report indicates that Parliament had expressed a view that any review or evaluation of the trial must be reviewed by an independent expert within 6 months of receiving the final report. We didn't see that independent review having been undertaken, and we called that in the audit, as we do, and the department had its view, which is in the audit report. Your second question goes to the quality.
I just pause there.
Yes.
But we still haven't held the government to account for not having fulfilled that legislative obligation. They've essentially explained their way out of it. Do you have a view as to how, what power does Parliament have to insist that that review took place and that it was independent?
Well, I think, Senator, it's not for me to instruct the Parliament in the conduct of its business. We've provided you with a report. Our function is to independently report to Parliament that indicates that something that the Parliament expressed in legislation wasn't carried out. In terms of holding, the executive government to account for that, that's a matter for you.
And in that context, you've certainly played your role in reminding the Parliament that independent review didn't take place, and that the reviews that did take place very much had their own limitations. So in part, that is the system working. Yes, please go on to the next part of your answer.
So I might just ask Ms Chalmers just to explain some of the limitations that we saw in the work that was done, if you don't mind, Christine.
Yes. So the evaluation report by the University of Adelaide itself noted a number of limitations with respect to the evaluation methodology, and that included issues such as social acceptability reporting biases, a lack of experimental design in the trials, no quantitative survey of stakeholders and the broader non-CDC population, long-term outcomes being assessed in a short study time frame, community data limitations, and also, importantly, concurrent CDC policies and initiatives occurring at the same time, and therefore making it difficult to identify whether it was the CDC that drove any observed changes or something else. And we also noted that in addition to some of those limitations that were noted in the evaluation report, that there was a risk of recall bias, given that there was only one wave of quantitative surveying done, and the respondents to that survey were being asked to recall their behaviour prior to the intervention. We also noted that a range of data sources, including alcohol sales, emergency hospital presentations, and wastewater monitoring, were not used in the second evaluation at an aggregated level.
Thank you for that. Other reviews through academia or community have commented on those issues. Do you have a view as to whether the things that would have made it a more robust review were specifically excluded, or because it was the official review asked for by government, did government dictate the level of access to information on what data could or could not be used?
I think we might answer you in two parts. I'll just talk about the importance of when people are implementing trials or activities for government, setting up their review framework very early in order to properly identify the data that's necessary to measure and measure parts of or the whole of the impact. And I think it's clear that that wasn't sufficiently done. The opportunity for the independent review that you were asking about before was really not just to see to revisit what happened, but also to provide guidance back to the department to properly construct the data sets that might be necessary to measure the outcomes. Insofar as other reviews, I think you're asking us whether or not there was a selection bias in what was being measured.
I am essentially asking that. In terms of whether, the University of Adelaide may have just been doing its best with the parameters of its contract to do the review, which therefore doesn't necessarily make it particularly independent. And I want to know what you found in looking at that review yourselves.
At paragraph 4.24 of the audit report, we make the point that the University of Adelaide undertook the evaluation largely in line with the evaluation plan and methodology that had been set by the Department of Social Services.
Okay. And I guess this is a broader philosophical question. It might be one not for the A&O, but what does it mean really for a university to accept a government contract that, if you like, dictates the level of scrutiny and independence in it? I guess that's a matter for Adelaide University, but it does.
I think the most I could say is that when departments and agencies put out work to be done, people will respond to the parameters that are set in the work, And research institutions and specialists will call limitations in the work, caveat things, if their view is
which they did do in this case.
That's right. So it's not a shoot the breeze issue for me at all, Senator.
No, and that's fine. I'm really just trying to get my head around how we ended up in a place where, even when this review was released, there was, widespread critique coming from other sources about it. Fortunately, otherwise, it might have been harder to see those biases, which clearly also you looked at in depth as well. Finally, can I ask, in the course of your work, did you happen to have a look at, in the context of the contract to Indue, whether you've got a view about who now owns the technology and the work that was done? So, for example, if government wanted to say, well, let's use the coding that Indue's done for different merchants and make it available to other financial products, are we able to do that? Or is that not something that that you looked at?
No, so you're correct, Senator. That's not something that we would have a current view on. We certainly had an awareness of, as you'll see in the second report, the feasibility study. There's certainly commentary in the first report about feedback from the wider banking sector about the initial design.
Right, I'll go back and have a look at that. Thank you, and thank you for your excellent work.
Thanks, Senator.
Thank you. I just had one question with two parts, I guess. So in terms of the finding in the 2022 report around the program extension and expansion not being informed by an effective second impact evaluation, cost-benefit analysis or post-implementation review, was there any rationale given as to why this hadn't occurred?
I could try and...
That probably is a better question for the department. What we do in the audit process, Senator, is go and look to see whether people did what was expected, i.e. what was planned to do, what they committed to do, and what we saw was that they hadn't. And why they hadn't would be a matter for them. We're very flat and factual about these things and have called what we've seen.
Okay. That's fine. We'll ask those questions of the department. Senator Rice just had a couple of questions as well.
Yes, I did. Sorry, I didn't have them to hand. I wanted to take you to, in the second audit, table 3.1 and paragraph 3.9, talking about the internal performance measures, where you say in paragraph 3.9 that these internal performance measures provide management level information, and the issue that, noting that this might be useful for internal management purposes, it should not be used as a substitute for the latter. I mean, i.e. effectiveness and efficiency measures. And you say that effective monitoring relies on clear performance expectations. The internal performance measures in table 3.1 do not have targets limiting their usefulness as a monitoring tool. So I'm just, in terms of your audit, did you have a recommendation as to the inadequacy of this in terms of monitoring? And was there any evidence that there was any attempt at looking at more informative evaluation of the cashless debit card in terms of social outcomes?
The internal management information can be helpful for people to understand how they're going in the implementation of a project, a program, delivery, etc. I think the difficulty with only having sort of internal information is it doesn't give you a sense of impact. And so for external reporting, the rules around what sort of, if you like, KPIs are relevant for portfolio budget statements and corporate plans, etc., do sort of push the entity more towards describe to the Parliament what the impact of the program is. We weren't seeing that in what we were seeing. Internal targets are really useful for people for budgeting and for implementation planning, adjusting implementation plans. Certainly, these are issues that have been discussed with the Department of Social Services, because it is a department whose performance statements we audit under a previous pilot of auditing performance statements. So what we're looking to do is give Parliament greater assurance about whether or not KPIs that are sort of presented to the Parliament are being met. And certainly in the course of that audit work, it's a separate audit product, Senator, it's not the performance audit itself. We have been involved in lengthy discussions with departments, including social services, on lifting their eyes a bit and reporting more on impact. So we don't offer a view to them about what it should say. I mean, they have to develop their own performance statements and their own performance indicators. But it is certainly an ongoing conversation with departments, and in this case in particular, Department of Social Services.
Okay, I mean, you also note in paragraph 3.14 with regards to the data reports provided by Services Australia that the data presented in the reports are not linked to program objectives or service standards, do not involve targets, and do not provide information to executive management about program performance against expectations.
Correct.
So clearly, so essentially you're noting that there's an inadequacy, but it's not your role to say how to fix it?
I think we've got a recommendation in the report, which is recommendation 1, but I think the sitting message for agencies is your internal management information is really important for managing. Measuring performance requires more than just that, and counting things doesn't necessarily tell you about impact. Counting activities is important for management of your budget, management of your delivery plans, etc., but you really do need to turn your mind to whether or not the purpose and the intent, and in this case there's legislation that has an intent, and the program has an intent, whether or not that's being met, and you should collect data to support, and that data has to be unbiased and fulsome, good samples, etc., to enable you to report on whether or not the activities plus other things, satisfaction of people, engagement with people, etc., is leading to the intent that Parliament had when it passed the legislation.
And noting that that was your first recommendation and that the department has agreed with that, would you be intending on, I mean, clearly the cashless debit card, if this legislation goes through, will be abolished. That won't so much be the cashless debit card reporting and evaluation, but with other programs, will you be auditing at some future stage whether they are effectively doing that, given that they've agreed that they need to do it?
So when as I say, we have this new program that we're implementing. We're auditing 6 departments' performance statements at the moment. So we look at what they put into their portfolio budget statements and their corporate plans. And in their annual reports, we audit the financial statements. We're doing a report on whether Parliament can rely on the information in the performance statement. So where people say they've met something or they've achieved something or they haven't, we'll have a look to see whether the evidence underneath that supports that outcome. So more and more, we'll look at the performance statements. When we do performance audits, we will invariably look at the monitoring and the measurement of performance. But it's a new product that you'll see coming through much more in the work that you do, Senator.
Great, thanks. Thanks, Chair.
Thank you. I believe we don't have any further questions from other senators, but I just wanted to give an opportunity, anyone to jump in? Okay, excellent. Thank you, ANAO, for your evidence today. We appreciate you taking the time to be part of our processes. We're going to suspend now until 12:15 Eastern Time, which is 11:45 time. Thank you.
Who's participating in the hearing on Thursday?
Peter? Commence, and I'd like to welcome representatives from the Department of Social Services and Services Australia. Thank you for appearing before the committee today. The Senate has resolved that an officer of a department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. I would like to invite officials to make a brief opening statement if they wish to do so, and then I'll be moving to senators for questions.
Thanks, Liz Heffron-Webb, Deputy Secretary, Families and Communities, Department of Social Services. No opening statement. Thank you.
Thank you. Did any of the other officials at the table have an opening statement?
Senator Jonathan Thorpe, Acting Deputy CEO of Services Australia. No opening statement. Thank you.
Okay, thank you. I'm going to move to Senator Ruston now for questions.
Thank you very much, Chair, and welcome to officials. I'm just sort of keen to get on the record. Is this legislation actually necessary for the abolition of the cashless debit card under Part 3D of the Social Security Administration Act 1999, or would this legislation automatically lapse this year?
Thanks, Senator Ruston. So the legislation for the cashless debit card does have a sunset date of 31st December 2022. The purpose of the legislation is to enable an orderly transition of people off the card, so to enable us to do this in a structured and planned way, so we don't have everybody exiting the card right on the 31st of December 2022.
So what programs of support are being put in place to assist cashless debit card recipients transitioning off the card?
So we've been working very closely with our colleagues at Services Australia, and I can get them to talk about the detail in a second, but essentially we'll be working in each community where people have the cashless debit card, undertaking outreach, encouraging people to come and discuss their financial situation, including any direct debits or other arrangements they have in place, to make sure we can support them to move those arrangements around so that they're not affected by any missed payments, etc. But I might ask Services Australia to just speak a bit more to that.
Thank you, Senator. So whilst we're still undertaking detailed implementation plans through the consultation process that we're working with DSS on, we are looking at a communication approach that is tailored for each particular location. The communication approach will deal with matters such as using all available channels, such as using MyGov, using SMS, for example, using our local services, remote servicing, and a range of community support services to make sure that we can contact individuals that are currently on CDC and provide them options to transition off and any support they might need in doing so.
So what sort of resources have been allocated to this transition process?
So, Senator, the resources will be subject to government decision, and certainly the implementation plans are still being reflected based on the community consultation that we're still currently doing.
So can I ask you if you're expecting the cost of this transition to be significant?
Senator, we're still working on the detailed costings. Obviously, we do want it to be a very supportive transition. So there will be a lot of individualised support available to people. However, of course, once they've moved off the card and subject to their other needs, they'll be tapping into other support services, etc. So it's really not something we can comment on right now.
So have you had any discussions or significant consultations with the financial counselling services around additional supports that may be needed in these areas? And who have you been speaking to?
So we have spoken to some of the financial counselling services who operate in the locations where the cashless debit card services, cashless debit card program operates. I know Mr Burford might be able to speak a bit more about that.
Thank you. Patrick Burford, Group Manager of Communities. Senator, so on the consultations in each of the CDC locations, a range of stakeholders have spoken to, including some of those services in each location. And so, for example, most recently, Assistant Minister Elliott was in Arakoon and met with the money support folk up there, including not only the financial counsellor role, but also financial literacy and helping set up some the finances and the management of the card types of supports in that region. Similarly, in Ceduna, we met with the, I think it was Centacare in that region that provides that financial management, also counselling services as well.
Did they express any concerns about the supports that may be needed or the resources that they had to put those supports in place in order to support people transitioning off the card?
Senator, they're under funding agreements to the middle of 2023 at the moment, most of these support services. And so they did ask questions about what would be the enduring funding beyond those periods of time. And as Ms Heffron-Webb mentioned, ensuring that the supports are quite tailored to the needs of the individual. Some people won't need much help in terms of getting off the card, but other people might need a quite more intensive support, be that arranging disbursements and where monies go from their cards, and also understanding how to interact with a new system in terms of liaising with Services Australia, and etc. So I think that was the main bit of feedback from those stakeholders, to make sure it's measured, carefully done and tailored to the needs of the individuals.
And can you advise if there was any consultation undertaken with any of these support services prior to the decision being taken for the cashless debit card to be abolished? I'm not talking about subsequent to the decision, I'm talking about prior to the decision.
So, Senator, the decision was an election commitment of the government, so we would not have been involved in any consultation prior to the election.
During consultations subsequent to the decision being made, has anybody indicated to you that they will participate in any consultation with the prior to the decision being made?
So certainly the current Minister for Indigenous Affairs, who was the former Shadow Minister for Social Services, has indicated she undertook some discussions, but I that's literally all I can say. I don't know the nature of them or who they were with.
Okay, thanks. Can you advise when the income management arrangements in the Northern Territory are due to sunset?
So the income management legislation is enduring, but there are instruments, legislative instruments that underpin that legislation, some of which sunset in October 2022. I just might ask Mr Bonham to speak to the exact date.
I'll be more keen, actually, to know of which of those instruments and to whom do they apply.
We can run through those instruments.
So Patrick Bonham, Branch Manager, Policy and Technology Branch. There are 6 terminations which are due to lapse on 1 October this year. One of those is actually in the Northern Territory.
So how many people does that particular instrument cover?
That would cover all of the Northern Territory, which I believe is around 22,000 to 23,000 people. There's the... Sorry, Senator.
I was just wondering whether there has been, any advice as to whether that instrument should be extended?
Yes, we have provided advice to the Minister on that.
So could you maybe just run me through what would be required for that instrument to be extended so as it did not sunset on the 1st of October, and what action would need to be taken?
So they would either need to be remade or the sunset date deferred.
And what's the process of deferring the sunset date?
Deferring the sunset date would require the permission of the Attorney-General.
So there is no requirement for the Parliament to have any say on this?
This is not unique to these instruments, so legislative instruments can be extended through the agreement of the Attorney-General.
So is it your understanding that this is going to be publicly made available? Is this information something that is publicly reported, the extension of an instrument by this means?
Yes.
Okay, so when would you expect, when could we expect to know that it is the intention of this government to extend income management in the Northern Territory when it sunsets, is due to sunset by instrument on the 1st of October?
I don't have a specific time frame, Senator, for that.
Okay, thank you very much. Just wondering, in relation to the contract that currently exists with Inju for the provision of the technology services that sit behind the cashless debit card, is there any penalty for ceasing the operation of the cashless debit card, or is this part of the contract for expiration on the 31st of December?
The contract is due to cease on the 31st of December, and we will be expecting Inju to be doing services up pretty close to that date. The contract does include a clause for a disengagement, which are basically the costs of winding down the program, and we are in negotiations with Inju now in relation to that clause.
So is it your understanding that the government's intention is to wind down the or to completely scrap the technology that sits behind the CDC as at the date that is determined by the Royal Assent?
So, Senator, the government's committed to abolish the cashless debit card. So the Department of Social Services, which currently has the contract, Inju, is winding down its contract to operate the cashless debit card. Services Australia has a separate contract with Inju in relation to the Basics card, and Services Australia is undertaking due consideration as to the best way to manage that contract going forward in the current circumstances. So I think that's the clearest way I can say it.
So who owns the IP to the technology that has been developed in relation to the cashless debit card?
The technology in relation to the card itself is owned by Inju, and that is similar to products which they would provide any service provider. So Inju provide a lot of cards in relation to gift cards, and we are using their system and leveraging their system to provide the CDC.
Okay, so if the current government decided that it wished to continue to use the cashless debit card technology that has been invested in by the taxpayers of Australia quite significantly to make sure it was an appropriate and advanced banking product, if they decided that they wanted, say for instance, to do income management by a voluntary mechanism, what would have to happen for us to get access again to the technology of the cashless debit card? Would we be required to be paying Inju, or could you simply just ask a bank to do it?
So I would say there would be a procurement approach. Senator, with the government wishing to do that, an approach to market. There may be other mechanisms other than the cashless debit card technology that Indu is currently providing to us that could provide similar or better functionality. That would be something you would go to market to explore.
Okay, so we're going to get rid of the cashless debit card technology and just walk away from that. Can you explain to me what the process is in relation to the 4,000+ people in the Northern Territory who have voluntarily made an informed decision to use this method or mechanism for income management that are now going to be forced back onto the basics card? What discussions have you had with those people around the satisfaction of their experience of being on the cashless debit card as opposed to have previously been on the basics card?
So, Senator, the Minister visited the NT last week, as I'm sure you're aware, and I understand she received representations from some people who are cashless debit card participants who'd moved over, and some people who are still using the basics card, and she received some mixed views. Some people said they preferred the basics card because of it was technology they were familiar with and had been using a long time. Some people said they preferred the cashless debit card because of
Can I just interrupt you there, Liz? Are you talking about people who are on the cashless debit card who preferred to be on the basics card? Or I'm just sort of trying to understand the people who have actually made the decision to move over to the cashless debit card, what was their advice and their experience?
Sorry, I was saying that there were people who were on the cashless debit card who felt that it provided a better consumer experience, but I was also saying there were people who had not moved over who did not wish to move over and preferred the experience, from their view of the basics card.
Yep, so I'm actually just trying to talk about the people who moved across onto the cashless debit card. And I just wanted to understand, so were there any consultations undertaken to your knowledge with people who were on the card, the cashless debit card in the Northern Territory prior to the decision being made for it to cease? And is there any further advice that you could provide us around whether anybody's done any polling with people or done any research with people who've moved from the basics card onto the cashless debit card in relation to their experience of the two types of cards?
I'm not aware of any polling, and in relation to prior to the decision, as I said earlier, the decision was an election commitment. So prior to the election, I'm not aware of the specifics of who may have provided kind of feedback or been consulted in the NT. I'm sorry.
Yeah, so I can assume from that nobody even bothered to have any involvement with the Traditional Credit Union, who is currently a provider of cashless debit card services to Indigenous Australians in the Northern Territory?
Senator, I have no knowledge of whether the Traditional Credit Union was spoken to prior to the election. They've certainly have been spoken to subsequent to the election and as recently as last week.
Okay, just finally, can I move to the Cape York situation? And I'll just draw your attention, Ms Hebron-Webb, to a letter that the committee received this morning from you. And I was quite interested in a number of the comments that you've said in here, that you believe that Commissioner Williams' concerns have been addressed, and yet we heard testimony last week from Noel Pearson, who was very, very clear that the repeal of the cashless debit card legislation and subsequently access to cashless debit card technology, I think, to put it in his words, would set back his reform and support for his community by 20 years. So you say in your letter that the intent of the legislation is to recognise the unique arrangements in place for the FRC and to preserve these arrangements so the FRC can continue to operate effectively. how do you reconcile that statement with Mr Pearson's comments from last week that without the cashless debit card, they can't continue to operate the support services that they provide to the people of Cape York?
Senator, the letter outlined that the intent of the legislation is to enable Cape York to continue with their arrangements that, as you know, have embedded in a lot of history and community consultation and underpinned by a statutory arrangement for the Family Responsibilities Commission. I wasn't dismissing or in any way saying that I didn't think that I thought Ms Williams' concerns had been addressed. I said that the intent of the legislation was to address any concerns, and we appreciate her raising these. Some of them are somewhat technical matters that go to the interaction between the FRC legislation and our legislation, and we really appreciate her having raised these, and we are looking at what the options are to address them.
So on the basis that, you know, the FRC through the Cape York Institute have developed the amazing Palmer app, which is, you know, won nationwide recognition for the success that it in its ability to deliver great support services for people in the Cape York, and the fact that that particular app cannot function integrated with the Basics card, but it can with an integrated interface with the CDC. Has any consideration been given to allow the Cape York to be able to continue operating using the cashless debit card technology to enable them to continue the works that have been so successful in their community over the past years?
Senator, I was given a demonstration of the Palmer app when Minister Rishworth and I were in Cairns, and by Mr Pearson. It's certainly a very impressive piece of work. I'm not aware that it can't operate interactively with the Basics card. That's not something that was raised with me then. Is that what you understand?
Well, absolutely, because I mean, as you would well know, the CDC is actually a functional bank account that has all the ability of being able to interface on the basis of that particular infrastructure, whereas the Basics card is a little more than a preloaded gift card in terms of how it operates. So, I mean, you know, that would be a very simple piece of information for you to be able to get around the functionality that the cashless debit card provides in terms of an interface with applications like the Palmer app. So I just...
Senator, sorry, I just want to clarify. So the Palmer app is available to anyone in the Cape York communities. They don't have to be participating in Basics card or cashless debit card. It's a money management resource. It's an engagement with a separate independent financial institution, as I understand it.
I'm asking about the inability for it to be able to interface with the cashless debit card as opposed to the Basics card. I didn't suggest for a minute that the Palmer app was only available to people on CDC.
So I don't think you have to have a CDC bank account in order to interact with the Palmer app.
No, I didn't say that at all. I said that if you wished to be able to interact with your CDC, you could do so with Palmer, but on the Basics card, your Basics card does not interact with the Palmer app.
I'm not
I was just wondering whether you had any advice as to whether that was functionally possible.
I don't have any advice about that. No, as I understand it, the Palmer app is a money management tool that sits across whatever other accounts a person has.
Yes, no, I get that. I'm talking about the interface with the two particular income management applications that we're discussing by this legislation. Okay, so in your opinion, do you believe that the legislation is going to enable the FRC to continue to operate effectively?
Senator, that is absolutely the intent of the legislation.
And yet Mr Pearson last week said that categorically that wouldn't be the case. You still maintain that the arrangements that are being proposed here will enable the FRC to be able to operate in the manner in which it wishes to operate.
So, Senator, the legislation is intended to enable the FRC to operate in the manner in which it wishes to operate. To the extent that inadvertently aspects of the legislation may need slight adjustment, I absolutely take that on board. But the intent is that the FRC are able to operate exactly as they wish to operate.
You just made reference to slight adjustment. What did you mean?
So there's some issues that Ms Williams raised, and I think she raised them in her evidence to you, that just go to interactions between how the FRC offers notices versus the legislation we're putting in, and so technical in nature. But we've certainly, the Minister was very clear, and as I said in my letter, the intent is to recognise those unique arrangements and preserve those unique arrangements.
So there's no intention on the basis of the testimony of the Cape York Institute and particularly Mr Pearson to consider taking on board what he has asked for in the self-determination that's being undertaken by him and his people in relation to how they wish to have income management delivered in the Cape York.
There absolutely is a desire to take on board the self-determination of the people of Cape York, and that's the intent of the. Sorry, Senator, if you don't mind, I'll just finish. That's why the legislation had significant provisions aiming to keep Cape York separate from the rest of the arrangements. And to the extent that we can strengthen those, we will certainly be seeking to strengthen those.
But can I just finally check, there is no intention of maintaining the cashless debit card technology in order for Cape York to be able to continue to operate the way it wants to?
Senator, the government's announced that the cashless debit card is ceasing as a program. The FRC makes referrals, as you know, to income management. It does not refer people to a particular card. It refers people to income management. And the government's intent and the intent of the legislation is that people will continue to be able to be referred to income management.
Yeah, I think my point, Ms Heffernan-Webb, was the fact that last week Mr Pearson was very clear that he wished to continue to have the ability to revert people to the cashless debit card mechanism for the delivery of income management. What I believe you're telling me is that that no longer will be available. So anyway, thank you very much, Chair. That's all from me.
Thank you, Senator Ruston. I've got some questions for both agencies now. But first of all, can I just let me know, since the CDC program was introduced in 2016, how many participants have been placed on the card overall?
Sorry, Senator, we have point-in-time data, but I'm just trying to see if anyone has evidence about how many overall in the whole period.
No, we don't on the overall. We'll have to take that one on notice. But to give you an indication of how many people may be on the card now, it's around 17,300. But in the previous 12 months, there was 23,857.
How long will it take you to just get me that number of how many overall since 2016?
We'll get it to you as soon as possible. We'll try and get it by the end of today, Senator.
Okay, thank you. Can I ask, when people were placed onto the card, how much notice would they have?
So, Senator, obviously the people being placed on the card was supported by legislation, which was announced and then introduced in the Parliament and passed. And so it would depend, you know, if they were tracking that legislation, potentially they would have had some knowledge that it was happening. But in terms of actual notification to them, I believe it was a 4-week notice period.
There is a period, and maybe our colleagues at Services Australia may be able to assist on this. There's a period between when they're notified and when the payments are made.
So Senator Brendan Moon, General Manager, Working Age Programs, Services Australia. Because this has to do with the specific policy around income management, the notification periods for each customer, depending on where they are and which program they're participating in, can vary. Generally, it ranges between 28 and 56 days, but there are a number of steps and processes in between. So it may be best if we take on notice to get you sort of for the different areas where people are and which programs they sit, how that notification process and transition process works.
Okay. And were individuals consulted before they were placed onto the card within that time period?
So there were consultations in communities, but individuals, they may have participated in community level consultations or they may not.
Right, but otherwise they would have needed to be tracking the legislation, monitoring the legislation, or alerted by the department that they were being moved.
Correct, Senator.
Okay. Can you provide the number of people over the course of the program who have successfully exited from the card?
Senator, we might have to take one on notice, but we should be able to get you by this afternoon or immediately.
We're just checking. Sorry, Senator.
Thanks, Senator.
Thank you, that's okay, I'll wait.
So, Senator, there's wellbeing exemptions and then there's exits. So I have some data here on wellbeing exemptions, which is...
Can you just explain the difference, sorry, Ms Heffernan?
Yeah, so there's a provision that if being a cashless debit card program participant would pose a serious risk to a person's mental, physical or emotional wellbeing, there's a power for the Secretary of the Department to provide the person an exemption. It's called a wellbeing exemption. There have been wellbeing exemptions, 35 in Ceduna, 37 in East Kimberley, 129 in the Goldfields and 52 in Bundaberg, Hervey Bay, 0 in the Northern Territory.
Okay, and exits?
And I'm just seeing if we've got the data on exits.
I've got the exits here.
Yep.
Senator, the exits, again, in Ceduna, there's been 40 approved, East Kimberley, 38, Goldfields region, 205, Bundaberg and Hervey Bay, 383, Northern Territories is less than 5, and yep, sorry, that's the total.
Okay, and are these figures over the course of the program since 2016 at point in time figures?
This is over the course of the program.
Yep. As at
okay, so since...
sorry, Senator, as at 1 July this year, yep.
1 July. But you don't have in those figures the number of people on the program from 2016 to 1 July?
No, we don't have that on the table because obviously people flow in and out of income support. So then we will get you that figure, but we just don't have it.
Okay, but so the last point in time, the last 12-month period you had, was it 23,000 in the past?
Yeah, 23,857 have been on the CDC in the 12 months prior to the 27th of May 2022.
Okay, so we're presuming then that figure over the course of the program since 2016 would be considerably higher?
Higher than that, yes.
Yeah. Okay, and in that context, we're looking at about, what, less than 300 wellbeing exits, and I guess less than 700 general exits. Do you have the total figure? Or does your table add up quicker than my view can?
We're working off two different tables, so no, unfortunately, but I can get someone behind me to do some calculating and give you the figure.
And the data table broke it down by individual site, not a total.
Right. But it's a very small percentage, isn't it, over the number of participants on the program?
Yes.
Do you have any data on the percentage of those people who either received wellbeing exits or general exits were Aboriginal or Torres Strait Islander people?
Yes, I think we did have that. So the wellbeing exits, so in Ceduna, it was the number of people was 35, and that was 18% of those were Indigenous. In East Kimberley, the number was 37, and 57% were Indigenous. In the Goldfields, 129, and 19% were Indigenous. Bundaberg and Hervey Bay, 52 people, and 19% of those were Indigenous.
And that's the wellbeing. And what about the general exit? Was that the general exit?
Certainly. So with the exits of the 40 in Ceduna, 30% were Indigenous. Of East Kimberley, of the 38, 39% of that total are Indigenous. Goldfields, of the 205, 12% are Indigenous. Bundaberg and Hervey Bay, out of the 383, 8% are Indigenous, and not published as the Northern Territory because it's such slow numbers, Senator.
Okay. Sorry, did I?
I wonder whether I could just jump in terms of the proportion of the participants who are Indigenous, because it doesn't, that percentages, you can't make sense of those unless you know how many participants were Indigenous in each area.
Yes, so in the Northern Territory, 77% of CDC participants are Indigenous. In East Kimberley, 84% of participants are Indigenous. In the Goldfields, 48% of participants are Indigenous. In Ceduna, 75% of participants are Indigenous. In Cape York, 95% of participants are Indigenous. In Bundaberg, Hervey Bay, 18% of participants are Indigenous. And then there's a group of people who are no longer living in the trial site, 3,819 of them, and of those 46% are Indigenous.
And so my rough calculation would be where we're looking at sort of much shorter than 1%, even possibly shorter than 0.5% of participants on the card, using sort of best case data, because we've only got the data for 1 year in terms of who was on the card. We're actually able to exit either via wellbeing exemptions or general exits. Does that sound right?
So without the figures exactly, it would be in the low percents, but I wouldn't want to get more precise than that.
Can I get that data
Yes.
on notice, please?
Absolutely.
And any breakdowns you could provide, because my rough calculation actually has less than 1%, but I'm happy for my maths to be challenged and get some better detail on that. Some of the things I've heard from participants who have been on the card is that they were put on the CDC despite being located permanently outside of a CDC area, but because they made brief visits into an area which was on the CDC, they were placed on it. Can you talk me through whether that's something you're aware of and why that would have happened?
So, Senator, people would have only been placed on the CDC, to my understanding, if they had changed their permanent residential address with Services Australia. So if they were just visiting for a few weeks and weren't planning to change their permanent residential address, that shouldn't have triggered entry to the CDC. However, if they went somewhere, changed their residential address, and then for whatever reason left a few weeks later, that would trigger participation in the CDC. I have seen that evidence given last week to the committee by someone who said she was out of area and hadn't been in area for months. I don't know the details of that particular case. So it should, to my mind, on the face of it, that shouldn't have triggered CDC entry, but it may have related to what she provided to Services Australia as her permanent residential address.
So if someone was changing their residential address, so for instance, maybe a student might be living in Adelaide for the course of the term and may go home for holidays to stay with family and return to a different address. In an instance like that, would they have been advised when they changed their residential address that that would force them onto the CDC?
I'd have to ask Services Australia if that's...
So, Senator, it would depend on the individual circumstances as to the conversation that would happen with someone. If someone was moving, as you suggest, for a couple of weeks to go back home in the middle of a study term or in the middle of a semester, it would be more than likely we wouldn't advise that they permanently change their address. It's not just the CDC that would impact, it's other entitlements such as rent assistance, living away from home allowance and other things, depending on the customer's circumstance. That being said, many updates happen to customer records and many conversations happen over time. So in individual cases, depending on what's happening with the person, different things can happen. But ordinarily, if it were for a 2-week period, we wouldn't advise someone to permanently change their address for a holiday or to return
So are
home.
you aware, is Services Australia aware of participants who were moved onto the CDC because they were relocating for a short period of time and then sought to get off it afterwards?
Yes, Senator, we're aware of a small number of cases where that's happened and we've undertaken service recovery in those cases.
Okay, do you know how many times that's happened?
No, Senator, I don't.
So what would be the process for those individuals of getting off? Just noting it's a very small percentage who generally can get off.
So, Senator, we can take on notice. It's a somewhat technical process, but effectively we would engage with the person, determine whether or not the address update was correct or not, and if in the instance that the address update was incorrect, there is a process that we can follow to take someone off and have their payment put back in their normal payment destination, their normal payment account, bank account.
I just want to go back. Sorry, I can hear another voice there. Is that a voice in the room? That's not someone trying to answer? No? Just some background noise just coming through the audio. Apologies. I just want to take you to the prior decisions around the selection of the CDC trial sites. Why were those trial sites chosen?
Senator, the former government made those decisions, and I believe there's material on the public record indicating that in some cases community leaders in those communities sought the introduction of the cashless debit card in their communities. And so the government of the time was responding to requests from some community leaders in those sites.
Right, it might be easier to be a bit more specific. So do you know why Bundaberg and Hervey Bay were chosen as trial sites?
That decision was made before I was in this role. So I'd prefer to offer to get you some information on notice about that, Senator, because I wasn't around, and I don't think any of my staff were. So apart from saying at a general level that's been the representations made, we would have to go back and do a bit of chronology about what discussions were had with who in Bundaberg, Hervey Bay.
But your understanding is that was on the basis of community lead representations rather than analysis undertaken by the Department of Social Services?
That's my understanding. I mean, analysis would have been undertaken to support further discussions with those community leaders.
Right, but the decision was based on the representation of community leaders as opposed to independent assessment and analysis done by DSS to select a trial site.
That's my understanding, yes.
Okay. And in South Australia, so Ceduna was chosen as a trial site. Why Ceduna on its own and not, for instance, the neighbouring town of Port Augusta?
Again, as I understand it, it was representations from the community and from community leaders towards the government in Ceduna, which that wasn't the case in Port Augusta.
Right, so that wasn't based on an assessment from DSS that, you know, I guess the problems underlying the government's objective weren't evident in Port Augusta. I'm just trying to understand the evidence base for making these decisions on the trial site.
My understanding, it was the community leaders that were the key factor.
And it was a decision of government as opposed to a recommendation of the department?
So as I said, Senator, I wasn't in this role. We would have to go back and look at the specifics of briefing as to how decisions were made. I would imagine they were cabinet decisions, so they may not be able to be provided. So I really can't say whether or not the department recommended introduction in specific sites.
No, that's fair enough. I suppose perhaps what you can do is let me know if any evidence assessment was done prior to the nomination of those sites and the selection of those sites by the department, and whether that was recommended to government, or whether these decisions were made on the basis of discussions with community leaders without evidence or analysis undertaken which specified why these sites and not others. Is that something you could take on notice for me?
I can certainly have a look at the kind of chronology of events, but as I said, once community leaders may have approached, we as a department would probably have been tasked with doing some underpinning analysis as well. So it might be that both were happening, but I can see what we can track down in terms of how communities were selected or how communities came to be chosen.
Yeah, I'm particularly interested in whether there was an evidence base prior to the government making a decision to choose particular sites and the boundaries of those sites before that decision was made, or whether that was a decision of government based on other factors. So if the department, I appreciate you can't speak for the former government, but if the department can provide advice in terms of their input into that process, that would be appreciated.
Yes, we will see what we can provide on that front.
Okay, can I take you to the technology underpinning the Basics card? We have heard evidence that the technology for that card is outdated. So why does the CDC have better technology to the Basics card? Or, I mean, in the words of some participants, sorry, I know that's not the words of all participants, but some participants have said that.
So there was a procurement process done to procure the cashless debit card, would have been in 2015, I think. That was able to procure a Visa debit card that could be used on across at all merchants, and with specific merchants being turned off. The Basics card was introduced in, I'm testing my memory here now, Senator, but I think 2008. So essentially, technology had moved on substantially between 2008 and 2015. And because the government's decision was to introduce a cashless debit card, there was no upgrade to the technology of the Basics card, if you will. So it still operates on the platform that was essentially originally procured back in 2008, which is a stored value arrangement. Is that
right? So there weren't investments made to the functionality of the Basics card during that period because the government was focused on the CDC.
The investment focused on the CDC. The Basics card was funded and to continue, but it wasn't upgraded significantly in terms of the technology. I should also add, Senator, there is a peculiarity of the income management legislation that says that a person's funds can be placed on a stored value card, which does also, it's just as a technical matter, it may make it difficult to use a Visa type of product. So, but that's something that could be addressed through legislative change.
Right, okay. But in terms of the Basics card under the previous government, so investments were made in terms of the continuation of this card, but not in terms of enhancements to its functionality.
Correct. Correct, Senator.
And that's because their focus was on the CDC card, a different product. Or the investment was, sorry, I'll rephrase that because I'm not seeking your opinion. At the same time, investments were being made into the functionality of the CDC.
Correct.
Okay. Ms Heffernan, you mentioned during your consultations in the Northern Territory, you spoke about experiences of the Basics card and you spoke with participants who were using the Basics card. You mentioned that to Senator Ruston. I was just wondering if you could expand on that with the committee.
I should clarify, I wasn't at these consultations. Minister Rishworth was at these consultations along with some of my staff and our secretary. So I have had very solid reports of them. And it was that some women in particular said they liked the Basics card because it was simple, they knew how to use it, and they didn't want a card with tap and go functionality just because they felt they wanted the PIN protection so someone couldn't steal their card and tap and go, essentially. So this was just in the course of a consultation. I'm not pretending it was a scientific poll or anything. It was just mentioned as being the view of some women who've been on the Basics card for a number of years.
Okay, but the view expressed was that the PIN, as opposed to tap and go, provided better protection in terms of the use of that card for those women.
Correct.
Okay. I appreciate the evidence is anecdotal. Much of the evidence we have received is anecdotal, but I appreciate that perspective. Just interested, in terms of the intellectual property retained by Indue for the card, obviously is quite a significant amount the government expended on the card. So did the government not seek to retain any of the IP or the work developed by Indue for itself? Were there any protections within that contract so that the government could retain some of its investments in the event that it moved to a different product?
So what the contract does is actually purchase a product from Indue. So it is their intellectual product which we are purchasing. It is effectively a bank account run through their system. So it is not something which is unique to other institutions, but it is something which they could provide when they went out to tender. So effectively, we have purchased their IP, not get them to create IP for the government.
Okay, so there's nothing within those contracts which would have enabled the government to retain the technology that it had invested in?
If it was to retain that technology, there would need to be a new contract because, as I said, they own the intellectual property, not the government.
Okay. Senator Pratt, I believe, had some questions.
Yes, my questions follow up from that. I guess we're not just talking about technology here. We're talking about lists of merchants, for example, that have been registered as being compliant with income management, so therefore not selling alcohol or not being a gambling product, etc. Why even can't we retain that information so that it could be made available to other banks or credit unions, etc., to do that?
There are two arrangements which are in place, one which is with the Basics Card Services Australia and ones which are with the CDC, which is our department. The department does have and was responsible for negotiating those arrangements with merchants, so we do have that data. So that's not data which is owned by Inju. It is actually it was a responsibility of our department to sign people up to those agreements.
Okay, so does that mean the functionality of the Basics Card should be the same as the CDC, notwithstanding the fact that it's got the PIN and the like? Is that matching of merchants exactly the same?
There are different agreements in place. Services Australia.
What does that mean?
So with the Basics Card, you must be an agreed merchant to be able to accept transactions on the Basics Card, and we understand there's around 18,000 of those merchants. With the CDC, because it is a Visa debit card, it can be accepted anywhere Visa is accepted. So that means the vast majority of merchants which don't sell alcohol or gambling products can use the CDC. They do not have to be approved by the department to accept the card.
Okay, and so why don't you have a list of the merchants that don't sell alcohol or gambling? Why wasn't that information kept for you? Why is that subject to Inju's intellectual property and not owned by the department?
No, the intellectual property is actually the provision of the card. So they own, the technology which actually has the bank account and the technology.
So you can ask Inju for all of the merchants that made the cut as not selling alcohol or gambling products?
They don't retain a list of those because basically the only list which they retain are those merchants which have been blocked. There are about 880 merchants which have been blocked. That is freely available on their website.
Okay, and so you've got that, and if you needed to expand the
department has actually requested those
retailers that access Basics, then you could.
Senator, sorry, we're talking at the moment about the cashless debit card merchants. Basics card merchant information is the matter for Services Australia, so I might just ask them whether they have the list of the 18,000 or so merchants who can support Basics card.
Kathy Toes here, General Manager, Services Australia. I don't have the list with me, but the number I can tell you is closer to 17,000 than 18,000. But I'm happy to provide information on notice if you'd like.
I think...
but what about the question itself of can you use the Inju data to change your list of merchants for the Basics card?
So the merchants which have been blocked have actually been blocked at the request of the department. So we do have those lists of merchants.
Okay, so that part of the intellectual property...
No,
we
hold that. No, we hold that.
The departments?
Yes.
Can we just have a
Great,
okay. Point of clarification, Senator? I just wanted to clarify the number of Basics card merchants is roughly 17,000. What number is it for the cashless debit card?
It's over 1 million.
Over 1 million merchants you can purchase from with the cashless debit card, and only 18,000.
You've only blocked how many?
Blocked currently 880.
Okay.
Sorry.
So what's the prospect of expanding the number of merchants available on the Basics card?
Senator, that's an ongoing piece of work as part of our business as usual. So as the customer population changes and grows and moves, we track that and continually negotiate with merchants to bring some on. We, from time to time, need to pare some back based on the behaviour of the business. It's just part of our general maintenance of income management.
But there's a big there's a big difference in the number of merchants.
And Senator, some of the comments made by DSS earlier are quite important here in terms of the underpinning around income management refers to a particular legislative instrument around a stored value card. For us to be able to move to a merchant scale such as 1 million using the Visa network, that would be an example of something that would need to change to enable us to achieve that. Otherwise, as Brendan Moon has articulated...
I understand that. I guess what I'm trying to come to grips with. So will, as far as you're aware, for example, will Cape York continue to use an Indue product based on those same lists to offer their version of income management? Is that legally possible under the legislation? I don't really understand when the department's given evidence that this repeal is not going to get in the way of that process of a community that's got the legislative mandate via that self-determination arrangements with the state, what kind of product they will then use to do that work. It seems, would it be legally possible for them to do that with Indue?
Senator, can I just maybe clarify? So prior to the cashless debit card being introduced in Cape York in March 2020, the Cape York communities used the Basics card. So,
I understand that.
So
that's not the evidence that they have given that they want to continue to do that.
Understand that.
Functionality of the CBC.
Yes, I understand that.
But there must be a whole range, I guess my question is, what other banking products might be available to them that would be allowable under this legislation?
So as I mentioned before, Senator, the issue in the current income management legislation is the reference to a stored value card. If that were amended, we could use a technology product with the features that people from the Cape York were talking about in terms of online shopping, greater number of merchants, etc. So
is that something you're looking at or not at this stage?
It's certainly been raised with us actively through the consultations, so we are certainly looking at that.
Great. And would that be by Indue or other banking service providers?
At this stage, in the short term, it would be hard to get another financial institution on board.
Yeah.
And I will just mention Indue provide the Basics card as well. So
does that create contractual difficulties as far as the affordability of a product? I agree very much with the need to end the cashless debit card, but I guess I want to ask you about, how do you go about creating a financially viable product if it's just a small number of consumers on it? Or, there could be reason really for lots of Australians to want to have access to a product that helps them manage their income better.
So these are very good questions. So I guess we are considering all avenues, but yes, you're right. To the extent that we have a small cohort who want to volunteer for income management, provision of the technology platform to enable that will naturally have quite a high cost per head. If we have a larger group of people who wish to access it on a voluntary basis, the costs per head decrease because there's a base, there's fixed costs essentially having a contract with a financial institution, and then there's some per head costs. So these are issues we are considering.
And you might have caught on in the course of the inquiry that there's been discussion about how you go about in our communities going where they know there's a problem with gambling or alcohol, but of course that those issues aren't just aren't specific to people who are on social security. They can be widespread. Have you had conversations with ASIC, the ACCC, the Banking Association about better products for people who want that kind of support? Might be outside the scope of your department, but of course I'm keen to look to solutions that are relevant to the whole of the Australian population and aren't focused just on the social security welfare dynamic.
I haven't spoken to the agencies you referenced. Obviously, it's a thought and a consideration that's been raised from time to time, though, that the technology may have other applications for people wishing voluntarily to introduce some sort of restriction.
Yeah, okay. And can I also ask, in the case of people who have direct debits on their CDC, if they're going, they can work that out with a different financial product. If they're not on if they're not on the Basics card, what will happen in the case of those direct debits for people on the Basics card? Will they turn into a centre pay payment or something else?
So, Senator, in terms of providing support for customers that are moving off CDC to potentially income management, Services Australia will be offering support to help customers transition their effective arrangements, particularly around essential goods and services such as rent and utilities. That can.
What about telecommunications services, internet? So, for example, your Apple Pay, which is done by credit card that you might be purchasing, even little things like apps, for example. What happens to stuff like that?
So, Senator, we'll be providing support to customers relating to their deductions in a broader sense, but with a particular focus on essential services, which would include things like, as you say, the telecommunications. If customers have had connections with third-party organisations through CDC, we'd encourage them to make contact with them in the first place, as they did with their CDC deductions.
No, that's fine. I guess I'm just asking what is it that they move to? I'm assuming that they would use the non-quarantine part of their Basics income to set up a debit facility to replace their CDC. So if their existing banking is a regular bank account and not a credit debit card, how do you go about ensuring people have a banking product to complement their Basics card that will meet those needs?
Yes, so we actually do have the records of the customer's alternative bank account as well. And what will actually happen in practice is the participant can contact us, or we will reach them via a number of channels, and that could be they call us and we walk through what their situation is with their, their deductions coming out of their account, and advise them on what their next steps need to be. We also, obviously, our remote servicing teams will be out on the ground, and we have got some financial officers included in that as well, so we can help people organise their deductions when we're out in community also. So we're taking a very highly supportive approach to make sure that people, don't get caught with having missed deductions or having late fees or anything like that. So, and obviously, where people come in contact with us about, the exit of the CDC. If we identify that they're in hardship or at risk in any other way, we have tools available like referrals to social work support or financial counselling, etc. as well. So we'll be looking for all of that, those indicators as well.
Who will be liable for any late fees if there was an administrative error? So, for example, something wasn't appropriately transferred, and how will you check whether someone's alternative bank account is capable of taking a credit card deduction from it?
We can't obviously look at the bank account itself, but what we can do is work with the person when we have them in contact with us to really step them through what their situation is and the specific deductions that are coming out, and then we can give the guidance on what the next steps will be.
Will you be referring people to financial counsellors on occasion?
Yes.
Will the people stepping through that change, there's been some discussion in the course of the hearing about debts that perhaps people should not have accrued because they might have been a breach of their consumer rights. How aware will the advisors in the department at an individual level phoning and talking people through this stuff be aware of all of those issues?
So, Senator, it's probably really important to note that whilst Services Australia will play a critically important role in the transition, we won't be in it alone. It will include on-the-ground consultation and town halls and all sorts of consultation from our Department of Social Services colleagues, cascading messages from the NIAA, the National Indigenous Australians Agency, engagement with financial literacy providers, cascading information in communities, and perhaps even support from certain companies that have frequent deductions from the CDC customers. So it really is the approach of Services Australia, where they be there to provide information and support as it relates to their income support payment and those deductions that can be supported through the income support system or centre pay. But the broader approach being taken is to get as much information out there so that people are supported to get the information that they need and the support that they need from those that can provide it.
Okay, and so when it comes to independent advice on the range of, so you decide that you do need a new financial product because you do want to retain, for example, direct debit using a Visa type facility. Who gives the best consumer advice in that space about how you find a product that you can access and does good remote servicing, for example?
So, Senator, we fund financial counsellors and money management services in a large number of remote communities, and they will be part of this referral network that Mr. Moon was talking about. So if people say, I want some more advice about what kind of debit card I should get now that I'm going off this card, we can certainly offer them a referral to discuss that, and also to discuss, as you mentioned before, issues where they may have entered into consumer contracts that they shouldn't, or that are potentially where they were taken advantage of. And as you know, financial counsellors have the ability often to renegotiate terms for debt.
So in that context, will you have a particular look at lease agreements for appliances where people have paid over and above the value of the product?
So, Senator, that we can certainly, in terms of data, we can try and determine what sort of arrangements people have in place, and perhaps provide some
I guess I would like to ask if you will take up the suggestion of, when you're reviewing the kinds of payments that people are making, really to ensure they're getting good value for money. It's come up at previous hearings that you know, leasing a fridge, that you'll pay much more than it's actually worth over the lifetime of that lease agreement, and that because there hasn't been much visibility of things like no interest loan schemes or nils, that often people have gone for a very expensive product in order to get access to that essential service, such as a fridge.
Senator, as you say, this has been a topic that's been raised in a number of contexts, and we certainly work very, very closely with the Financial Counselling Association and other peak bodies, consumer law people who raise this as a concern for their clientele all the time. I must say that Buy Now, Pay Later has emerged as the most recent kind of area of high concern. It's certainly, all these issues are things that we as a department are monitoring and tracking. So I can assure you of that. In the context of this transition, individuals who have those kinds of arrangements, we will be supporting them to be in the best possible situation they can be in, noting they may have entered something that is unwise for them financially.
Senator,
Are there any consumer protections we can or could or should put in this legislation from that point of view? I know there aren't a lot of consumer protections for Buy Now, Pay Later, but you know, what is the government's obligation to transfer that debt to from their CDC to a different product?
I think that the question of consumer protections kind of starts to get into Treasury responsibility. And so certainly at an individual level, someone's entered an agreement. Our goal will be, how can we transition them to make sure they don't incur late fees, that their payments are continue and they have the product that they want to have. The question of kind of overall whether it was a good financial decision for them to enter into that product is a kind of separate policy question. I think absolutely it's a legitimate policy question, but it's a bit separate to this process, I think. But obviously, if we're working closely with people, we will be able to gather some de-identified information about how many people have entered into kind of arrangements of that type.
Thank you.
Thanks, Senator Pratt. Senator Rice.
Thank you, and thanks for all of the evidence so far. It's been very informative. I just wanted to start up, and I'm not sure whether you've given this statistic before, or where it's, I'm sure it's on the record somewhere, but just to recap, how much overall has the cashless debit card cost the Australian public, cost the government over the years it's been in operation?
I believe it's $180 million approximately, Senator.
So that's since its introduction in 2016. Okay, and what have been the costs, say in the last financial year?
I don't think we've got the numbers here, Senator, but we could find it out pretty quickly. Might just have to take that on notice if that's okay, Senator, and come back to you.
Okay.
Apologies.
Okay, that would be good. So look, I just now want to step through what the current situation is, so prior to this bill passing. So as currently legislated, the cashless debit card would end on the 31st of December. That's correct?
That's correct.
Yep.
Yep. And so basically, if we didn't pass this legislation, cashless debit card would end on the 31st of December, and anyone on the cashless debit card would exit on the 31st of December.
Correct.
Yeah. And is there anything in the current legislation that would then require them to transition onto the basics card in the Northern Territory or elsewhere?
Yes. The current, if this legislation, putting this legislation to one side, And subject to the continuation of the instruments we talked about earlier, yes, people in the NT would revert to income management on 1st of January.
Right, okay. That's good to clarify that that's the case. So, okay, let's say we pass this legislation, and so then there's a closure date that's set. So let's say it's, the closure date is mid-September, so the 19th of September or something like that. It would mean that from that closure date, people would be able to exit the cashless debit card. So can you just talk us through, so say that was the closure date, people who knew about that, they'd immediately be able to stick their hand up and say, I want to be offered ASAP. Can you talk us through what the process would look like for them, and then for other people, what the expected timeline of the transition of getting them off the card is under this legislation that's before us?
I might ask Services Australia because they're managing the customer focus.
Thank you. Yes, so, and as my colleague Mr Moon said earlier, sort of in the lead up to Royal Assent or these changes taking effect, there'll actually be quite a robust communications strategy that happens via a number of channels. So we're talking local news networks, radio, on-the-ground networks, and through our service centres and remote servicing teams, as well as the department and their providers, just to let people know that this change is coming and what it means for them. From that date that the change takes effect, participants will be able to contact the agency through a number of different channels. It could be on the phone, through MyGov on our website. It can be in a service centre. It could be with department officials that they come across, or our own teams on the ground. To indicate that they want to be removed off the card. Within 7 days, that person will be ceased off the card. In the interim, though, there will be the support provided that I talked through earlier, around talking through what their circumstances are, whether they want to volunteer for income management moving forward, if that's appropriate for them, and helping them set that up, and working with them to, or having their deductions, established from whatever their bank account, remaining bank account is, and referral to any further support services like financial counselling or money matters or social work support, housing support, etc., as those needs are identified.
But can I just clarify, that would all happen within that 7-day period from them saying they
Yes.
wanted to get off it, or, yeah?
Yes, that's right. There will be two, I should have mentioned, there will be letters actually sent out from when the change also happens, so from when Royal Assent is essentially. So that will go out to all participants, confirming that the change is coming and what that actually means for them, and reiterating that they, contact the agency because we can really support you through this change and help you. So it really is quite strong in that regard. Then, as I said, we expect a lot of people will be contacting initially, once they are aware of the change, so we'll be ready for that and to support people through that, as I said, via the various channels. And people that we do not hear from, we will be sending SMS reminders as well, just to say, please contact us, because we want to talk to you about your card, and reminding them of the support from the agency. Once a person ceases their arrangement on the card as well, they'll be sent another letter to let them know. And this is really in case people haven't, if they've contacted us but not really wanted to have an interview with us at the time, we again say, your card is ceased, but please contact us if you need more support, because we're here to do that. So From
But
there,
sorry, if in the sort of transition period,
That's right.
if they have contacted you, their card doesn't cease immediately if they didn't want it to cease immediately, does it?
no. So if people contact us, we'll arrange for their card to be ceased. But if they contact us, if they don't contact us, we will be doing continuous outbound contacts to them. Even as far as our remote servicing teams will be having lists of customers in their communities who haven't engaged with us, and this will be, flexible and real time, so that they often can find people, and they will be going through lists and trying to engage with people to support them through when they're out on their community visits. So I guess in a nutshell, what we're really doing is front-loading the support from the very beginning, and we do expect that we will, through those channels, contact most people, or they will contact the agency. As we move closer to December, we will be closely monitoring numbers of people, of course, who are still left on the card, and working through different strategies, which again will be flexible depending on who these people are and where they are, but using all the networks that we've got on the ground across government and with service providers to have contact made with these people, and to have them contact our agency. And what we've done is we're putting in place sort of a warm handoff process where there's no wrong door in a community, and once a participant is identified, they'll be put in touch with the agency while they're there, if absolutely possible, so that we can support them at that time. So it will be very much an upfront supported process, but we have to remain agile and flexible as we move forward, and working with individual communities as well, to make sure that the whatever strategy we're putting in place at that particular time, it works for that community as well.
Senator, I'll just add to Ms Toe's testimony there that those workshops have commenced with community to discuss that approach and just get local intel about what works best in each place, where they might see certain pressures or difficulties in locating participants, or whether it's community by community approach as well. So again, test this approach with those affected communities, and that might result in some nuance. And that includes some of those service delivery partners like your money management folk or your financial counsellors. So they're well aware about the transitional process as well.
And what happens, despite all of your best efforts in reaching out, that some people fall through the cracks and they haven't contacted you and you haven't managed to contact them? What happens then at the closure date?
So the participant will be exited off the card, but I think the point too is that the support doesn't stop though. We will still be, maintaining a high level of communications around to participants to please contact the agency if you need support with this. And I think what we're expecting is that people who don't contact us, maybe, hopefully we will have captured them through this quite detailed plan we've got, and the warm transfer process through to the agency. So I think that should really help.
Okay, and I suppose the proof is going to be in the pudding as to how many people end up in that situation. I want to go to items 2 to 28 in the bill, which, as I read them, the core effect is to enable people to move, the minister to move people from the cashless debit card onto the basics card. That's correct?
It provides a provision for the minister to denote a class of people to move, yes, from cashless debit card to basics card. Yeah.
Right. And with this, do you know whether, with this ministerial decision, would this be a disallowable instrument?
Yes.
Yes.
And so it enables it, but does it does it require it, particularly in the Northern Territory, does it require the Minister to do this in the Northern Territory?
No, it enables it.
Okay, so do you have any, can you clarify for me what the situation is in both circumstances? If it, let's say the Minister says, okay, we've got this legislation that enables it, what then happens? Let's go through that scenario.
So in that scenario, people in the Northern Territory on the CDC who would otherwise be subject to income management will be transferred back to income management.
And would they be given any choice to not be transferred? Would there be a process to ask them whether they want to be transferred or not?
So this instrument operates as a class of people. So no, it doesn't involve an individual choice process. I think Minister Rishworth has previously said that reforms to income management are something the government is very keen on and is pursuing, but wishes to first cease the cashless debit card.
Okay, so your expectation is the Minister will be taking up this scenario of using that option to then transfer people who are currently on the cashless debit card in the Northern Territory back to the basics card?
That's a decision for the government, Senator, and so I think it's a question directed to the Minister.
Okay. Okay, let's go through the other scenario then, that the Minister doesn't choose to take up this option of transferring that class of people onto the basics card. What would then happen?
They would cease to be subject to income management in any form.
And are you mapping out scenarios as to manage those, in that scenario, as to what would happen in terms of transitioning them off income management?
So I guess it's not very different to the situation in, say, a place like Ceduna, where most people will be moving from a CDC to no income management arrangement. Same kind of, if that was the process, same kind of supportive exit process would be put in place to help people transition. As you know, many people have been on income management in the Northern Territory for 15 years, so some people are very used to the specific arrangements. So we would have be very much focused on supporting individuals to make that transition.
Are you currently, in terms of the work that you're doing to be managing the transition outside the Northern Territory, are you setting up teams and starting work already in the trial sites? Let's Ceduna, let's use Ceduna, seeing you mentioned it. So what work are you currently doing specific to Ceduna?
So as Mr Burford said, we have already commenced community workshops on how to best support people as they transition out of the cashless debit card. We have embedded a staff member with the Far West Leaders Community References Group to be there as a sort of person they can turn to ask for any information, any data that they wish. And obviously we'll continue to meet very actively with them. But, we are always saying this is subject to passage of legislation and, that is in the hands of the Parliament. But at this, because of the tight timeframes, we essentially are planning and are working with people, and so that, should the legislation pass, we'll be as prepared as we can be.
And have you started doing that was that a departmental initiative, or was it something that the Minister has requested you to do?
The Minister requested it and we supported it so it's something she, from the beginning, has emphasised, that she wants this to be a very supportive transition, and so we have designed it that way. So.
And has the Minister requested you to do any similar work in the Northern Territory?
So yes, we're doing preparatory work in the Northern Territory as well, preparing for kind of consultations, noting that, as you've reflected, there's a couple of pathways that could occur in the Northern Territory. So the nature of the response might need to be adaptive to the different pathways.
Right. Could you talk us through exactly what work you are doing in the Northern Territory? What's planned?
So as Ms Toes said, there's an implementation plan being finalised, which involves a whole series of community visits by Services Australia remote servicing teams, staff from my area in the department, and staff from NIAA, along with service providers in those communities, with a view to community meetings, community workshops to discuss and familiarise people with the, the pending changes.
And when are those meetings and that outreach beginning?
We're still working through the schedule, as I understand it. There's been some consultations in the NT. The Minister had consultations last week, but at the community level, I think we're still working through the detailed planning.
Senator, yeah, we were hoping in very early September, and that's gathering in together stakeholders from land councils, service providers, Northern Territory government, local councils and the like as well, and the money support hubs and those financial literacy and counselling services we fund. Some are also state funded, but bring them together. So planning's underway for those, but we're still to bed down exact dates.
Mm-hmm. And would it be your expectation that you would have had confirmation from the Minister that she is going to use the provision to be able to transfer the whole class of people onto the cashless debit card before that consultation process and that outreach process begins?
I mean, that would be a logical assumption, yes.
Yes, it's a logical assumption. Is it your assumption? Has the Minister, or have you, had that confirmed by the Minister that that would be the case?
So it's not for me to announce the decision of the Minister, Senator. That's something the Minister will need to advise, but obviously we'd be seeking to provide communities with as much certainty as possible, as soon as possible.
Yes, and that certainly if you had those consultation processes, it would be rather confusing if you didn't know what you were consulting over as to what the way forward was looking like for those people, wouldn't it?
Yes, you might well say that, yes.
Yes. Okay. Could I take you to, in terms of, so it looks like it's a quite, a very real outcome that people are going to be transferred from the cashless debit card onto the basics card. I'm just interested to know what statistics you've got equivalent to what we were talking through in terms of people requesting to be exited off the basics card. You were quoting the statistics for people exiting off the CDC earlier on. Do you have those statistics?
I'll just check with my colleagues.
What was this?
Exits off the basics card.
No, we do have the statistic, but whether we've got it on us, Senator, that's the...
It's my understanding that the basics card does not have a similar type of arrangements as the CDC. A lot of people are actually on there for a set period of time, for example, 12 months, so they can come in and off. There is one group of, or two groups of people, which would be long-term welfare recipients who would be on for a longer period of time. I would need to confirm, though, if there is an equivalent process for exits.
The figures I've got here are that there's 2,582 people who've been granted an exemption from income management. There's various reasons, as Mr Bonham said, can be because they're full-time apprentices, full-time students, they're meeting parenting requirements, they're on special benefit, they're undertaking regular paid employment, they're on less than 25% of the maximum rate of income support, or their child is participating in improved activity.
Okay, well, if you could get me some statistics, and also those statistics broken down for Indigenous people compared with non-Indigenous people, because we had evidence last week of there seeming to be a big disparity in people getting an exemption if they were much less success in getting an exemption if they were Indigenous compared if they weren't Indigenous.
I do have the data on Indigenous and non-Indigenous. So of that, 2,582, 688 are Indigenous and 1,894 are non-Indigenous.
And what's the proportion of Indigenous to non-Indigenous who are actually on the Basics card?
Overall. Be good
Yeah,
if
well,
we...
I presume your 2,582 is overall.
Yes, we're just trying to locate that. It's approximately 25,000 on the Basics card overall, but do you have that?
No, not the breakdown.
Okay. We don't have the figures all in one spot. I'm sorry, Senator, but we will get that for you.
Okay, my understanding is that the majority of participants on the Basics card are Indigenous because of it.
That's my understanding, is it's a significant majority. But we will get
So
that for
certainly those statistics that you quoted then of only a third as many people who are Indigenous being successful at an exemption would mean, yes, a much less successful rate of being exempted if you're Indigenous compared to the non-Indigenous.
Yes, so the figures I gave you were the exemptions. I don't know that we've got how many people applied, but we will get all that data for you.
Thank you. And so if we do go through a process of the Minister moving the class of people in the Northern Territory back onto the Basics card, are there any proposals or any processes in place for changing to that exemption processes, so it would actually make it easier for people to exit off the Basics card if they wish to?
So, Senator, that would require amendments to the income management provisions in the legislation, changes to the exemptions, I believe. So, again, that would be a matter for Parliament.
Okay, I'm just ticking back through those criteria that you said as to how people could ask to be exempted as to...
I think those categories of people are specified in legislation. I will correct that if I'm wrong, but I believe, yes, I'm hearing that I'm correct, that the exemption pathways for people on income management are in legislation. So it will require an amendment to those.
All right, and so basically you're saying it's a pretty black and white decision as to people have to be able to meet one of those categories if they are to be exempted. There's no overarching category that people can make a case that they don't need to be on income management.
I believe that the categories in some cases are kind of black and white, and some cases people adduce evidence. So I think the ones with parenting requirements, people produce sort of certain evidence that shows their kids are going to school or some other things, and so they are slightly different in type, the exemption category list I read out, but essentially, yeah, they are, there's no overarching exemption process the way there is for CDC.
Okay, thank you. Can I just get some more clarification then? Mr. Bonham, when you began your evidence today, you said that there were 6 termination instruments that were coming into play on the 1st of October. Can you just give me some more details about what they are and what it would mean if they weren't extended?
Certainly, Senator. So the 6 are as I mentioned before, the specified income management territory, Northern Territory. Recognised state or territory, Northern Territory determination. Sorry, Senator.
Can you tell me what that is?
So basically, both of those two cover the territory of the Northern Territory participants. So if they were to lapse on 1 October, the Northern Territory would no longer be covered by income management.
So that's the basics card as well as
the basics card,
CDC.
yes, yep. We have the declared voluntary income management areas of New South Wales, Queensland, South Australia and Victoria. Declared income management area, which is the APY lands in South Australia. Declared child protection states, New South Wales, Queensland, South Australia and Victoria. And vulnerable income management areas specification 2012.
Okay, and the process then of extending those, could they be modified or is it just a case of they have to be extended as they are?
There is the ability for the Minister to remake those determinations and instruments. They are normally just set out the sites which are applicable to income management.
Okay, so it could be possible to extend them from the 1st of October, but to modify some of the measures that are in place, you know, so the way the basics card operates, for example, in the Northern Territory?
I would need to have a look at that. My understanding, we did one back in March, which was for volunteers in WA, and effectively that just set out postcodes where people could volunteer. A lot of the rules in relation to who is eligible, so for example, child protection, vulnerable welfare recipients are set out in the legislation, not the determinations. So we'd obviously need to make sure that that determination was consistent with the legislation.
Okay, if you could take on notice, just giving me, what details you've got about those instruments that would be, those determination instruments that would be really useful. Can I now go to the, we had discussion before about having a voluntary income management tool, and Ms. Hepburn-Webb, you said if we were going to proceed with that, it would probably be a procurement process and going out to tender to have something. Could you just step me through what that process would look like and how long you think that a process like that would take?
So that certainly for the long term, that would be the process, but I might ask Services Australia to speak to that as the technology, as they engage with Indue on the technology for income management.
So, Senator, I'll start off with and might hand to my colleagues for further detail, but essentially Services Australia is responsible for the current contract with Indue for income management. That contract currently expires on the 30th of June next year. We are looking at a range of options in concert with the community consultation. In other words, hearing from community about what they see as important to them in terms of features and functionality. That includes what's currently available on basics, but most importantly, what is currently available as technology on the CDC card as well, and then taking that into consideration about options to the market, which will be a decision for government in the coming period.
And Senator, just a tiny bit on the tail end. This isn't unlike other procurements that we would undertake. The differing factor here is that the end state policy position is still something very much being consulted and engaged upon. So if we were to look at a very simple timeline, that process, including engagement and co-design with community, would help to inform the requirements for us. We would then draft a statement of requirements, enter the market and seek open proposals on what's out there, and that could be banking-like products. It could be something that we haven't come up with yet. It would be sort of for the market to respond and tell us what's now technically available to us and possible. We would then evaluate that against the plans as per the procurement rules and have a look at what is both the best value for money for the Commonwealth but also best meets requirements and manages risk. We would then enter into a negotiation phase with the preferred vendor or tenderer and then get through to agreeing and baselining an arrangement, negotiate pricing and then look to move on transition. It's important to note we would expect that there would be a period of transition moving from any arrangement because it would have to do with our ICT systems interacting with the systems of a new provider and of course making sure there's enough customer and public communication out there so that people understand how they're being affected by such a change.
So what sort of timeline, based on your previous experience of, procuring something like that, would you be expecting that if a decision was made to try and find a new tool, how long would that take?
It's challenging to say, Senator, on the basis of the requirements for such a procurement would very much impact it. If it was something like a stored value card with a bit more functionality, that may be a little bit shorter because we understand that. We've been dealing with that for a lot longer. If it's something directing toward, emergent technology, we would need to do all manner of assessments around things like cyber security and sovereign risk and all of that sort of stuff. So it's sort of a continuum that could go from, if it's a like-for-like replacement, something that you may be able to achieve in a 12-month period. If you're looking at new technology, you might be 18 months, 2 years. It just depends on what comes back from the market.
Okay, thank you. That's really useful. And in your the consultation that you've got proposed about that sort of a voluntary income management tool, are you also then looking at having that tool also potentially being the tool that could be used, say, in Cape York?
So certainly we would want a tool that could support a range of communities to do what they want to do, to establish arrangements and programs that meet their own needs. So yes, that's right.
Right, okay. So for, as per the situation in Cape York, whether it's the Family Responsibilities Commission that say this person needs to be on income management, that this tool would be able to be used for that.
We would certainly aim to have a single tool, yes.
Okay. Look, finally, clearly we know that the government has said that they do want to move to ending income management overall, and this is the first step in getting rid of the cashless debit card. Is there anything you're able to place on the record as to sort of what planning is looking to the next stage, or is it purely just a matter for government at this stage?
I think it's really a question for the Minister at this stage, Senator.
Okay, so there's nothing that you have been asked to sort of start stepping out beyond the consultation you're doing about the transition to more broadly the transition off income management altogether?
We have started some early thinking because, as you said, that is the government's announced position. So we have started early thinking about what that transition could look like, but no decisions have been made, and so on timing, etc. So I can't really say any more about that.
Okay. Thank you. Thank you very much for your evidence today. Thank you, Chair.
Senator, could I just close the loop on a couple of questions we were going to try to get your answers on? We've got a couple.
Yes, that'd be
still
great.
owe you a couple more, but in terms of First Nations people on the income management program, 82% of the 24,825 participants are First Nations people, and comparatively 50% of the 17,322 cashless debit card participants are First Nation people. That's of 27th May data. Senator Smith, Chair, you asked also about some totals on CDC for exits and exemptions. So the exits totaled to 666 and the exemptions added to 253. And noting, Senator, that's not all the questions that we were going to get back to you on, and we're still waiting for that data.
Great. Thank you. Thanks very much. Thanks, Chair.
Thank you. Look, I don't have any indication from other senators of further questions. So I will thank you all for taking your time to provide evidence to the committee today. We are now going to suspend for a break. We'll be returning at 3:30 Eastern Time, which is 3 o'clock Central Time. Committee suspends.
Thank you.
Before we move to our next witness, I just wanted to check Senators Rice and Askew if you were comfortable for us to table the letter received by the Department of Social Services, which was discussed in the last block of evidence.
Most definitely.
That's fine.
Okay, excellent. We'll now welcome via teleconference Ms. Rhonda Evans. Thank you for appearing before the committee today. I'd like to invite you to make a brief opening statement, should you wish to do so, and then we'll be moving to questions from senators.
Thank you very much. My name is Rhonda Evans. I'm the CEO of Judamal Aboriginal Corporation, operating in Gulagoo country at Coolgardie, 32 kilometres west of the city of Kalgoorlie-Boulder. The cashless debit card was imposed on the community of Coolgardie, despite low incidence of antisocial behaviour, nil if any street drinking or other reasons given for its introduction. We believe the card was supported for Coolgardie to ensure that the town would not be flooded with people moving from Kalgoorlie-Boulder and other towns to avoid being subject to the card. Since the implementation of the card, little has changed for the members of Judamal who are participants in the trial. We continue to have high Indigenous unemployment, low per capita income, and minimal, erratic and duplicated support services that do not meet the needs of this community. With the introduction of this bill, it appears that those on the card must follow an opt-out process. Why should people who did not opt in have to opt out? The reason for my presentation today is not to debate the pros and cons of the card, but to request that the exit be simple. We have the capacity to ensure smooth transition from the card. Let us be involved. Before you legislate and implement new income management programs, please consult. We at Judamal call on you to provide meaningful support services defined by the participants, to talk to small communities, and to show some kindness to those involved in the trial, but more importantly, to show some respect. Thank you.
Thank you. I'm going to go to Senator Rice and Friend.
Thank you. Yes, my cat Trieste loves a Zoom conference, a WebEx conference. Thank you, Ms. Evans, and yes, for your evidence about how the cashless debit card was imposed upon your community. Could you talk us through what the impacts of having the cashless debit card imposed upon your community have been?
The main impact was a feeling of separation from the rest of the community. Coolgardie had always been a fairly cohesive community, and for the most part it still is. But those that were treated differently, the unemployed who were treated differently from the employed, created a certain amount of resentment within the community. As I said, it's a fairly small law-abiding community, and many matters could be handled by ourselves. We realise that we're in a region where there are issues, but we've got to question the imposition of such a wide-ranging process on everybody rather than on those who need it.
And you also said in your opening statement that your community is characterised by high unemployment, low income and poor services. And I mean, you just acknowledged that there are issues in your community. what would the community like to see take place rather than the imposition of some blanket income management?
We would like to see the fact that the community, while only 32 kilometres from Kalgoorlie, is isolated and is different from other towns in the region. For instance, many people live at Coolgardie because there has been housing. At the moment, it's limited, as it is everywhere else. Lots of people don't have cars, so they don't have transport. So it doesn't really matter whether it's 32 kilometres or 320 kilometres away. We have a once-a-week bus service that goes into Cal at 9 a.m. on a Thursday and comes out from Cal at 4:30 or 3:30 on the same day.
That's extraordinary. Once a week.
But we also have the local Aboriginal medical service coming 1 day a week, and it's a Thursday. And we find that many services come to town without checking with the locals. Their time is scheduled, and we constantly get from service providers that nobody turns up. There's usually a reason nobody turns up, because nobody's asked us about it in the first place.
Yes, if you haven't been asked, it's very difficult to get there. So, I mean, given we know that the cashless debit card, if this legislation goes through, is going to cease. We've just heard from the Department of Social Security and Services Australia that they're going to be having a process of engagement with people to be talking through what people's options are. You mentioned in your statement how you really want them to talk to you. Could you map out for us what you'd like to see that process of engagement look like?
Well, okay, for the first thing, we would like to see that the exit application form, I think it's SS526, be abolished. This is the form that you need to complete to opt out of the cashless debit card. And this requires that copies of documents with details of bank, building society, credit union account balances and transactions for the past 3 months be provided. This sort of bureaucratic nonsense that sends us into a spin. Practically everybody that's on the card has a MyGov account. And on the MyGov account, there is an option for, I'm just trying to see what it's called, because I'm on pension and I've got it as well. So you can have a look at where your payments are going. So why can't it simply be a case, well, I say simply, nothing's ever simple, but why can't the MyGov option that is already there be used for people to check where they have regular payments going out, to adjust them as required? The Indue card doesn't need to be disappeared overnight. What needs to disappear is the restrictions on that Indue card, and then give people the opportunity and the time to adjust where they want their payments coming from.
So could you expand on that? So you'd be happy for people to keep the Indue card, but to have all of, so one option would be to have all of your payments paid onto that?
No, what I would like is that the MyGov account, the section in the MyGov account where you point your payments, so if you want to change from one bank account to another, be used for people to set up their payments for their rent, etc., and then be used for them to make the decision on whether they continue using their Indue card for any reason, but to get rid of the 80-20, or to eventually get rid of that 80-20 spread, but also to take the restrictions off the Indue card, which means they can't use it for online shopping and etc.
Right, so basically one potential way would be to allow people to keep that Indue card and still have some payments coming out of it, but without the restriction.
Yeah, the Indue card has some definite technological advances. It's fabulous that if you lose your Indue card, you can get a replacement really quickly. I think it takes about 2 weeks here and you need a trip to the bank to get it. The Indue card has the option so that you can block and unblock your card at a moment's notice, which means that if you live in a household where somebody keeps nicking your card, if you've got it blocked, they can't use it. So it's the technology that is the advantage of the Indue card. And that means that people have the choice. And hopefully people using the Indue card then wouldn't be discriminated against just by the look that the lady at the shop gives you. Or if you go to Perth, nobody's seen it before. And sometimes you have to wait a couple of hours before they get the idea and can accept it.
Can you tell me more about sort of the look that the lady at the shop gives you?
People are human, and there are still an element of people out in the community who resent somebody who looks able-bodied from getting employment benefits, particularly in a region where we have lots of jobs going. What's not recognised by a lot of people is that if you haven't got a job, 99% of the time there's a reason why you haven't got a job, and it's, number one, it's none of their business. But number two, there are cultural and personal restrictions on the way some people work, and that's not accepted by a lot of people who are employed.
Thank you. Look, just finally, I mean, I asked you before, and I'm really keen to sort of you to expand on it, about the services, I mean, that you'd like to see in place in Coolgardie as part of this, you know, transitioning away from income management. Sort of a lot of people have given us evidence of the need to have, you know, much better community support services. I mean, you mentioned the lack of transport, which I find astounding. But what are some of the other key things that the people of Coolgardie would really like to see improved in terms of what services that they're getting?
Certainly transport is the biggest, and in keeping with everybody around, I presume around the country, housing services. But also we would like to see, and I'll give you an example, that the child protection services only work within office hours. It's not, the neglect of children is not something that happens from 9 to 5. It's very difficult to get support or some form of adjudication when you have a situation out in Coolgardie. The police, I've got to say, are absolutely magnificent, but child protection is not their role, and the police have to roster it out from Kalgoorlie, so you're waiting for the 35 minutes that it takes them to get here. So apart from transport, housing, and a lot of domestic violence is caused by overcrowding and etc. Services, mental health services and counselling services have come to our community, but when the service changes staff, we usually lose that service for about 6 weeks while the staff are replaced. The lack of constant lack of continuity of services in the community means that people are less likely to use them. They also need to be provided in a comfortable space. And as much as I never used to understand it and now do, a lot of people aren't comfortable in a shire-owned building. They tend to be very rigid and unwelcoming spaces. So what we also need is community spaces that are not seen by the community to be council space.
Fair enough. Thank you, Ms Evans. It's been really useful for us. Thanks, Chair.
Thank you, Senator Rice. Ms Evans, can I ask, to what extent was your community consulted before being placed on the CDC trial?
I can only give you anecdotal evidence, and that was almost not at all. Some of our elders were involved in groups that went to Canberra to discuss problems in the region. So to that end, there was discussions about, how to fix these solutions, but how to fix these problems in the region. But I was in Menzies at the time, and there was almost no consultation with local people until the point when the Senate hearing occurred in Kalgoorlie, which was, I think, October 2017, was it? August 2017.
Okay. And Ms Evans, in your evidence, you expressed concern around the process that participants have previously had to undertaken to exit the card in terms of providing significant amounts of personal data and the such like. I note under this legislation, those requirements would no longer be there. So those requirements are replaced with a single phone call with Services Australia. I was just wondering if you could talk to me about the experience of CDC participants that you may be aware of who'd gone through that process previously, and why you believe it's been so detrimental.
The form required information that most people don't have ready access to or feel intimidated at having to produce it. At no time on this CDC card was there a requirement of proof from somebody else to suggest that you needed to be on this card. It was just, well, you're unemployed, or you meet these criteria, or you have a disability support, and so you need to have the card. And that form just perpetuates that. Prove to us, and there's nothing in there that says prove to us that you don't need the card. It was just provide us all this information. If you had children, it was a real nightmare.
And do you think that acted as a detriment or stopped people being able to exit the card when they should have?
Oh, absolutely. After the first, I suppose the first 6 months that we looked at that card, I don't think anybody that I know in Coolgardie even attempted.
Mm. So did you, Ms Evans, have concern? So that process falls away under this legislation, is replaced by a phone call with Services Australia, not to go through that information, but just to discuss transfer of financial arrangements or commitments. Do you have a concern with that new process, or was your concern more to do with the previous requirement to provide that personal information and that burden of proof being on a participant?
Okay. With reference to the new process, in Coolgardie, I'm just trying to think, we only have about 80 members of the community on the card. And so when people become aware that they can make a telephone call, they can come down to the Judamal Gallery, where we can give them wireless access and telephone access. They can make the call. They could also go into Centrelink, or I'm sure the Shire would provide facilities. But it still means that people who, very shy retiring people, have to actually go and put themselves out there. And very often when somebody comes in and makes a call, the person at the other end can't understand them. I don't know how many times when speaking to government departments, I've had to sit there and translate for somebody who speaks perfectly good English, but because of the distortion that you get on telephones somehow or other makes them difficult to understand. We would really like to be able to have the option, if you can't make the telephone call, to get onto your MyGov account and do it through that. People log onto their MyGov account every fortnight to update income, etc. So they are comfortable with that. It's an app that's on their phone that's easy for them to use and they've been using for a long time.
Thank you. That's useful information for the committee and the government to know, I believe. Ms. Evans, you also mentioned at the start of your testimony that there were low instances of antisocial behaviour in your community before it was put on the trial. Just wonder if you're aware of why your community was placed on the trial. Were you made aware of any evidence supporting that decision, or just can you reflect on?
No, as I said, I was at Menzies at the time, right?
Okay.
Hello, I was in Menzies at the time, and it was really a regional decision, what was best for the region. As you probably know, only half of Menzies Shire is on the card. The Junjun community chose not to go on the card. And so we had this split at the time, but the implementation of the card trial was seen very much as a regional approach as opposed to a town-by-town approach.
Okay. Look, I think in Senator Rice's questions, you answered my other questions around support services and local engagement. I'll just check that Senators Askew and Nampijinpa Price didn't have any further questions.
Thank you.
No, I'm fine. Mine have been covered, thanks.
Okay.
I'm fine, thank you.
Okay, excellent. Well, in that case, Ms. Evans, unless you had any parting thoughts to leave us with, thank you for your evidence.
It's Senator Pratt. I should have flagged. I just wanted to say thank you to Ms. Evans. I didn't need to ask any questions because her evidence was so excellent. But as a WA Senator, I thought it was important to let her know that I'd heard her evidence today.
Thank you very much.
Thank
Okay,
you.
well, thank you, Ms. Evans. We appreciate your participation.
Thank you.
I believe we're now in a position to welcome via teleconference our next witnesses. Joining us, we have Ms. Beverly Whaley and Mr. Justin Fenwick. Thank you for appearing before the committee today. I'd just like to remind you to please speak clearly into your device and identify yourself each time you speak. This assists with the broadcast and recording of these proceedings. I'd like to invite you to make an opening statement, should you wish to do so, and then we'll be moving to questions from committee members.
Hello?
Yes, it's the chair here.
Oh, yes. Hi, everyone. It's Bev Wally, Kununurra, although I'm currently in Perth at the moment to take this call and our conversations via the conference. I'll just give a bit of debriefing. We are referring to the cashless debit card. Yes, we are. Is that correct?
Yes, this inquiry is into the legislation surrounding the cashless debit card.
Okay. I will give you debriefing in myself when this first came about 6 years ago. I am still behind supporting those who are basically, requesting to opt out. We're in a 6-year process. So I'm prepared to ask any questions as to how it's been prior to the beginning, prior to now.
Excellent. Thanks, Ms. Whaley. Mr. Fenwick, did you have an opening statement you wish to make?
Yes, I do. And good afternoon. I thank the committee for hearing from me and the invitation to appear. First and foremost, I acknowledge the traditional custodians on the lands of which we're all meeting on today. I'm coming to you from Quandamooka country on Kanipa Island, known formerly as Russell Island today. I've been an employee of Services Australia and was an employee in the early days of the rollout at the CDC. I was also a foster carer for 5 years in Alice Springs, and I can see both sides of the argument that is presented, but I see the integral role that the CDC plays in the makeup of the welfare system, in my view, especially when it comes to stigma and shame. I'm also very wary of the, kind of ability that the card has to provide a bit of a safety net, if you like, to mob who might be impacted in family and domestic violence situations. And it goes across Australia as well. We know that income management isn't just, isolated to Aboriginal and Torres Strait Islander people. However, unfortunately, for whatever reason, it seems to be that we are, the main distributors of income management. So I can see both sides of the fence, and I think, if we do go down this road of repealing, it's very concerning. It raises a number of questions, around the responsibility that the government then has to provide support for family and domestic violence victims, of how we could easily get them out of a placement if they should identify in that situation. And then also, what next for income management as well? I'm happy to answer any questions.
So thank you for your evidence. I'm going to just offer the call first to Senator Askew or Nampijinpa Price if they have questions.
It's Wendy Askew. I wouldn't mind just following up on that with Mr. Fenwick. Just on that, you sort of mentioned that you were, as part of the rollout, you were a Services Australia employee during that rollout. Which part of the country was it when that rollout was happening that you were there?
It was Alice Springs, so it was in the really early days when it was kind of being pitched to Services Australia that it was coming, and that the trial may eventually come into Alice Springs. I did leave before it actually rolled out in the Northern Territory into a trial site, but it was very early days in kind of how to, I guess, sell it, if you like, to clients who might present.
So was that the Basics card initially, or was it the cashless debit card?
It was the cashless debit card.
So it was only in the last 4 or 5 years. Okay.
Yeah.
And you also mentioned that you can see both sides of the argument. So have you witnessed any sort of improvement in the areas that you have seen it in action in regard to domestic violence and alcohol-fuelled activities?
Yeah, absolutely. I think you need to look to the evidence that was provided in the report to Senator Ruston, around Ceduna and the other trial sites, the original trial sites, where it has actually provided some level of, I don't want to say normality, but it's provided some level of order in some of those areas. I'm talking Ceduna, Kalgoorlie and Cape York. You need to look at, I guess, those types of areas where it has seen some improvements in some of the areas that I'm talking about, that it's, actually working as it's meant to. And I guess I've got a few kind of, I want to say ideas, but a few kind of points that I think, it comes down to, especially from working in Services Australia, I think it comes down to looking at, the kind of ways in that the CDC might look in the future. If the legislation's not repealed, I don't think it needs to be, all kind of driven into one direction. It kind of makes up the welfare system, if you like.
Okay, so at the moment, it looks like the cashless, as part of this legislation, the cashless debit card would be repealed. And for example, in the Northern Territory, those people will be moved back onto the Basics card. You would probably have seen the difference between the two types of cards. What would your thoughts be about that?
Absolutely. So one of the big things that I saw when people came to me at the service centre in Alice Springs, the biggest question around the Basics card for people travelling interstate was, where can I use it? Obviously, there's a list of merchants, but not everybody is a merchant, and you have to become a merchant or apply to Services Australia, and it's quite a lengthy process to become a merchant of the Basics card. Whereas the CDC, you can use it as a normal bank card. right? It's run by TCU. It's a normal bank card that you and I would use with CommBank or one of the major big banks. You can use it very easily and accessibly. And I guess that's the biggest thing, and that's the kind of main point for me, is that it's the accessibility to services across Australia, from groceries to household furniture. You get the variety with the CDC that you don't get with the Basics card. It's a very convoluted system to go into Centrelink, go through Centrepay if you want to make a booking for travel, for example. So if I'm in a DD situation with the CDC, I could take it to my local welfare agency who might be looking after me, like a social worker, for example. I use the example of WASCA in Alice Springs, the Women's Safety Services in Alice Springs. I could take it in to the women's shelter. I might be seeking refuge and I might say, look, I need to get out of this situation. I've got family in Sydney who I can go and stay with. Can you help me get to Sydney? They can help you if you don't use the internet, or if English is not your first language. Then someone can help you book an escape plan, as I kind of mentioned in my statement.
Okay. So if your advice to the committee, if we were looking at the fact that, okay, this is likely to happen, the cashless debit card's going to go to disappear, what would your advice be in regarding to replacing the technology that we're going to be looking at? Because the Basics card is the alternate at this stage. Is there something that we could be looking at differently, or even using the background basic technology behind the similar card to the cashless debit card or other bank products?
Look, I think, using the technology that has been established by the CDC, if the government is to go down this road, then using the technology behind the CDC to provide that accessibility measure to the Basics card would be, a really good option. However, I think it should be for some people. So if you're identified by your social worker, so say I go to my women's shelter and my kind of case manager, if you like, identifies me as a vulnerable person who might benefit from this, that person needs to have a direct link into Services Australia, into the local branch, to be able to flag that in the system to say this person would benefit from this for this reason. So then you're identifying people and not, kind of rolling it out across everybody and blanketing everybody with the CDC or the Basics card or whatever it looks like. You're giving that option to those who actually need to escape certain situations.
Yeah, I appreciate that. Thank you. Thanks for your evidence and your time. I'll hand over, I think, Senator Price.
Yep, Senator Nampijinpa Price.
Thanks.
Thank you. Thank you very much for your evidence. I just had a question for Justin. How, in going forward, there has been conversation around there's certainly been organisations that have been suggested abolishing income management altogether, and not just stopping at the Basics card. Stopping income management in compulsory format altogether, which could possibly leave a gap. Can I just get your thoughts on how you think that if there was a possible gap between coming up with a new idea for income management and bringing to an end all forms of income management, how that might impact certainly those that you're aware of in the region that you serviced?
So, look, I think if income management was to be abolished across the board, that's a very big, issue for people who haven't had free access to money because of government institutions. As Aboriginal people, we are governed by government institutions. So we need to, really consider the impacts to those people who are in vulnerable situations, who, might, for example, if I'm not, for whatever reason, on income management and I happen to be in somewhere like Papunya or Kintore, and my money is going directly into my bank account, then there is, and we know from anecdotal evidence, from hearing from organisations, that there is active, I want to say, fraud going on within these communities to take money from, say, old people or from those who aren't on income management for whatever reason. So I think if we are to kind of get rid of income management, we need to look at the real world implications that's already going on with income management on, communities where money might be, getting distributed kind of in the background, if that makes sense. I think there's two things, though, Senator, if I can. There's two things that need to happen, and that's that I think income management in general needs to have a parliamentary review. There needs to be a review into the effectiveness. If there are organisations calling for its abolition, there needs to be a review into the effectiveness of income management for the pros and the cons, and then actively immersing yourselves as senators into those communities where income management is a massive part of their life, so in the remote communities, particularly in the Northern Territory, and actually having conversations on the ground with people that if we were to abolish this, how would it affect you?
Thank you. Can you also tell me about your experience as a foster parent and I guess how you see income management impact that area as well?
Absolutely. So throughout the time as a foster parent for the two young children that we were caring for at the time were placed back with family, there was a level of, I want to say, DV that was going on behind the scenes still, that was happening, that wasn't being picked up on until, it was picked up by the mother putting herself into the local women's shelter. And I think also on top of that, there was this level of control from the father figure who, or at the time, her partner, who was actively taking her basics card. Because remember, the basics card doesn't, have an active kind of service that you can track suspicious transactions, if you like. And he was actively using that in day-to-day life. So he was going and spending her money, knew her PIN, and was actively going about doing that. If she had been on the CDC, she could have called up the bank and changed the PIN very easily. With the basics card, you either have to go into the service centre and change the PIN, or you go to a machine, swipe the card and change your PIN. There's no way of actively securing yourself financially so that your partner, who might be abusing you financially as well as physically, goes and spends your money. We knew that was actively happening, and she would actively and openly tell us that, this person has come and he's taken my card and I don't have any money. And so we were in the situation where when they were with us, we were having to then help the family out and help her out to live week to week because her money had been expended. Whereas if she had been on the CDC, that would have been flagged with, the bank that, hey, this person's taken my card, I'd like to change the PIN. And if he'd already made transactions or she had already made transactions, that could have been traced and trapped. And, actual prosecution could have happened because that's fraudulent activity.
So in your opinion, do you find the cashless debit card a superior technology to the basics card in supporting vulnerable people?
Absolutely. I think that's a fair statement.
And one last question. I just wanted to ask that there has been a push by organisations that sorry, just got to get my thoughts. There has been a push by organisations that welfare income management, well, it's been suggested that it's failed. However, there is still a push that people should be able to have the opportunity to opt in to make it optional. And would you suggest, it's a concern to me, knowing the DV situations and the pressures of culture on a lot of women, Indigenous women surviving DV, that a mechanism might be able to be put in place. If income management was voluntary, a mechanism might be able to be put in place so that those vulnerable women might be placed on income management. Instead of it being an option to them, it's sort of, I guess, in a way, they're put onto it because they're in a DV situation, would be better than allowing it to entirely be voluntary so that they are protected from pressure to remove themselves from the card, I guess is what I'm saying. There have been suggestions. I think there's a framework in Cape York where the community itself intervenes and understands the circumstances of individuals within family groups, and so then places people on income management in a sort of intervention way to ensure that those vulnerable people are taken care of. Given your experience, would you suggest that a mechanism such as this should exist if it were to go to voluntary income management?
Absolutely. I think if the government does go down that road of voluntary, opting in, opting out, then that is definitely a consideration they should make. If it's from an agency, for example, like I mentioned, the Women's Safety Service, if they flagged that one of their clients was, experiencing financial mistreatment as well, they could flag that, and it could literally be a, income management kind of sweep through that person's life, and that, I think, would save a lot of people. It would also give people an out as well. If you've got a technology behind the scenes like the CDC, it also means that you've got the ability to provide service providers like these agencies, like the women's shelters of the countries. It provides them with the ability to help vulnerable people, escape family and domestic violence. And it kind of gets us right there at the beginning of it, if not, in the early stages when someone presents to a women's shelter because they don't know what else to do, and it's seen as a safe place for people to kind of escape domestic violence. And if they actively have people interstate, then the technology that the CDC has behind it can help do that. And I think, having that mechanism in place, like the kind of mechanism that you described in Cape York, that kind of opt-in and that voluntary putting people on a system to kind of, help alleviate the mandating, if that's a concern of people's, then I think that's a great way, because you're identifying people who actually need help and assistance to get out of situations that are extremely damaging and traumatising.
Thank you. That's all from me. Thanks.
Thank you, Senator Rice.
Thank you. Look, I just had one question. In fact, Senator Juniper Price just covered most of it, because I wanted to ask Justin what your view was about voluntary income management, and given your experience, and given that there are people that have been compulsorily placed on income management who we've had a lot of evidence that's done a lot of harm to them, whether you feel that a system of a tailored product that actually has got the advantages of the cashless debit card vis-a-vis the basics card in a system of voluntary income management would overall be the way to go.
Look, I think there is evidence out there, very anecdotally, to suggest that, and I don't think we've done enough research into the basics card at all, to suggest that, it's been harmful. I think it's also been very useful. A lot of the older people who came into the service centre, and I'm talking like, 80 to 85 or 70 to 85, who came into the service centre, some of them had upwards of 100 grand saved in the bank, and on their basics card, like ready to go. So I think in some situations it's actually worked as intended, for people to have the ability to almost not be welfare dependent because they've saved money because it's been quarantined in such a way. I think the quarantine measure also needs to be looked at, and so I guess kind of looking at the parliamentary review kind of aspect into the effectiveness of income management is something that I would push for. I think that income management works in certain situations, and look, it's not a one-size-fits-all approach. I guess the kind of takeaway that I would also put out there is that a lot of the people who came in and said, I don't want to be on income management, were white. So a lot of the people who said to me at the service centre, oh, but income management is just for Aboriginal people. These were the people who were actively helping Aboriginal mobs. So they might be volunteering for organisations within the town. I'm not going to name those organisations, but these people were actively involved in the background in helping Aboriginal people. And yet, when they were placed onto a form of income management or into a kind of box that they felt they weren't defined by, they were very vocal about standing up and saying, this doesn't suit me because of the colour of my skin. Unfortunately, income management affects everybody who is in a locality, whether you're white, whether you're black, whether you're brindle, you're affected by it. And
I mean, to me, that just shows the structural racism that's been involved. Hello, yes.
Hello. Can I speak on behalf of the East Kimberley region, Trial region, Kununurra?
Yes.
Yeah, we've had, what I've noticed in the past, we've had issues. People have left the area to live in Perth. They're still having issues where they can't use their card in Perth. Okay? And basically, from seeing it from the word go when it started up until now, my opinion, which I've noticed, it's unfair to the community people if they are going to be consulted now in regards to no CDC. That's it. They won out. And I think it's unfair that if they were given that opinion now to view their points when they were given that 4 or 5 years ago. So what I'm basically saying, the cashless debit card has deteriorated the quality of life. We have the mobs who do not want to go to seek help, do not want to go to mental health, because it's a shame factor. We've had a lot of people like the NT with different languages that come into Kununurra, which has been really hard. We've had a lot of people who do not know technology, who do not own a mobile phone. And, there's been a lot of frustration, anger, domestic violence, kids not going to school, youth crime has always been. Parents drinking, drugs, gambling. That has always been prior to the cashless card being enforced 2015-16. Having said that, there is no change. Everything is still the same. My opinion is they've started off with nothing being put on this card. If it comes off, they're still going to have nothing. So how are we going to correct the stability of their life today and their next generation in having a life, those that are having children, young girls having children now. So for us to put something in place, a plan, I don't think that's going to work. Because
what would you like to see, Ms. Wally?
Beg your pardon?
So what would you like to see happen?
Well, if we were going to abolish the card, if that was going to happen after all the submissions being put through, after and understanding and explaining to the mobs in Kununurra the process and how the government works, because some of them don't quite fully understand. Look, we have some well-educated people. We have a lot that's that's been supported. So my point of view, if they opted off the card, if the government decides to abolish as it was promised, what changes are there going to be? There's going to be no changes. We're going to have alcohol restrictions, which is still in the mix at the moment, banning only going to be having mid-strength drinks. You know what I mean? Having said that, a plan to be put in place is not going to work, in my point of view. We're 6 years down the track. Basically, nothing has changed. Let the mob live the life that they want to live. They choose to spend the money how they want to spend, but then we can have more statistics with DCP, the police, the hospital, and what have you. Well, that has all been happening prior to the CDC in 2015-16. I can't see any much change if they get off the card.
So what changes in terms of social support and other services would you like to see in place that would make a difference?
Well, actually, you know, I myself, I've encouraged a lot of them, and you know, even wanted to go with them to see certain support services, you know, as stakeholders, what have you. But they decline to do that. They tell me straight outly why I want to do that, why they put us on this card. And the biggest issue we've had, like, sorry, I forgot your name. You spoke really well there, and all your true facts. When the husbands come out of prison, that's been our big major default in the Kimberleys as well, is because the wife doesn't have any money left in the card, you know, and that's been pretty traumatic. So we're having more statistics in TV, but we've always had this before the card came along. If something was to be put in place, and if there's organisations there that are supportive, which I know of two, that are basically behind this, is that who's going to come forward? Who's going to help and support this? The mobs just want to get off the card straight out.
Yeah. Thanks, Ms. Wally. Thanks, Chair.
Thank you. Senator Pratt.
Thank you very much, Chair. May I ask you, Ms. Wally, Kununurra is a really diverse community. What is working well, and what are the strong things about culture and community there that should be recognised by government in order to be more supportive in situations like this where we're ending the cashless debit card?
Well, this is the thing, a misunderstanding. No one fully understands the government's rules or government law. Now, if government's going to come forward and say, right, we're going to do this, right, this is what's happening, and technically speaking, you need to speak to the ground truth people.
Yes,
You're not
yes.
not supposed to go by he said, she said, or go to certain people prioritising, seem to be the pick of the bunch always, to speak on behalf of these people, which is totally wrong.
So can I ask in that context, are you able to give us a list of the kind of the people that government does need to speak to locally in the East Kimberley?
I believe it to be the elders.
Yeah, yeah.
We have the elders.
And in that sense, that's when we look to the strengths of the East Kimberley, there are lots of very strong elders who it's good to empower them to have some oversight over these issues so that they can have input into them.
That's correct. So, and this should have happened.
And by elders, you mean, you know, it's hard for government just to have a list of elders. Where do we go to and find? Clearly, you've got to know a community well, but some of them would be in the native title bodies. But who else are we talking about here, and how do we bring them together to talk to them?
You've got different organisations there, which should, like, you got the Warringah Language Centre, you got the Warringah Arts Centre.
Yeah.
I'm the chairperson of the Audible Aboriginal Health Services. Perhaps you can touch base with them. I can't think of the others now. There is quite a few. You've got not only elders,
there
but then you've got
are indeed. So, but it's very much those grassroots organisations that have strong cultural authority and activity at a very local level, where you've got cultural elders leading that community work.
That's right. And then you've got others in the next generation who have a total good voice, who will sometimes speak on behalf of the next generation down. So we do have some good
and so when I asked about the strengths of the region in the East Kimberley culturally, you would find those strengths in those organisations as well, wouldn't you?
Absolutely, absolutely. The ground truth people should be the ones that should be notified and spoken to about. This all should have been happening a long time ago. Because if we're going to correct it now, we're not going to correct it.
Well, just to highlight to you, Ms. Wally, clearly you're not a supporter of the cashless debit card, and we announced our policy just at the election, and now we're consulting in order to implement it, and we agree that we need to consult and take our time in order to do that, with the card due to end by the end of this year.
Yeah, I understand that, but that's to get a better view or to hear from those. Give them let them have their voice to the panel or whoever is concerned. Should they confront or speak with them? We need to listen
Can I
to
ask
them.
you, Ms. Wally, do you know of the banks? If you're not, other than the cashless debit card, when people have their own private bank account, which of course people do as well in addition to the card, who do they bank with and why, and what kind of service do they get? Is it any good?
Well, as everyone always make a joke of, Australia Aboriginals' leading bank is the Commonwealth Bank. I have found that we have got some clients that are ANZ, which is a big one because ANZ Bank is based in Derby.
Yeah, so they've actually got a branch,
Sometimes it's difficult for them. I am pretty certain that they go to the post office, Kununurra. We have Bank West in Kununurra. We have NAB in Kununurra.
Okay, so do you think government should be consulting with the banks as well to make sure that this is a streamlined process, so that if banks see particular issues happening for customers as well, they can also help let government know?
Well, that's been big issues. They've had transactions in the past. They had money taken out. When they went to check their account the night before, they go the next day, there's no money there. There's been a lot of issues
the kind of thing
past.
we need to stop from happening. Absolutely.
There's been a lot of that issues in the but now they have all the merchants where people can go. From the start up to about 4 years ago, it was so traumatic. It was terrible.
So one of the things we will need to do is make sure that people don't suffer a financial penalty because they want to check their bank balance, which at an ATM. Would that be correct?
They go online. They can't check it at ATM, as far as I understand.
Yes. No, that's right. But if you were to go in with the cashless debit card ending and going back to an ordinary bank account, we need to make sure that people know to continue to do that online so they don't lose money by trying to check it at an ATM.
Yeah, exactly. That's correct. Because I haven't heard anything since, but at the start off, it was untold fees were taken out, shopping centres. I've helped a couple of old people at the shopping centre in Brisbane, only the big Coles shopping centre, who didn't understand, who spoke a language, a little bit of English. And, that was just terrible. And then, explaining it to non-Indigenous people.
Yeah. Can I ask who is most effective at supporting people in your community where English might be their fourth or fifth language? And, they're very clever people that speak lots of languages.
I know.
But none of them are particularly connected to Australian bureaucracy or banking or whatever. What's the best way of getting the support and translation for people? Clearly you need people who can speak that language. Where are they and who do they work for, and how do we make sure we're resourcing them in this process?
The Warrangarri Aboriginal, the Warrangarri Language Centre.
Yeah.
They're the ones that teaching Aboriginal language. They do have interpreters there that can speak to the mob. up there. Also, we get people coming in, families coming in from Port Keats who speak how many languages? Who have connections in Kununurra anyway. So the Aboriginal Language Centre be the one place to connect to. And I know the interpreters there that can assist and that will help for them to understand.
And do they currently have arrangements in place? Is that language centre currently connected to Centrelink to do work for them or not really?
Well, actually, as we speak, they did have someone employed there at the Centrelink. I'm not sure if he's still there. We have got someone based at Kununurra Hospital, but that's because health reasons.
Yeah.
But I haven't heard any more since, it might have been last year.
Yes.
And well-respected leader in the community.
Yeah.
So I'm not
I
sure
would
if
be
he's still
keen to
there.
know. I'm keen to know who would have the skills and capacity in language to be able to do that work. But I can take that up with you.
Am I allowed to give a name?
Yes.
Can I give a name or not?
Yes, you can.
His name's David Newry.
Yeah.
He has got Aboriginal name as Julima, but to the...
No, that's terrific.
Not Indigenous world, it's David Newry, but the Aboriginal way, he's got a Aboriginal name which is called Julima. So to make contact to the Wangari Language Centre, you will have to ask to speak to a David Newry.
That's fantastic. Thank you so much, Ms. Wally. Your evidence has been really helpful to me.
Yeah, he's the top leader in the Kimberleys. Because you've got other leaders, but, you know, they're all slowly passing away. But, yeah, that's where we're at.
Thank you.
Yeah.
Ms. Whaley, Mr. Fenwick, thank you very much for your evidence today and for participating in the committee's processes. We appreciate it.
Thank you.
I'd now like to welcome via teleconference Ms. Christine Donaldson, Ms. Sylvia Asuza and Ms. Marion Skeen. Can I just confirm we have each of the three witnesses online? If you could just identify yourself by name, please.
Yeah, I'm here, Sylvia Asuza.
Yes, I'm here, Christine Donaldson.
We have Ms. Skeen on the line. Okay. Hopefully we can get Ms. Skeen soon. I'd like to thank you both for appearing before the committee today. As you're participating via teleconference, could I ask you to please speak clearly into your device and identify yourself each time you speak to assist with the recording and broadcast of these proceedings. I'd like to invite you to make a brief opening statement should you wish to do so, and after that I'll be inviting committee members to ask you questions.
What happened then? I did.
Oh, hey, some people want to go, then I don't get on text back. Sylvia, do you want me to go first?
Yeah, if you like, go, Chris. Or did you want me to go first? It's up to you, Christine.
I don't know.
I'll take it away.
All right, no worries, Sylvia.
Okay, so I'm Sylvia from obviously Kalgoorlie. I'm a card participant in the region. I've been a card participant for the entirety of the trial in Kalgoorlie. I'm also I'm a single parent. I'm a carer. I'm a payment nominee. I'm also a admin on the No Cashless Card page in the Kalgoorlie. So I've seen and heard quite a lot about the card and people's stories. Myself, it's caused up to $12,000 damage with financial debt I now have. My family has gone through many problems trying to pay rents, car payments, and then there's just the effect on the community. There was no community consultation. As far as any sort of community consultation, I did attend a meeting towards the very start before they rolled the card out, and it was through GIFSA organisation. And it wasn't a consultation. It was telling us how this card was going to play out in our lives. And to that meeting, it was a lot of lies. We were told that as a payment nominee for the people we were caring for, that they wouldn't be affected. So there's a huge portion of the community that's really angry and feels lied to. And just as in fact, the community just feels like there's certain issues in Kalgoorlie that the community was dealing with when the card was introduced. And I believe that was taken and used as a bit of, the card was used as a bit of a beating stick. And it really divided the community. There's been so much going wrong with it. It's really, it just really poorly affected people's lives. Thing.
Thank you. I'm not sure if we've got our third witness on the phone, or if anyone else would like to make an opening statement.
Yes, it's Christine Donaldson here. First of all, I pay respect to the traditional custodians of the land we are meeting on today, the Ngunnawal people. And I also want to say thank you for the invitation to attend the Senate inquiry on the subject of the cashless debit card repeal. I am an elder of the Wongatha Ngadu people in the Goldfields region of Western Australia, and I fully support the amendment bill and agree that the card needs to be abolished. I was forced onto this card because I lived in the trial region. I had to give up my employment because I had to be a carer for my partner, unknown to me that I was going to be put on the injury card. This card is a tool against my people because we are labelled and judged. It controls our financial management. It removes our people's independence and responsibilities. There was no consultation with the targeted peoples, and I'm saying us Aboriginals. There was no information services, no optional input to say, it's good or bad, or we want it or we don't. The card has increased crime, racism, elder abuse, alcohol and drug abuse, self-harming, just to name a few. I feel stripped of my rights, and I feel like that we're going back to ration days and being controlled to say how we can spend our money. Personally, I haven't been able to buy at markets and Facebook, buy and sell, because I'm used to having cash. I've been to Woolies and had declined transactions, make me feel shame. I can't give my grandchildren money for birthdays, chores, rewards. Rent gets debited from Inju, but Inju failed to pay the arrears, pay the rent, so you end up getting a letter from the housing to say you're $800 in arrears. The kangaroo, we Aboriginal people like to buy kangaroo meat and tails. We haven't got access to cars and bullets and what have you. So the only shop that was selling and that was fresh kangaroo meat and tails, they only accepted cash. And then the butcher shop, they took it on and, probably competition. They sell frozen tail, but it costs $30 for one tail. That's the minimum. The cadging, the humbugging, begging, that hasn't stopped. People, they go talk about it on Facebook, social media, saying they're still happening. I thought the cashless card was supposed to decrease these things. Stop the people buying grog and wasting their money, being able to buy food, but there's still hunger and poverty out there. The homelessness has increased. People are forever losing their Inju card, then they've got to go and get another one, and, it's just on and on. It's a well-known fact that the Shire people, when they know that any dignitaries are coming, they take our blackfellas and transport them back to homelands, just to show that we don't have any problems with homelessness or drunks, etc. And so they'll arrange transport for our people to go back to their homelands. These people don't want to stay here. they want to go home to their homes too. So, you know, where's that service today? The card has not prevented people from getting drunk, even though this was the primary goal of rolling out the card. It is destroying Aboriginal people. And not only them, it's also disadvantaged whites. Not everyone is a drunk, druggie or gambler, whether you are Aboriginal or non-Aboriginal, but you get put in this category. If you're on injury, you have problems. People have put comments on the social media in relation to Leonora and Laverton shires. So I contacted those people, and this is from their areas. The community members have told me that all the people in Aboriginal in Laverton, they want to stay on the card. I have a family member who lived there for over 16 years. They told me that there's over 20 households have said they don't want this card. So there was no consultation between the Shire and the community at all. And they were told that when they hear of a meeting, the Aboriginal people hear of a meeting, they'll walk into that meeting. There's only Kiwis and non-Aboriginal sitting at the table, and when the Blackfella walk in, the meeting's closed. So, you know, they're sitting around talking about Aboriginal people's problems and thinking that they can solve them. There was a petition at the shop for people to sign to keep the Inju card, but only high society people signed this. So, there wasn't many people signing that card. This is in the Laverton Shire. It hasn't improved the behaviours because, sadly, Laverton is a dying community because, you know, there's no services about, and there's no opportunities for employment at the shops or whatever. So they just drink and, you know, One of the guys told me that he had saved money on the Inju card, and he wanted to buy a car, but he couldn't buy it because the money was on Inju. So he had to get permission from Inju, and that would have taken, you know, a mountain of paperwork and trying to get permission to spend his money. He said he missed the opportunity anyway, because you can't transfer $3,000 overnight. So the couple who lived in the town have witnessed the destruction of what the card has done to the local community people. And it affects black and white people. So that was the Laverton people were telling me about. In the Leonora mob, there's no consultations, only by the member of parliament. They go up there to visit, and only service providers are invited. There's no grassroots people, and that seemed to be a common problem, that when people come to town, they don't get to speak to the real people that have the experiences. Since the Inju has come to Leonora, the crime has increased, the elder abuse is happening more, drugs are still there, alcohol, people are constantly drunk all hours of the day. No. Hello? Sorry?
Please continue. I think we may have had our third witness join, Ms. Skeen. Is that correct?
No, I'm actually Louise swapping phones. But I'm still here.
All right. So
good to still have you, Senator Pack. Apologies, Ms. Donaldson. If you'd like to finish your statement, and then we'll go to questions.
All right. And the big shop there, it sells supposed to sell. It sells all the goods and that, but most of the time all the meat is smelly. So the other option is to go to the local pub to buy a meal, but the Inju rejects the card because it sells alcohol. So they can't buy, you know, a meal out, even though they don't drink. So the people are saying that they want consultations with the local people in the town, not service providers, because when they go home, when the service providers go home, that's when the events start to happen. And it's after hours, not during office hours. They would like to have the CDP reintroduced and no income management to be forced onto members. So, yeah. The other thing is to have a person in the area to advocate for individual people who have English as their second language or intimidated by bureaucracy people, and so that's my opening statement.
Thank you, Ms. Donaldson. I appreciate both of those opening statements. I've got some questions from Senator Pratt.
Thank you very much, Chair. Can I ask, please, thank you both for your evidence today. What has the card meant in terms of a kind of them and us attitude in the communities that you live in? You've both touched on that. That can't be a very healthy dynamic in the local community.
SSR speaking here. So obviously I speak more, I guess, my communications has been, I guess, a lot greater with people with disabilities because I'm a carer myself. And there's a huge divide. Like the minute you pull the card out, it's like telling everyone how much money you've got. I mean, you might as well just give them a roundabout figure because they're going to calculate if you're on a carer's payment. They don't care. You're just on a payment and you're put into a class. I mean, I remember one interaction, I think it was in the first year the card rolled out, and there was questions on a public forum about the local fair that was coming to town. And I believe a card participant asked if there was going to be FPOS facilities available so that they could, their family could participate. And so many of the comments were, well, you shouldn't be going to a fair. You shouldn't be doing that. Countless times I've got onto a community page and had to defend families or someone getting on there just for asking a simple question. Like you're immediately called a dole bludger. It's just an immediate giveaway. And there is no place to ask your private questions. We were given these cards. I mean, in Kalgoorlie, for example, we weren't even given an in-due office that hung around for more than a year. Up until last Monday, I attended a meeting at the Jobs Hub, which is absolutely a great initiative for the town. But it shouldn't be just about injury. Injury is irrelevant. It's done nothing. But programs like the Job Hub, they have improved the community, and they will. I walked in there and I saw a young girl smiling ear to ear because she's got a licence. That is what the community needs, and not a division, basically.
Yes, I totally agree with that, Sylvia. We feel the same way with our Aboriginal community, that it's them and us, and it's the labelling and the judgment that is detrimental to us. It disempowers us.
Can I ask, in Laverton, other than the CDC, who do people bank with, and are they, what access to good banking services do you have, or is that something that needs to be improved?
I don't think that there's a bank there at all. They just used, there's probably an ATM in the pub, so Inju wouldn't be able to be used in there. That wasn't a concern in relation to, having banking issues. It was mainly the CDC being forced upon them without consultation.
And how might we in Kalgoorlie use the Jobs Hub positively to help people and provide advice if they're having banking issues in coming off the card? Is that a good
sorry, this is Sylvia speaking again. I don't think that's what the Job Hub entails. I think it's more about trying to get people connected to work and the ability to get to work. But even so, at the moment, there's so much misinformation going around town, even to this day, a young, Centrelink, they're telling people, because we have no Inju office, people are being told that the Jobs Hub can sort out their problems that they're having with Inju. So there isn't a place. There isn't a place to necessarily, even, so there, like I said, there's just so many lack of facilities, and I mean that's exactly why I joined No Cashless Card and wanted to help as an admin, because it was the only place I could get information. It was the only place who was willing to listen, and the only place who directed you to help. And like I said, and it's had nothing to do with the government. There's just people, Amanda and Catherine, who cared enough to educate people on just how to deal with this system that was dumped on us.
Yes, and can I add to that? I know that our Aboriginal people are very diverse. So we have the homeless ones, we have people who are upstanding citizens, and so there's, a range of people. Now, you can't tell me that, one guy off the street going to go into the Job Hub and ask for help. No way. It needs to be culturally appropriate with someone that they know and trust. Sometimes they don't even go to Bega Medical Service because there's a stigma that if they go in there, I'm just thinking in relation to pregnancies and, little things that other people don't take, that other people take for granted. Mental health and stuff like that. They know
so
that.
Who are the trusted services or cultural groups that government needs to look to and resource to work with us on this?
Well, the starting place would be a hospital that they have the sad thing about it is people get in there and feather their own nests and forget about the little blackfellow in the bush that's sitting back in the cab. Whereas, we did have a lovely lady who used to be working at the hospital. She could speak language, and she used to visit the outskirts of Kalgoorlie-Boulder daily to find out who was sick and whatever, So
where was she from?
She's from Kalgoorlie. But she's
did she work for someone, or was she volunteering, or?
No, she used to work at the hospital.
Right. So she was part of the hospital outreach. So that's really about connecting state services into those supports.
Yes,
the federal government's talking to as well.
Sorry, if you put notices up in medical centres and shopping centres and stuff like that, or even Kalgoorlie Miner, to say that you are wanting a meeting, word of mouth spreads.
Thank you.
Thank you. Senator Rice.
Thanks, Chair. And look, thank you very much, Ms Donaldson and Ms Azizar, for your evidence. It's been really important evidence for us to hear. Ms Donaldson, I'm really disturbed by the evidence that you've given about basically the government not running a fair process in terms of evaluation of the benefits of or the problems of the cashless debit card. We heard from the Kalgoorlie-Boulder Council last week, who were claiming that there had been a decrease in crime. And when I asked them what evidence they had of that, they were quoting a survey that was done by the Chamber of Commerce. Would you like to just respond to that, given that your evidence is, in fact, there's been an increase in crime? You said an increase in crime and racism and elder abuse and alcohol and drug abuse.
Yes, I'll respond. In my views, what I've witnessed is people can't get cash for their, habits, so they will do crime to get their drink, get their drug, whatever. You know what I mean?
Yeah.
Yeah. So
this is Sylvia. Could I add a bit to that? I know the question was directed to Christine.
Yes,
but
no.
The claims from the City of Kalgoorlie-Boulder. Look, when the card was even rolled out, we heard all sorts of fantastic stories about how there was this massive reduction in crime in Kalgoorlie. What I think what people failed to understand was at that same time they rolled out mounted police, they rolled out a new street patrol, they rolled out police buses in the main streets of both Boulder and Kalgoorlie that moved around efficiently. The police presence was huge. And then, like I said, and then there's been, like I said, it's all, smoke and mirrors. Underneath it, there's been a reduction in crime because people have got sick of reporting it. That's what it boils down to. You ask most members of the community, they're so tired. The only reduction has been the fact that they're sick of calling.
And there's vigilante groups out there that want to come and run over our kids and, those sort of things that are happening. And of course, the survey would have been taken by upper class citizens, not the grassroots people that it affects.
Did you know anything about this survey from the Chamber of Commerce that claimed that things had improved dramatically and that it was going to be a disaster if the cashless debit card was scrapped?
No, I didn't. I didn't know that survey was out and about. But they don't ask the right people. That's the problem.
Yes. Been made aware of a survey either. And I'm closely to follow most of the cashless card related things, and I haven't been made aware of a survey.
Yes, I mean, I asked in their submission, the council said that, this was their perception that, things had improved and crime had decreased and that people had told them this. But when I asked them whether they had done any surveys themselves, they hadn't, and it was all just based upon this Chamber of Commerce survey that they didn't have the details from. They're going to give us the details. Ms. Donaldson, the other thing I was really concerned about and to hear in your what you told us before was where you said that where the Shire knows diggers are coming, they transport people back to their homelands. Can you give us more details about that?
Yes, I can. I was actually working at Bega, that's our Aboriginal Health Services in Kalgoorlie. Excuse me. And there was a notice and lots of meetings being held because we were getting, I think it might have been Rick Wilson or somebody, it wouldn't have been Rick Wilson, sorry, it would have been somebody from the Liberal government coming to visit Kalgoorlie. So they had a service provider that's connected to the police rally around to all the service provider or all the Aboriginal agency to get all our people together, find out where they were hanging out to get them back to either Warburton or Junjunjara. That's our two outlying communities that visit us here in Kalgoorlie-Boulder. And it also happened when it was COVID. So we know that what the Shire did was to put on a show to say we don't have an Aboriginal problem, but it's there because the system has failed them.
This is Sylvia speaking again. It's quite what Christine is saying is quite a well-known fact in our community. We've all seen it being done. Any time a Prime Minister visits, it suddenly becomes this magical place to live. It's really crazy.
And so they basically provide transport and encourage people to travel away from Kalgoorlie before these visits.
Yes. And, like our people are on a revolving door. They come to Kalgoorlie-Boulder for funerals or medical reasons, and the poor buggers get, they end up getting stuck because there's no transport back home. PATS won't pay them back home to get on the plane, even though they come down by PATS. They won't pay them to go back home because it's too costly, but we know that the Shire can provide transport back to our people's homelands. They don't want to be here. They want to go home.
Yes, so they'd like to go home, but it's only when it suits the Shire that that transport's provided to remove them from town.
Absolutely.
Look, my final question.
Sorry, I'd just like to add to that is part of the reason why they say that there's been a reduction in crime, because every time that they want to make it look great, it's convenient to ship them out. But yet, I really don't understand, just as a basic human right, even for the people who live through Menzies, Laverton, Leonora, out to Ginninderra and Warburton, why isn't there a regular bus service for these people to obtain medical services and clothing and food, and just even to be able to connect with banking services and any help? How are these people supposed to get to town if there isn't at least a regular service for them for transport? It just doesn't make sense. And then we in town complain that there's an antisocial problem and they're hanging around the streets. Well, of course they are. There is no way for them to get home. So, yeah.
Sounds sensible to me. Look, finally, I know we're about to wrap, but Ms. Donaldson, you also mentioned evidence of when Aboriginal people sort of entering meetings, when they're discussing Aboriginal people, that then the meetings were closed. Have you got any more details about that? Because that's also a really disturbing thing for us to learn about.
Yes, and this one here happens in Laverton. I'm not aware of the ones in Kalgoorlie because only, but I'll go back to the Laverton one first. The people who told me about that, they are well-respected citizens in the town. And when they hear of a meeting, so, and it's mostly held at the Aboriginal Corporation or the art gallery, or it's a well-known place for Aboriginal people to go and have a yarn about things, CDP and stuff like that. But when they walk in, the person will just shut the book and say meeting closed. Oh, we just closed the meeting finished, and it's just not on.
Absolutely.
And in Kalgoorlie, we've got.
Can you just give me the details? I mean, what type of meetings are we talking about?
They didn't explain that to me, but I'm assuming that it would be about the antisocial behaviour and the domestic violence and the crime, all the things that just only happen to Aboriginal people. Only Aboriginal people do it.
Look, if you had any further information just with the details of that, I think that would be would be good to get that information, because that, again, in terms of what people are saying, the problem is, and the potential solutions, and with abolishing the cashless debit card and the problems with evaluating it, having that evidence would be really valuable if you're able to get it to the committee.
Yes, I'll certainly ring the family up. And who do I send it to?
We could be the Secretariat can be in touch with you to give you an email address to send it to.
Awesome. And I just want to add to this, all my years within within my work history, we have always made the CEOs, and because we Aboriginal liaison officers, and our skills and our language skills, everything like that, make everybody feel good, that they end up being, that they take all the glory. We don't want the glory. We want our people to be helped.
Yeah. Thanks very much. Thanks, Ms. Donaldson and Ms. Azizar. Thanks, Chair.
Senator Nakajima-Price.
Okay, bye.
Thank you. I just wanted some clarification around, was brought up earlier about the debt, the problem with debt, and I just want a bit of clarification around how that eventuates. Is it around, whether it's around direct debits being set up with accounts, and if money is not there for that direct debit to be taken, and how that might be affected, whether it's through just a regular bank account with welfare in that account, or through the CDC system.
With the rent, it gets paid to Inju, who then have the link with Department of Housing. So it's the Inju and housing setup.
Yeah, this is Sylvia speaking again. I'm not sure about Christine, but myself, I mean, the reason I've faced the debt that I'm in now is simply just not being able to access money that was available to me to buy a car. And then Inju was always sort of suggesting, well, then you can go to Money 3, that, you might be able to get a loan to get a car. Or if you can't buy something through Inju, because they won't release cash, so if you wanted to buy a cheap fridge, they're directing you to Afterpay, they're directing you to Zip Pay instead of releasing funds that are already available. So then it's not so much about, well, basically you're getting into finance. You can't afford to pay back in the first place. Basically, you're living above your means because you can't access cash that's in your account. So, I mean, that's how the debts are accumulating. And even to try and fix the problem is, it's a matter of swapping accounts basically and paying the same way you'd be trying to chip away at it with Inju, I guess.
Okay, so it's accessing sort of things like Afterpay, multiple sort of things like that, pay to purchase things and pay later. Along those sorts of lines, is that the reasoning behind the debt? Yeah, but I know I've heard from a lot of other people, it's about not being able to pay their rent and not actually being aware that their rent's not being paid. And so, I mean, there's a lot of different ways to get into trouble on this Inju system. Like I said, I've heard people, weren't having their car insurance paid, so they were driving around uninsured cars, and they weren't made aware until it had relapsed, and they rang up and you're not even insured. So, I mean, and then you've obviously got your fees that accumulate if you're missing payments. So, I mean, a lot of it is there's a lot of different ways to get debt with Inju. Okay, if there was better sort of education, understanding, and those sorts of services alongside, would that have been more helpful, do you think?
Ability that being able to access money that was, is sitting in our accounts, but we couldn't touch it to buy something off Facebook cheaply. And then you go through the embarrassing process of applying, and you're told no. And you said, well, you sort of say to people on Inju, well, how am I supposed to keep, food cold in my fridge for my children? And they turn around and say, well, you've got the option of Afterpay. Here's your quick fix. It's like, you're dangling a carrot in front of desperate people and then going, oh, oops, you've got into debt. It's when you're desperate, you'll do what you can to provide for your family. And this is just pushing people to that edge. So it needs to go. Before it causes further damage.
Sorry, just to clarify, was that advice provided by Inju to access things like Afterpay?
It has, yes. It's quite a known fact that, yes, a lot of people have been told to access access Afterpay or Zip Pays. And like myself, but even trying to get a car, it was told, well, you could, we don't really want to release this money. And the process to even get a large sum released was ridiculous. I mean, they want the owner to provide registration papers for a car you haven't purchased yet. So, the requirements to release that cash were impossible. So therefore, you're sort of left in a situation like I was with no car and 4 children, a child with a disability who just had a cochlear implant, and you're left going, well, I need a car. So this, that's my only option at this point, if you know what I mean. So, so it's not something I would have done if I'd had access to a cheaper car, that I could afford within my means. So, yeah, it's really, it doesn't give you a choice anymore. It takes away your choice.
Okay, thanks for that.
Senator Nampijinpa-Price, was that your last question?
Yes, it was. Thank you.
Excellent. Okay. I'd like to thank the witnesses for appearing today and providing evidence. We appreciate the time you've taken to support the committee's work.
Thank you.
Bye.
Bye.
I'd just like to check if we've got our next witnesses online from the Australian Red Cross. Yes. Excellent. Thank you. I welcome Mr. Kwong and Ms. Holland. Thank you for appearing before the committee today. I'd like to invite you to make a brief opening statement if you wish to do so, and then we'll move to questions from senators.
Thank you, Senator Smith, and thank you for the time to the committee. I'm coming to you from Ngunnawal country here in Canberra. I'm joined by my colleague Kate Holland, who is the Manager of Community and Justice and Place-Based Programs in South Australia. I might make a few brief remarks and then hand over to my colleague Kate to speak more specifically with respect to Red Cross's experience, particularly in Ceduna. As many of the committee members may know, Red Cross is a network of around 25,000 members and volunteers, as well as staff across Australia. We are very proud to be both the front line and what we would describe as the heartline in terms of supporting people during, after, and certainly throughout disaster and crises. We support migrants in transition and very proudly and continue to learn to walk alongside First Nations communities and those we support in the Asia Pacific. We are part of a global humanitarian movement of 192 national societies and established under a Royal Charter here in Australia, which places us in a unique position where Australian Red Cross is neither an NGO or actually part of government, but what we do under the Royal Charter is act to provide additional and supplementary help and support alongside public authorities in the provision of humanitarian services. From this sort of larger landscape, where in particular with respect to Ceduna, is one of nine place-based programs that Australian Red Cross delivers across Australia. We've been in Ceduna in the far west of South Australia since 2012, and very proudly been part of the backbone and strategic support for the delivery of the Red Cross Ceduna Community Hub, which I understand, Senator Smith, you are quite familiar with, and certainly we would welcome any committee members who would like to learn more about Red Cross's work there. That'd be very much invited to do so. Over this 10-year period, we've had around 80,000 or over 80,000 client presentations since our inception in Ceduna. And in that respect, would like to share some of these insights that may be relevant to the committee's consideration today. So on that note, I might hand over to my colleague, Kate.
Can everybody hear me? Excellent.
Yes.
Thanks, Chris. I'd like to begin today by acknowledging the lands from which I speak to you today, which is the lands of the Kaurna people, and pay my respects to elders past, present and emerging. I'd also like to extend my respect to Aboriginal and Torres Strait Islander people who are in the room today. I would like to thank Senator Smith, who's visited our hubs in the past and seen the work that we do in community, and appreciate the time you've given us today to make our presentation. The full document from which I'm speaking today, we are going to submit via the link you've given us, which will give you statistics and full case studies, which I'm briefly going to cover today in my presentation. Red Cross has become a trusted and respected member of the service network in Ceduna since 2012, which is evidenced through annually increasing client presentations and strengthening collaborations with our key partners. We understand that communities are impacted by multiple and complex issues, and that requires a long-term commitment and sensitivity to local conditions and culture. The Red Cross Community Hub in Ceduna plays a really important role in supporting community members who are CDC recipients. A key funding source for the hub over the last 18 months has been the Strong and Resilient Communities activity, cashless debit card, which has provided us funds through till the end of the financial year in 2023. And this funding has been put in place to seek to strengthen local support services and to connect cashless debit card participants and other members of the community to employment or pathways to employment. Our hub supports clients who need assistance with Indue banking issues on a daily basis. Approximately 3 to 10 clients require assistance on a daily basis, and approximately 10 to 20 use our digital access, so our computers and Wi-Fi, etc., to access Indue banking. One case study I would like to bring to your attention is that of a gentleman 61 years of age who comes from the Kaniba community. He recently had throat cancer surgery and now has a tracheotomy fitted, therefore had no voice and very low written literacy skills to communicate. He had no ID, no access to either of his bank accounts, Westpac and Indue, and had been cut off from Centrelink. The hub provided emergency food relief and worked with the Royal Adelaide Aboriginal Liaison Officer to have information sent to Centrelink for medical exemption and payment reinstatement. The hub worked with him to access his banking as he couldn't manage the identity process because he couldn't speak through the verification process with Indue. So we assisted him with an ID referee and organised that reference to be signed by a community elder to be able to verify that ID. So in support, we worked with Westpac, Indue, connected him to internet banking, organised a new card to be sent out. We tried to set him up with the National Relay Service for future dealings with the bank, which is unsuccessful as he doesn't have access to phone or internet himself personally. He's working with Centrelink, or we're working with Centrelink to have him move from job seeker to a disability payment, as he's currently being denied funds by Centrelink because of his inability to communicate, to report. So a referral to NDIS was very important, but also a referral to the Vulnerable Persons Framework and participating in the Vulnerable Persons Framework workshop to workshop a solution for this client. We also assisted him with setting up a new Indue card supplied by the Ceduna Post Office. He's now living in an assisted living facility. He has his ID. He has EFTPOS cards now for both Westpac and Indue. He has his NDIS support program now working, but he's still working to get off the job seeker program. So that's something we still have to help him resolve. And that's a nutshell of the complexity and the types of issues that often are interlinked when we talk to someone who's on the CDC. We believe that the impacts felt across the Far West community will not just be for those who are currently members or participants of the CDC, and they will be very far-reaching. There is widespread concern within the existing community services and Aboriginal controlled organisations based in Ceduna that there's going to be significant strain on our existing services. Some individuals who had been unable to access family or community members' financial accounts during the cashless debit card program could now reinstate coercive control over family finances. Impacts of this could be realised in the increase of issues such as domestic and family violence, alcohol and drug abuse, and food insecurity. There are also others whose ability to effectively budget their finances could be negatively impacted. They will instead be expected to manage funds without some of the structures that the CDC helped to provide, and this not only affects the individual account holder, but the family and the wider community. Support services such as Red Cross and other support services within the Ceduna community don't have the financial buffer or extra staff to be able to take on a massive influx of need at the moment. Current funding arrangements for Red Cross's community hub in Ceduna will expire at the end of June in 2023. And even with Red Cross committing to place-based investment in an ongoing basis, this is actually not a sustainable model for us beyond the 2022-2023 financial year. We could see rapid increases in transient homelessness, a significant impact on health services due to drug and alcohol use, and associated increases in family and domestic violence, with potential impacts on coexisting health conditions such as diabetes and cardiovascular disease. An extensive range of issues such as these are referenced in the case studies that will be in the document we send through to you. but such an extensive range of issues inform our need for specific services to provide the assistance that's required. So they include mental health services, financial literacy programs, digital literacy, food security, alcohol and other drug harm minimisation and crisis care, family and domestic violence supports, and emergency housing provision. Given that sorry, was that someone talking to me? No? Given that there is some support within the community for the cashless debit card, we support the bill's provision to allow some current recipients to opt into voluntary income management if they choose to. We will continue to work closely with our community partners as the program is repealed after the end of the year, both through our existing programs and through additional new supports if we can attract the appropriate funding. Funding will be necessary not only to continue the existing day-to-day work, but to address the medium and long-term impacts of the removal of the CDC with additional staff and other resources. We at Red Cross recommend the following programs. Firstly, we recommend outreach delivery of our hub services in the remote communities such as Caniba, Oak Valley and Yalata, done in conjunction with our trusted community partners such as Far West Community Partnerships and the Ceduna Aboriginal Corporation. It will ensure that community members don't need to come into Ceduna to access vital services. We secondly recommend the expansion of our existing hub programming to include financial counselling and workshops offering practical skills development, dedicated access to government systems and websites through IT, hardware and service provision on site, digital literacy workshops for practical skills development, food security programs, alcohol harm minimisation and drug harm minimisation workshops, utilising the hub as a culturally safe place to host community health assessments. And this is something that we saw was really important during the vaccination campaign within Ceduna and Far West communities, in that a lot of people were loath to go into health supports, but were comfortable with coming to the community hub to receive their vaccinations. So that's something that we would like to continue to encourage. We also recommend the implementation of the Families Thrive program. We currently run this out of our Port Adelaide Justice Reinvestment Hub here in Adelaide, and it's a very successful program of case management. Due to the ongoing migratory movements of First Nations populations, learnings can be applied from this Justice Reinvestment Hub in Port Adelaide, where we can often see the same individuals or families over time, and this can impact broader communities on both geographical points. The Families Thrive program, which we were proud to show Senator Smith recently, provides individualised and coordinated support to improve capacity and confidence within individuals and families to access information, service and community support where they need to improve the stability and wellbeing of home and families. There are currently very limited in-person financial services in Ceduna. We recommend government advocacy with the financial institutions that exist to see how they can support community members, in particular Bank SA, Westpac and ANZ. And we also recommend a much stronger focus on measurement and evaluation of what happens after December 30th or 31st. In conclusion, we'd like to invite all the members of the committee to visit the Ceduna Community Hub in the future and meet the people who work to provide the support to the people and communities of the Far West region of South Australia, and we look forward to discussing our proposed initiatives in more detail. Thank you for the opportunity to present to you today.
Thank you, Ms Holland. I appreciate your evidence today and also you hosting me previously at the Ceduna Hub. I might kick off with the questions if that's okay with my fellow committee members. This bill seeks to, well, it works within the existing framework where we have the cashless debit card sunsetting at the end of the year, and this bill seeks to enable a staged transition to take place. It does leave the door open for voluntary income management and also for a community-based model of income management. Is that something that you or other community members have given thought to in terms of what you would like to see, or do you support the continuation of broad-based compulsory income management?
Oh, I keep getting feedback. Red Cross supports the community-led programs and community input. We've been talking in great detail with Far West Community Partnerships, Ceduna Aboriginal Corporation, Uniting Communities, Uniting Country, Centrecare, and even the Ceduna Council to talk about how that staged program may look. I suppose at this stage we're looking for a little bit more meat on the bone to understand how that might transition people from one stage to another. About 30% of the people that we speak to are really keen to be involved in a voluntary program. But, you know, whatever program is implemented post-December, we're just interested in ensuring that any negative impacts are confronted as early as possible so that we can offer some sort of solution or alleviate some problems before they even show up.
I guess I'm just curious if that is part of the way of mitigating some of the challenges you speak about. If there's so for instance, in Cape York, there's a system of community-led voluntary income management, which is supported through the Families Responsibilities Commission. This bill leaves the door open for similar models in places like Ceduna. So is that something you think might help to alleviate these challenges, or do you think the CDC needs to be broad-based across all welfare recipients for it to be effective?
I think agency and choice are very important when it comes to Red Cross and our fundamental principles. It's not our place to make any sort of judgment call on what we think should be done. All I would suggest is if community is saying that there is a section of community that wants voluntary income management and a community-led program can be modelled on something that's existing, then I would suggest that we absolutely continue to talk to community about how they might like to see that eventuate. I do, however, worry that that's not going to answer the concerns of the rest of the community who may not be interested in staying on a broad-based income management program.
Because, sorry, could you just expand on that when you say the rest of the community?
Just that if community is saying that they don't want to remain on an income management program, then we need to look at how we support them through capacity development in the areas of digital, financial and food literacy to help support them through their own decision making.
So you're talking there about those individuals who won't choose to opt into income management?
Yes, yes.
And one of the other pieces of feedback we've had come up throughout the process of this inquiry is there's the CDC as a technology which has been applied in a broad-based way, but then there's been a multitude of services wrapped around that card. And with the lack of evidence base in terms of the success of the card, in terms of meeting its stated policy objectives, it's been hard to disaggregate where there's been anecdotal evidence of a positive impact, whether that's attributable to the card or to the wraparound services which have existed alongside it. What's your perspective about that? Is your concern specifically that you think it's really important that this type of technology of income management in a broad-based application is what's made a difference, or do you think it's the services which have been implemented alongside that piece of technology?
If I'm really honest, I don't have the evidence to be able to answer that question, Senator. I'm really sorry. I know that the wraparound services, like in that case study where someone has sat in the hub and we've helped them navigate a system which is very complex, is something that solved their problems rather than a specific card or financial system. So I would suggest that the support services are the area I would always say are going to be more likely to answer a participant's questions rather than a card's benefits or linked programs, because a lot of the time the participants we're seeing within the community hub don't know how to use the card and its benefits anyway, because they're not accessing it through the digital systems that they may need to, or they may not have phone systems. This gentleman, for example, didn't have access to a phone or the internet, so he would never have known what he could have besides his money.
Mm. So do you think if those services were to stay in place and to remain funded, do you think that would be sufficient, or do you have a strong preference towards a particular technology and a broad-based application of the card?
I think I think for me it's two separate issues. I think there's the financial, there's the holding monies in trust for a person, and then there is the support services that are wrapped around that person. What Red Cross is focused on is the support services. And I suppose for us, it's about seeing each individual and their complexity of need on a case-by-case basis, because each case is unique. I think income management, as chosen by an individual, if they choose to enrol in a voluntary management service, then that's fantastic, but I don't think it's going to remove the other social supports that have become so important over the last couple of years.
So this is what I guess I'm trying to understand. So is it the Red Cross's position that you support compulsory income management?
No, it's not the Red Cross's position at all. The Red Cross doesn't take a position on financial management. All we're saying is if community chooses to do voluntary income management, we will support that because it's a community-led initiative.
Okay. It's just important to understand and step it back, because there's been concerns raised by the council around what will happen after the CDC is removed. We've had other testimony which has supported the services as opposed to the technology of the card, noting that the bill leaves the door open for voluntary income management. So for us as a committee, considering our recommendations, it's just important to be clear if the testimony is about specifically the cashless debit card and a support for that technology, A, as a tool of income management, B, as a broad-based compulsory income management for all welfare recipients, or the services and the importance of other conditions or other government interventions which might assist with some of the policy objectives the CDC was trying to address.
I suppose a simple way of explaining it may be that, irrelevant of what the program is, Red Cross is involved in the impacts of whatever program it is you decide to implement, positively or negatively. So the impacts on community and the concerns that they raise accordingly are the gaps that we strive to fill. So if community raises a concern around the card, all we're trying to solve for them are the day-to-day systems navigation problems. It's not a policy question. It's not an opinion. It's simply helping them navigate the system.
So in terms of the bill before us, do you support this bill, or you're not supporting the bill?
I'm not in a position to make a policy judgment like that. It would really stand against the fundamental principles of the Red Cross. But Chris, if you have something to jump in and say about that.
Senator Smith and the committee, if it's of assistance to augment the observations of my colleague, what I'd suggest is that Red Cross's position will be in favour of any solution moving forward which will enable the maximum opportunity to respect different communities and their different needs. So insofar as the bill is concerned, I suppose if it increases the flexibility or our collective ability to be able to engage with community to determine the best outcomes for that particular community and the individuals in it, then from a Red Cross perspective, that would be most desirable and then probably beneficial for people that we're seeking to support moving forward.
Okay, so you support the voluntary application of income management, which this bill seeks to stage. So
we would, yes, Senator Smith, yes, we would support any solution that would enable communities to better determine the solutions that suit their needs.
Okay, but the specific concerns you have aren't so much with the legislation, but around the support services which might be implemented alongside the legislation. Is that a fair assessment?
That's correct. We think it's just as important in terms of beyond the bill itself, is how we continue to work with community because the needs, as demonstrated by some of the case studies that Kate touched on, are quite complex to each individual.
Okay, but you believe adequate service delivery and investment in community is a worthy policy tool to address some of these issues. I'm just, because we're just looking specifically at the cashless debit card as one policy tool, so just trying to make sure I'm clear on your evidence. It's that you'd like to see that investment made alongside this decision.
Correct. It's a holistic approach that we would support, yes.
Okay. And did you have any views in terms of the future of income management? As I said, this bill leaves the door open for voluntary income management. So if individuals choose to participate in a form of income management separate to the specific product, which is the cashless debit card bill, and there's also opportunities for community-based applications of that. Do you have any concerns around the loss of the specific cashless debit card technology as opposed to other technologies like the Basics card or Centrepay or any other form of income management and withholding funds which may be developed?
Just if it's a voluntary program and community has driven how the program should be implemented, then I don't see any reason for us not to support it, because we can also assist with those wraparound supports of things like financial competency, etc.
Okay, so if we had good services and perhaps there was a voluntary income management tool, you wouldn't be concerned if it was specifically the technology of the cashless debit card as opposed to another technology or another form of income management?
I don't think anyone, well, I can't speak for everybody, but I don't think we've really got a specific issue with regards to the technology itself.
Okay. Well, thank you. That's very helpful. Does your written submission go further to the specific service gaps and service investment you would like to see?
Yes, it does.
Excellent. Okay. My only further questions to my other committee members would be to flesh out those services more, but I'm conscious to offer the call around. No one else is seeking the call. I've just checked the WhatsApp group. So if you could just, if there's anything else you wanted to add to that, noting that we will look to the detail in your submission as well.
Absolutely. We'll get that through to you.
Wonderful.
Thank you so much for your time today.
Thank you for your evidence. Although I didn't have any questions, I'm listening hard.
Thank you very much. We appreciate you participating in this process. That concludes today's hearings. I'd like to thank all witnesses who have appeared and Hansard and Broadcasting for their assistance. The committee has agreed that responses to questions on notice should be provided by 24 August 2022. The committee stands adjourned.
Thank you.
Chair.